Sound test 1, 2, 3, 1, 2, 3. Sound test for you too. 1, 2, 3, 1, 2, 3.
I could hear you, Caitlin.
Thank you.
Okay, we'll get started in 1 minute, everyone. Yeah. Okay, morning, everyone. We're going to get started. So good morning. Bonjour tout le monde. We are commencing the Community and Services Committee today for Tuesday, February 28th, 2023. I want to start by acknowledging that Ottawa is located on the unceded territory of the Algonquin Anishinaabe Nation, dont les cultures et les présences enrichissent et les continuent d'enrichir ces terrains. We have a very hefty agenda today. It's going to be a long day, and I do appreciate in advance the attention and the effort that is going to be given by committee members as well as the delegations. We will once again try to flow through the delegations as quickly as possible. And I ask that everyone remain on topic. We are going to be discussing the terms of reference for the committee, which will really set the tone for this committee for the next 4 years, as well as the budget for 2023. As I noted, we do have a long list of delegations. I believe we are closing in on about 45 in total. So I will ask the delegations and committee members try to remain on the topic at hand. I will adhere almost strictly to the 5 minutes. I'll say almost because there might be moments of a bit of reprieve, but I will note that everyone's time is of importance. And so we'll continue to proceed through that. So we've received no regrets to date. And I will ask the committee coordinator to call the roll.
Councillor Brown,
Here.
Councillor Carr,
Here.
Councillor Desroches, Councillor Hill,
Present.
Councillor Kavanagh,
Present.
Councillor King,
Here.
Councillor Lowe,
Here.
Conseillère Plante,
Ici.
Councillor Troster,
Here.
Vice Chair Bradley,
Here.
Chair Dudas.
Present.
You have quorum, Chair.
Thank you very much. We'll move to item number 2, declarations of interest. I understand Councillor King has a declaration.
Thank you, Chair. In accordance with Section 5 and 6 of the Municipal Conflict of Interest Act, I, Councillor Ralston King, declare a potential indirect pecuniary interest on the following portion of the 2023 draft operating and capital budget, as I am on the board of the Rideau Winter Trail of Ottawa, an organization which, via the Winter Trail Alliance, would receive funding from or would potentially receive funding from this budget line item: recreation, cultural and facility services, community recreation, culture and sports programs, community recreation and cultural programs, page 25 of the CSC budget book.
Okay, thank you, Councillor King. So when we get to that item, we'll ask you to recuse yourself from the table. We'll move on to item number 3, confirmation of the minutes. Minutes 3.1, the committee minutes from Thursday, 16th June 2022. Is that carried?
Carried.
And then the minutes from Thursday, the 16th of June 2022. Is that carried?
Carried.
Item number 4, we have the community services terms of reference. We have no motions to date on that item. We do not also have a presentation. Did anybody wish to hold this item? No, seeing none, can this item be carried?
Carried.
Item number 5 is the 2023 draft operating and capital budget. We have quite a number of delegations. We also have a staff presentation and potentially a motion. We do have one motion, potentially another. So I will hold this item. And then I will note that we are under other business. There is an item that I will ask for the committee's consideration of to add as an agenda item. to the committee. I do know that we have a very long committee ahead of us. However, this matter is about physical distancing centers. It is of a timely nature. The ward councillors would like to have some conversation in respect to this and potentially have some motions. So I will ask for the committee to consider this as an item to add to the agenda. Does anyone have any issues adding this item, or can we consider it added? No? Carried? Okay, so we'll keep that one till after the delegations and the budget, and that'll be a matter that we will discuss at that time. So we'll go back to one point we're holding out, right? That's not going, that's coming to committee or council. Yep. Wonderful. Okay, so we'll go back to the item that was held, which is our 2023 draft operating and capital budget for this committee. And I will ask staff to take over, seeing that they have a presentation.
Thank you. Thank you, Chair, and good morning, members of the Community Services Committee. I am pleased to be here today to discuss the Community Services Committee draft budget for 2023. Next slide, please. Next slide. There you go. So today's agenda will be an overview of presentation with myself and my colleagues from Community Services, Public Works, and Recreational and Cultural Services. We'll move into public delegations, take questions from staff, review the overall roadmap, and then recommend the budget to council. Next slide, please. Today's area of review will be the Community and Social Services Department, Recreational, Culture, and Facility Services Department, and within the Public Works Department, the Parks Maintenance Service area. Next slide, please. The overall 2023 draft budget for this committee is $443.3 million, which reflects the overall increase of $2.4 million when compared to 2022. The Community Social Services gross budget is $980 million, with recoveries of $24.8 million, revenues of $708 million, for a net requirement of $247.3 million, or a net overall increase compared to 2022 of $8.4 million. The Recreational Cultural Services budget is a $281.4 gross budget, recoveries of $56.8 million, which are mainly related to facility type costs and program costs allocated to other departments. Revenues of $70.1 million related to user fees for recreational and cultural programs, for a net requirement of $154.5 million. The overall reduction of 7.4 when compared to 2022 is driven by the one-time reversals from 2022 in 23 as it relates to the pandemic impacts experienced in 2022. The overall net requirement for parks is $41.5 million, which reflects a $1.4 million increase compared to 2022, which reflects increases related to cost of living adjustments, benefits, and inflationary pressures. Next slide, please. The overall capital program for this committee is $61.6 million. $47.3 million is for renewal of mainly park-related and facility costs. $10.7 million in growth, mainly for additional parks across the city. $3 million for accessibility, mainly for accessibility for service enhancements, for an overall net requirement of $61.6 for the capital budget for 2023. Next slide, please. The overall funding program for capital reflects $31.3 million or 51% from capital reserves. $8.7 million or 14% is funded through development charges, and $20.5 million or 33% is funded by debt. I will now pass it over to my colleague, Donna. Next slide, please.
Thank you very much, Cyril, and thank you, Madam Chair. I'd like to take an opportunity just to introduce you to the acting interim General Manager, Claire Ferrer, who will be assuming the leadership of this department at the end of the month. So happy to be presenting my last budget at the City of Ottawa. So in budget draft budget 2023, what you'll see are some key investments that allow us to continue our partnership and collaboration with community agencies who are an important part of the delivery of services. This budget proposes a municipal investment of over 51 million directly provided to community agencies and community partners that are critical to our success. You'll see in this budget an investment of an additional 1.3 million for the community funding framework, for bringing that total of that envelope to 28.8 million to more than over 90 community agencies. Included in that $1.3 million is 500,000 investment to provide sustainable funding and resources to Indigenous organizations. In addition, within that 1.3 million is an 800,000 base adjustment that allows us to sustain the 22 agencies that were added to the budget in 2022. In addition, you'll see 365,000 in new base funding to enhance services provided by community agencies in priority areas. And as well, we'll see us sustaining the investment of 2.1 in annual funding to community agencies that was provided through the budget to the Community Safety and Wellbeing Fund. That includes interventions to support racialized youth, prevent gender-based violence against women and girls, and improve community-based access to mental health programs. In addition, you will see a $1.3 million inflationary provision for community agencies across our housing and community agencies and supports in social housing. You'll also see other proposed investments to deliver on Council's commitment to community safety and well-being and to integrate our focus on service delivery model, particularly in priority neighborhoods and responding to communities' emergency needs. This will help us to meet the many needs that are coming as a result of the post-pandemic. You'll see 1.1 million in a one-time funding investment in order to staff the community engagement team that was created through COVID with the Social Service Relief Fund. It's a specialized team on the ground who link clients to city services and linking to our hub-based models of employment in our Catherine Street location. You'll see one new FTE provided to support the coordination of services in these priority neighborhoods. The role of this person will be able to work collaboratively with partners and governing bodies in Byward Market, Lowertown, and Sandy Hill to advance the social service coordination in these neighborhoods and provide additional wraparound supports. You'll see additional non-compensation funding within the community safety and wellbeing budget, which will be allocated towards these initiatives to allow us to do case conferencing and support the integration of services. This also includes providing additional supports to community agencies. Further investments in mental health and well-being are being proposed through ongoing base funding that has been sustained in this budget of $550,000 that allows us to develop a new mental health alternate crisis response system. This budget also makes a commitment to equitable and inclusive services. And you'll see that in the proposed investments in the anti-racism and women and gender equity strategy, as well our efforts to improve Indigenous relations. You'll see an investment of $300,000 to support the implementation of the important anti-racism strategy that was approved in the last term of council and the women and gender equity strategies, and $100,000 towards advancing municipal Indigenous relations. This budget allows us to carry forward Council's commitment to supporting low-income residents with reduced transit costs by maintaining a fare freeze for Equipass and the community bus pass at the 2018 rates. In addition, draft budget 2023 also accommodates for growth in our needs by provincially mandated programs, investments in our services. That includes 37 FTEs in children's services for the implementation of the new Canada-wide early learning and childcare system, and 66.4 FTEs in long-term care, meeting the provincial commitment of funding to the province for 4 hours of care. These new positions will allow us to deliver on these two important programs in long-term, both in long-term care and the childcare system. Next slide. So in addition to the operating, you'll see capital investments in our facilities, which also support the needs of clients. In childcare, you will see $100,000 to upgrade and to add new infrastructure in our childcare centers. Those are things like shaded structures to protect children from extreme heat. You'll see 275,000 in childcare for just life cycle and basic replacement for existing building assets. Things like roof replacements, building restorations, et cetera. And in long-term care, you'll see 100,000 for life cycle replacement, and that's for kitchen refrigeration equipment at Carlton Lodge. And you'll see 1.67 million for life cycle replacement for the existing infrastructure, things like roof, building, restoration, et cetera. And in social services, you'll see 300,000 for life cycle replacement, again, for those assets in social services. In terms of service enhancements and accessibility improvements, in childcare, you'll see 60,000 for the installation of ramps, elevators, power door operators, signage, et cetera. And long-term care, you'll see 100,000 for the same things like installation of ramps, elevators, and power doors and signage, as well as the 60,000 that is in the budget for social services for similar service enhancements. I'll now hand it over to Dan Chenier for his part of the budget.
Thank you, Donna. Bonjour, Madame la Présidente, membres du comité. It's a pleasure to be here this morning, talk about our budget. The Recreation, Culture, and Facilities budget is built this year on really the premise that this will be our first year recovering from pandemic impacts that were felt on our budgets in the last 3 years. There are adjustments to our compensation lines, and I can say in addition to the regular union settlements, for the first time, our budget does include an increase to our summer wages for the summer employees, which I know many of you have been interested in the issue of recruitment and retention. This is going to help us with decompressing the wage schedule for the summer. It also includes almost 500,000 for addressing the new minimum wage that came into effect last October. And so we're very happy to see that. Our fees are generally increasing by an average of 2.5% across the board. And this is generally to keep up with the escalation in the delivery costs for those programs. We are increasing our hand-in-hand program, and this is part of a package that was introduced by the mayor's office. So we will be increasing by 20% our hand-in-hand program, which is our participant subsidy that individuals can qualify for. So this will be increasing from $185 a year to $222 a year, which gives a bit more latitude in terms of the number of services that can be purchased with that. Also this year, as a new item, 10% off all our summer camp registrations, which generally means that that's $20 off a week for a family registering a child into our summer camp program. And I think that'll be a very welcomed addition to our program. In addition, the budget includes $250,000 to offer free and very low cost programming. And we are targeting across the board things like public swimming, free access to public swimming, public skating, drop-in gym programs, those kind of universally accessible programs. And we'll have more details for that as we roll it out. Most of it will start in April and run through till December. And lastly, the treasurer hinted at this in his introduction. Our budget over the last 2 years had seen one-time adjustments to offset both the fact that we were spending less money, and so our expenditures were reduced because our facilities were closed, and our revenues were reduced significantly because, well, we were either closed or running at very low capacities. So this budget takes out those one-time provincial funds and puts back our expenditures and revenues to their former levels. What that means concretely is a $12.8 million increase in expenditures, and some councillors have asked. This shows up often in our compensation lines of why we're increasing compensation so much. It's a one-time adjustment. Likewise, an additional $27.6 million is going into our revenue targets to reflect the fact that for most of our business lines, we are back up and running completely. That's a $4.8 million net impact to our budget related to COVID adjustments. Next slide, please. On the capital side, there is a long list of renewals. Our biggest envelope for renewals, and most of this work is done through our infrastructure services, and the budget book contains the exhaustive list of projects that are planned. But these are the funds that keep our facilities operational, that address the life cycle requirements to keep our facilities going. There is growth funding for 6 new parks, as well as an allocation towards the Alexander Community Center, which is in Councillor Brockington's ward. And then some service enhancements. What you will see there is the major and minor capital. Those are our grants programs for communities, where we do 50-50 cost sharing. So that program is back with an additional $100,000 this year, which is very welcome. And then some accessibility improvements to keep addressing the facility challenges that some of our facilities, especially our older facilities, have. And then lastly, there is under regulatory, that is funding for corporate accommodations, to make sure that as the workforce changes and our office requirements change, that we continue to be able to react to that, to redevelop our internal spaces, mostly in administrative centers, to both comply with legislation, but also to comply with the needs as they continue to emerge. And I'll pass it over to my parks colleagues for that.
Sorry about that. L'entretien des parcs municipaux prévoit un budget préliminaire de
We have a preliminary budget of about $41.1 million. Like we said, we're going to have an adjustment for the cost of living, also for increments and benefit adjustment for 2023. This will be about $500,000. We also have a $285,000 to compensate the increase in costs for materials. This includes fertilizer and chlorine. There will be an increase of $460,000 for the snow removal and lawn maintenance. That's the end of my presentation.
Thank you very much, staff. So we're going to hold questions to staff until after the delegations. And we will also have a roadmap motion, but we're going to hold that until just before we vote on the budget. So I will ask the first delegation to come forward. Katie Burkholder-Harris from the Alliance to End Homelessness. So should we leave? Okay. Welcome, Katie. I know you're old hat at this, you're familiar with it, but we'll be sticking to the 5 minutes. Very much appreciated, and commence whenever you're ready. I'll set the timer this morning. Thank you, Chair, and good morning, everyone. I'm the Executive Director of the Alliance to End Homelessness in Ottawa, and we're an organization that represents over 70 agencies and partners working to end and prevent homelessness in Ottawa. I want to start today with a reminder that homelessness is a solvable issue. We have seen communities across the country and the world reduce homelessness. Waterloo Region has almost eliminated chronic family homelessness. Edmonton, Alberta has reduced by 43%.
London, Ontario has ended chronic veterans homelessness. And of course, the most significant example, Finland has virtually eliminated homelessness and core housing need. Ottawa can do this too, but we need to invest in preventing and ending homelessness as much as we invest in managing it. We spend $30 million a year on emergency shelters because we do not have enough affordable housing for people in our communities. We spend over $15 million a year on families staying in hotels. In contrast, housing almost everyone staying in hotels with rent subsidies would cost about $3 to $4 million a year. Homelessness-related policing costs in Ottawa account for about $25 million every year. In other words, we're already spending the money, but it's not invested in the right places. Ending homelessness means investing in both prevention and rehousing people. Ottawa, as you know, has taken a housing-first approach towards homelessness since 2015. This simply means that a person is provided with safe, affordable housing before resolving other challenges such as mental health issues. Or as one writer stated, when you're drowning, it doesn't help if your rescuer insists that you learn to swim before returning you to shore. Since this approach has been adopted, Ottawa has housed thousands of people, and yet our homelessness numbers barely budge. In fact, Ottawa hit an all-time high of people experiencing homelessness in 2018, 3 years after Housing First was introduced. This is not because Housing First does not work. We have heaps of research that it does, but it requires that people have both housing and the supports necessary to stay in their housing, and that means staff. Community-based agencies and staff support are often the lifeline that keep people from falling back into homelessness. We cannot reduce homelessness if we do not turn off the tap of people becoming homeless in the first place. We can house as many people as we want, but if we never stop folks from becoming homeless, we will not get ahead. Community-based agencies are the places that can help to stop the flow of people entering homelessness. Agencies and supports that provide food, clothing, counseling, income support, eviction prevention services, and more are often the only thing between a person staying housed and becoming homeless. And these agencies are hurting. In a survey to our member agencies, the three most critical needs that were identified were funding for new staff, funding to keep existing staff, and funding for nonprofit housing. At the last Planning and Affordable Housing Committee, I asked for an increase in the capital budget for nonprofit housing in Ottawa. I continue to urge this council to double the capital budget for affordable nonprofit housing to $30 million to demonstrate the level of urgency needed to tackle this crisis. And today, I ask you to invest on the other side of the system, the prevention of homelessness. The majority of people who become homeless do not actually need significant supports, and in fact, prevention-focused efforts would be far more valuable in reducing homelessness. However, a small portion of people who do experience homelessness need significant supports. These folks account for about 15% of those who are homeless, but typically they use about 80% of system resources. These include emergency medical services, policing, emergency shelters, hospitalizations, and jail. None of these systems offer long-term stability like housing with supports, and all of these systems are exceptionally expensive. In comparison, funding for more staff at community agencies able to do prevention work pays off far more in the short and long term. Many of you are well aware of the challenges brought about by COVID to the housing and homelessness sector. One of the biggest challenges facing agencies is that there have been record levels of burnout. At a time when need is increasing, agencies have limited resources to attract new staff and retain those already working. I realize you're going to cut me off. I just want to finish by saying that budgets reflect values. I know that this council wants to end homelessness. I know that there are many important things that you're being asked to invest in this budget. And I also know that housing and ending homelessness are the backbone of dealing with so many other challenges we face. Thank you.
Thank you so much, Katie. We do have some questions for you. Councillor Carr.
Thank you very much for your presentation, Katie.
always learn so much from you. I fully support a lot of what you're saying in terms of supporting housing first and the need for more and more supports. In my ward, of course, the last 3 years, we've hosted folks in the physical distancing centers. We've seen food bank usage at record use. My 4 food banks are really suffering. But I have a question for you with respect to how the entire system operates. When you were speaking about the level of success that you've seen in other cities, you mentioned Edmonton. I mentioned that I grew up in Edmonton. And I know they use a systems planning approach there with Homeward Trust. And I was wondering if you had any knowledge of that, or could speak to how that's helped, if that's been one of the factors that has helped Edmonton.
Yeah, I often like to talk about sort of the 4 components of ending homelessness and what we've seen work. 1, housing, not a surprise to anyone here. 1 is community supports, and the other 2 are data and coordination. And the coordination ball, whoever is holding that needs to be able to have a system-wide perspective. They need to understand all the many complicated moving parts of the system. I know we're talking about 95 agencies that are getting $28 million. There's more. We've done a program review at the Alliance, which is going to be brought forward at the end of March. We've mapped over 200 programs at this point, and we know that that's actually not everything either. So all of that work, who comes into the system? How do they access which service? How do we make sure somebody's moving through the system in the first place effectively? That's coordination, and that requires thinking of resources as a collective. We cannot think about resources in terms of program A, program B, program C. We have to look at it as we have 200 programs, and we know that there are 8,000 people every year experiencing homelessness. How do they get connected to the right services? I'm sure many of you know that we have lots of system navigator positions in our communities. I want to work in a system that doesn't need a system navigator, to be frank. I want us to have a system that makes sense for the person who's using it, where workers can communicate across agency lines and get the support they need. So I'm taking a long way around on your question, Councillor Carr, but I think especially the idea of having an agency hold that coordination and system level view is really critical to being able to actually have common targets that we're all facing the same direction to look at meeting. So that's a big piece of what Homeward Trust does in Edmonton, and in a lot of its successful examples, somebody's holding that ball and doing that with clear direction and bringing the community together and doing that work collectively.
Thank you very much.
Thank you, Councillor. Councillor Troster.
Hi, Katie. Nice to see you again. I'm going to ask you the same question that I actually asked you at Planning and Housing, because I think it's really important for all of us to hear the answer. We often hear that it is more expensive to allow homelessness to continue than it is to solve it. I'm wondering if you could explain why.
So very much that kind of 15% of folks who have a lot of high needs rely on expensive emergency services a lot of the time. The 7 Cities Project in Alberta, so it was all of the 7 major cities in the province of Alberta, they saw significant reductions when they employed a housing first approach. I think it was like 50% reductions in EMS calls, something ridiculous like 60 or 70% reductions in policing calls. So all those systems that get involved simply because a person actually doesn't have a roof over their head and is outside is something that really contributes to the high cost. And at the end of the day, we're talking about human cost, right? This is lost potential. This is people who are struggling so deeply with poverty. They are not able to be a part of communities. They can't live, work, and play here in real ways. They're not able to participate potentially in the labor market. And actually, to be frank, more and more folks in shelter are working full time. Like, that is a sad state of affairs because we don't have enough affordable housing in our community. And that, again, is lost potential of folks being a part of community in a real way.
Thank you, Councillor. Conseiller Plante.
Hi, Katie. Nice to see you. I'm not used to seeing you on a Zoom screen, so it's nice to see you like in human flesh. Thank you so much for that. There was an op-ed this morning. I'm not sure if you had a chance to read it, by Peter Tilley in the Ottawa Citizen. And Peter has a great line that he wants to work himself out of a job. And I was just wondering, because there is some sort of basic confusion about the difference between an emergency shelter, supportive housing, and let's say community housing. I was just very basic if you can sort of differentiate between the three, because obviously the one in the middle is one my ward is doing cartwheels and backflips and a roundhouse kick for. And I want to make sure that that's what people know exactly what you're talking about when you refer to that. Merci.
Yeah, so I mean, it's a lot of complicated language. I appreciate that. And it's also a continuum. So I would say that we always are going to need some kind of crisis response for when somebody has a housing crisis. They can't always be rehoused immediately, though that is what we want to shoot for. So that is an emergency shelter space and option. The second step might be supportive housing, and that can look like a building where it's fully staffed 24 hours. It can look like somebody living in a private rental unit who has support staff coming to them. And I would say supportive housing, community, social, or nonprofit housing, kind of a catch-all for nonprofit or housing that is funded by government. I also want to add that all of the shelters are doing housing. All of the shelters are doing supportive housing, and they're trying to get out of the shelter business. Like, I know that line, it really is true. And when you see the builds that they have actually all across the city, some in Canada, new ones in College Ward, I think there's a real effort to try and reduce shelter beds, because they know they don't want to be doing, emergency services constantly. They want staff to be able to work with folks to keep them stabilized and housed. So yeah, that's sort of the breakdown of services. And I think we have a sector that's increasingly doing all of the things because that's what they have to do.
Conseiller Plante, tu es fini? Oh, pas de problem. Councillor Carr. Oh, all good. Wonderful. Thank you so much, Katie, for being here today.
Thank you. Thanks very much.
Our next delegation is Carly Scarf from the Rural Ottawa Youth Mental Health Collective. I understand we have some slides. Okay, Carly, I understand you're online. Please proceed when you're ready.
Wonderful. So good morning. My name is Carly Scarf. I am the program coordinator at the Osgoode Youth Association, and I'm here on behalf of the Rural Ottawa Youth Mental Health Collective. Next slide, please. Our collective is 12 multidisciplinary agencies who are deeply invested in the mental health of rural youth. I'm here today to tell you about our project, the issues faced by rural youth, and the need for investment from all levels of government in addressing rural youth mental health. Next slide, please. Our collective has observed that while mental health needs have increased in general and increased in complexity, accessible and mental health supports in rural Ottawa have been basically non-existent. As everyone at this committee knows, Ottawa is a unique municipality. It has one of the largest rural areas of any city in Canada. 80% of the city is made up of rural area with less than 10% of the population living there. This makes it difficult to compare to other rural areas because we're located so closely to a large urban center. However, the experience of youth living in rural Ottawa is very disconnected from the urban core and is causing them to fall through the cracks. Next slide, please. Past attempts to address these issues have been met with a lack of understanding of the true barriers faced by rural youth. Access, distance, no public transportation, the necessary disclosure to caregivers in order to access the urban services, lack of understanding of what supports exist, and the general perception that urban supports are too busy or simply do not reflect the unique needs of rural residents, just to name a few. Next slide, please. Last year, we spoke to a youth who lived in Fitzroy Harbor. They told us a heartbreaking story of the time they tried to access a very specific mental health drop-in group for LGBTQ2S+ youth. Fitzroy is a very small village, very far away from any services and no public transportation. The problem started with it being downtown on George Street on a weeknight, but this youth had supportive caregivers who flexed their work schedules to drive downtown in traffic to bring their youth. It took months to organize with many failed attempts in the past, but finally this youth was going to get downtown. Once they got there, there was a sign on the door that said, "Program full. Please come back next week." When we heard from this youth, they didn't bother to try and go back. This story isn't an isolated event. Social services and grassroots organizations in Ottawa have been hearing stories like this over and over for years. Next slide, please. So in 2018, our collective formed. We did extensive research and we learned exactly what needs to be done to make youth feel supported in their mental health. We talked to hundreds of youth, their parents and caregivers, local politicians, educators, service providers, hockey coaches, scout leaders, you name it, all of who are concerned about the lack of accessible, equitable, and inclusive mental health support to this vulnerable group of youth. Next slide, please. We defined the challenges, developed a baseline of how many youth currently feel supported, and learned what kinds of programs and services our collective and our members can implement to help youth feel more supported. And we set a goal. By 2024, 80% of rural youth will feel they are getting the mental health support they need or know where to go for help and when they need it. We learned the absolute best way for youth to access mental health services in their own community. Next slide, please. We then created a theory of change and strategies to achieve this goal, and we have begun implementing programs and advocating for services to reach rural youth. We are part of a preventative strategy. We want to support rural youth so they don't reach crisis stage and certainly don't end up relying on first responder resources or hospitals. Youth programming and youth mental health supports will enable youth to become mentally well and supported adults. We've talked in depth to rural residents and service providers about how to support rural youth, and we know exactly what it'll take. We're doing a really great job already, and we're only getting better, which brings us here to today. Next slide, please. Making sure that rural youth are supported in their mental health requires government investment. We're on our last leg of funding from the Laidlaw Foundation, and in order to continue our work, we need to secure sustainable funding beyond 2023. Our collective and/or our member organizations need consistent annual funding of at least $500,000 dedicated directly to rural Ottawa in order to increase youth mental health support so we can continue to connect with, support, and set them up for future success. Thank you very much.
Thank you, Carly. You're right down to the second there. You have a question from Councillor Brown.
Thank you very much, Chair. And Carly, thank you very much for coming out and delegating today. I know your colleague came on Friday to ARAC and shared a very similar message. And for the benefit of my colleagues, and I know they've all heard me say this, and at some point someone's going to roll their eyes and say, oh, there goes Councillor Brown again. But my ward alone fits every single urban and suburban ward, and I still have room left over. And that always provides, I think, pretty good context to how vast rural Ottawa is. And that's just my ward. That doesn't include Councillor Kelly's ward, Councillor Drew's, or Councillor Kitt. So rural Ottawa is, as you said, 80% of the city of Ottawa. And when we talk about access, if you can't get from one village to the next, let alone from the rural area to downtown, then there's no access. So I guess my question to you is, what is the single, achievable goal that City Council could do to assist your organization in ensuring that these mental health supports extend into rural Ottawa?
Well, obviously funding would be the best thing that we could ask for, because we, as a collective, we have a lot of the pre-existing relationships with youth. We have a lot of the pre-existing services. We just don't have the funding to extend it as large as it needs to go. So for example, at the Osgoode Youth Association, there is there's a counselor room there, but the counselor can only work part-time. We don't have the funding to employ her full-time. So that really limits the amount of clients she can see. And she does work for the Nepean Rideau Osgoode Community Resource Center. And that catchment includes Manotick and Greeley and Metcalf and all these other little neighborhoods. But because she's only part-time and that's all the funding that's theirs for, she isn't able to be in other communities. So really it would come down to council supporting to provide funding or advocate for funding for these rural specific services.
Okay, no, and I think that's helpful. And, Ottawa has 26 rural villages. So, and each of these villages has youth in need. And I think that's always important to remember. Madam Chair, I guess my question to staff, how are staff ensuring that funding doesn't just get directed to the urban and suburban wards, and that in fact, we are getting funding out in rural Ottawa? I'd appreciate hearing an explanation on that.
So Councillor Brown, we will hold questions to staff until the end of all the delegations, but I would ask you to ask that because I think it's an important point that we present to staff. But if you could hold that until the end, that'd be appreciated.
Absolutely. Thank you very much, Chair. And again, Carly, thank you for coming out today.
And Carly, we have one more question for you. Don't slip away. We have Conseiller Plan.
Hi, Carly. Thank you so much. Thank you so much for your presentation. As one of the urban councillors, in talking to my colleagues over the last couple of months, I was really surprised to learn about the need both for mental health and addiction supports in the rural areas. I wasn't surprised. I was just about the need for it. Sorry, I was just sort of surprised at the number and how many people have to come downtown for basic sort of services. And I'm a big fan of meeting people where they are. And I really do appreciate you coming forward to disabuse this notion that it's only the downtown that needs addiction and mental health and health services in general. I really appreciate you saying that. Thank you so much.
Thank you.
Thank you very much, Carly. Our next delegation is Rachel Wilson from the Ottawa Food Bank.
Good morning, everyone. My name is Rachel Wilson, and I am the CEO of the Ottawa Food Bank. The Ottawa Food Bank represents a network of 112 emergency food providers across the city. Currently, there are 28 community and emergency food banks, 18 after-school programs, 25 meal programs, and 29 food cupboards in every neighborhood in Ottawa. In 2022, the Ottawa Food Bank and its network reported the highest numbers in Ottawa's food banking history, over 400,000 visits to a food bank or an emergency food program. This trend continues to rise at an alarming rate, and this new year will bring additional challenges. Our number to food bank visits in January increased by 35% over last year. These numbers should scare you. This is no longer a COVID issue. I'm speaking to you today from a brand new warehouse that the Ottawa Food Bank just moved into on Bantry Street. This space is double the size of our old warehouse at Michael Street and is almost 50,000 square feet. I don't tell you this out of pride. We moved to this new location to meet the ever-growing demand for food across the city. For the first time in our history, unemployment levels are low, yet food bank use is at a record high. We know the cost of living is having a dramatic impact on everyone, particularly those on social assistance or in precarious work. Food banks should be seen as the canary in the coal mine. Our numbers typically rise in advance of other indicators. Food insecurity has become one of the largest symptoms of poverty in our city, and the challenges are systematic. Inflation, income inequality, and lack of deeply affordable housing are creating a health crisis in Ottawa. And food banks are no longer just about food. While we provide an essential service to the community, we are recognizing the important role we play in ending poverty and food insecurity in Ottawa. Food is no longer the answer. The network of emergency food providers have made significant strides to move beyond just food. We know food is what brings people to the door. Now agencies are creating additional community supports and services for residents within each of your wards. These include referrals, wraparound supports programs, connections to critical services such as employment, mental health, languages, and wellness programs. We play a critical role in people's health and well-being, and yet we receive no funding from the province, no funding from the federal government, and only a small amount from the city's budget. I'm not here to ask for more money for the Ottawa Food Bank itself, although it should be noted that our budget grew by 70% in the last 3 years and is now a $27 million organization, and the city provides less than $400,000. This represents less than 1.5% of our budget and does not include the budgets of the 112 agencies that we support. We are truly funded by the generosity of donors and the citizens of Ottawa. Food response should not be a charitable response. The network of community food banks and emergency food programs need more city support. They need access to affordable, adequate spaces, staffing, funding as an essential service, and support for long-term strategies to address poverty and food security in our communities. While we advocate for sustainable systemic solutions to the challenges of food insecurity, we continue to serve our communities. The efforts of the network of agencies is incredible. They truly are the unsung heroes on the ground working incredibly hard to meet the needs of the communities. We are unsure of our sector's sustainability. Most of the network received the same amount of funding despite the dramatic increases in the number of visits. The network cannot continue to address both the immediate and long-term issues without the support of the city. There are thousands of people in our city who are frequenting a food bank once, twice, and sometimes 3 times a month. Despite natural disasters, a global pandemic, and the rising cost of inflation, day-to-day operations continue for our network. We did not stop during the pandemic. We deal with the daily emergencies of those in crisis seeking food. I know the budget will not change between today and tomorrow, but I urge you to connect with the Ottawa Food Bank and the network as you plan the budget for the next year. The city can be an agent of social change and has the opportunity to reduce poverty and its root causes, including food insecurity. But we need public policy that supports and prioritizes the programs that provide essential services. I urge you to have conversations with the food banks in your ward who represent some of the critical threads that give a safety net and hope to those experiencing food insecurity. For some of you, there are multiple food banks and programs. And when you visit a food bank, think about your family, friends, and loved ones accessing a food bank. And if you wish for something different, that you consider the critical role the city must play. And I will stop there because I'm right on the dot.
Thank you so much, Rachel. Really appreciate your comments. And you have 2 councillors lined up to speak to you at the moment. Councillor Carr.
Hi, thank you very much for your delegation. And I'd love to say welcome to the ward as you're now Bantries in Ward 18, but at the same time, it's difficult to celebrate the fact that in Ottawa's capital city that we are having to expand our food bank so much that you needed that larger facility. I've gone out to see 3 of the 4 food banks in the community food banks in my ward since being elected, and I've been pleased to see that a couple of them have migrated to the grocery store model, allowing more dignity for the folks that are having to select food. I guess one of my big concerns, and you sort of addressed part of it in your remarks, is, does the Ottawa Food Bank alone have the ability to meet this capacity in the community? If you could outline a little bit how the city can better help short, mid, and long term, and I guess also if you could respond in terms of what's going to happen if these numbers continue to rise. We know that there's more and more asylum seekers coming across, even though employment is low. We're getting influx of new Canadians. We're seeing more and more people struggling, more people having to rely on emergency services of all kinds. If you could just speak to that a little bit, I'd appreciate it.
Sure. So to address your first question around how the city can support the network of agencies, we know that a critical issue is staffing, a critical issue is space. Most of the food banks would love to offer a grocery store model, but they are trapped in a basement, they are in community housing, and quite frankly, they have taken over community housing spaces that should be delegated for recreational and supportive services. But food insecurity is the #1 issue driving people to access services in our community. community. We need to have access to recreational spaces to be able to provide a full wraparound support to those who need to access a food bank. So staffing is critical. Affordable housing is a #1 driving issue. Most of our people who are accessing food banks now are coming from the private rental. They're not coming from social housing because they are well supported. It is private rentals that are driving the numbers up. We are seeing an increase in the number of people who are new Canadians and newcomers to our community, but we're also hearing it is a wide variety of people who are returning to food banks who haven't had to access a food bank in many years, people who are fully employed who are needing to access a food bank. So there are many reasons that are driving people to a food bank. It is critical to understand that it is not a moral failure that is driving people to a food bank. The pandemic showed that job losses, that the inflation, that there are critical factors that are driving people to need to access a food bank.
Thank you. And I'll just add a comment that, it was really surprising to me. I served on the Blair Court Community House Board for years, and what you're saying about people using the space now for food banks, I go over there now and it's just pure basic services that are being provided. There not nearly as much programming as there used to be, because using the space for food banks, clothing drives, just to provide basic necessities, you can really see the impact. But thank you very much for speaking today.
Thank you.
Thank you, Councillor Carr. Councillor Kavanagh.
Thank you very much, Chair. Thank you very much, Rachel. There's nothing more that we'd like to do than put you out of business, and wish that you didn't have to be here for this. I just had a meeting yesterday with a community house in my ward, looking for space, asking if we can use city recreation space for a food bank, because they've run out of space. The community house no longer has capacity to just work out the back of a building, a small building that would be a house. So I can totally understand. And it's important that these are local, that people can walk to these facilities to get food. And as you said, it's growing. My concern is the ask that you're putting out, are you asking for the space? Are you asking for funds? But I'm wondering, I'm thinking that it's about affordable housing too, that people can't afford where they're living. And no doubt the price of groceries have gone skyrocketing. So what is it is the best solution in terms of the city's role?
The reality is right now we are in a crisis situation where the numbers continue to rise at an alarming rate. And similar to what my peer Katie mentioned, we cannot be asking people to learn to swim before we save them. We need to be providing access to food now, while we continue to work on the long-term systemic issues. The work that's being done under the Community Safety and Wellbeing Plan, driving the poverty reduction plan is critical, as well as a food security plan is also critical. We like to see ourselves as a bit of the emergency room. So while we continue to treat and support people who come in and day out, the rest of the system, the rest of the hospital, if you will, needs to be working on those supportive systems that will truly reduce the need so that we can go out of business. That is our goal by 2050, to eliminate this massive structure that exists in food banking and to really drive a community-based response that addresses a holistic and a well-being approach to food security and poverty reduction.
Thank you. And as I said, it's got to be local, because it's happening in our communities and they need the help there. Thank you so much, Rachel.
Thank you.
Thank you, Councillor Kavanagh. Councillor King.
Thank you, Chair, and thank you, Ms. Wilson, for your insightful presentation. I know in my ward during COVID and beyond, we saw a 30% increase in the use of food banks. And I know that community organizations, individuals, community associations have been very concerned, so much so that they worked on advocacy in the last term of council around the establishment of a poverty reduction strategy, as well as a food security policy for the community safety and wellbeing plan. We hear often about the impact of inflation, obviously, on residents, their grocery bills. And you had noted that your budgets have been skyrocketing. I was wondering if you could briefly speak about the impact of inflation, food inflation, on the food banks themselves, and what solutions both whether it's municipal or other levels of government can bring to bear to address the challenges, the operational challenges that you and your members are experiencing.
Thank you for the question. We increased our budget, to give you a sense, from about $1.5 million on food alone to over $6 million in this year. 50% of that is the increase in numbers of people that we're serving, and about half of that is also the increase of cost of food. So we know that food is becoming incredibly unaffordable, particularly the healthy items. We try and put out about 50% of our items are fresh items, so milk, eggs, meat, and produce. Those are incredibly expensive for people, but they are the ones that have the most impact on health. The challenge and the reality is that as a organization, and most of our network is the same, funded by a community who is impacted by inflation, we suspect that our donations are going to continue to drop over the next 12 months. And as they continue to drop, we will continue to have to make sacrifices about how much food we can put out into the community, the number of hours that the agencies are open, and the staff that are there to support people in crisis. So we are going to be making some really difficult decisions because of the impact of inflation on all of our network. These are very challenging times, and quite frankly, they're scary times. We just don't know how this is going to roll out over the next 12 months because our sustainable funding is almost non-existent.
Well, I appreciate the insight and the candor, and obviously, in terms of our food security policy, it is my hope and in a sense my intent to ensure that we ask staff, how do we really address these changing environment, the changing conditions, economic and other social economic conditions, and their impacts, obviously, in this supply chain, because if lower income residents are impacted by inflation, so obviously will be the food bank, and we will need to look at solutions to ensure that we can address these challenges. Thank you so much for your presentation. Thank you.
Thank you, Councillor King. Councillor Troster.
Hi, Rachel. Thank you so much for being here and for your presentation. So something that we're hearing a lot in our community, and I know you referenced it, I just would like to ask you to expand, is about how a lot of the temporary COVID relief funding that funded a lot of food security initiatives during the pandemic has now dried up, even though we know the pandemic is not actually over. And then this is happening at a time when the rate of food inflation and the cost of living is through the roof. So in my neighborhood and in the west end of downtown, this Cooking for a Cause program run through the Parkdale Community Food Group that worked with restaurants to deliver thousands and thousands of hot meals to community agencies has now had to close its doors because it was funded by that temporary COVID relief funding. I'm just wondering if you could give us kind of a citywide picture of the impact of that funding coming in and now being taken away in terms of addressing community hunger.
Absolutely. That funding was critical for agencies to be able to meet the increased demands and the increased work that was needed to address the issues in a COVID environment. So staffing was key, being able to hire staff full time and know that they were able to hire them for a full year. I think people underestimate that many of these food banks will have one person who is a full-time worker and the rest will either be contract, part-time, or volunteer. Our numbers are skyrocketing, and this is not a COVID response. We're at 35% over last year alone, and yet now we're seeing the funding dry up. We are doing literally more with significantly less than we ever have in the past. It is not sustainable. We are hearing from agencies who are having to make really difficult decisions about staff. They are trying to get funding for staff, creating programs so that people can do the basic work that they need to do, and they're doing food banking off the side of their desk. This is not how a response should be to poverty reduction and food insecurity in a community, and we need to do things differently. So losing that funding has been absolutely devastating for the network of agencies.
Thank you. Yeah, I often say that as someone who's hungry doesn't really care where the funding comes from, nor do they know. They just know that they don't have a meal in front of them. So I really appreciate that additional perspective. Thank you.
Thank you, Councillor. Councillor Lowe.
Thank you, Chair, and thank you for your presentation, Rachel. My question is about the role of community gardens and possibly helping the Ottawa Food Bank in maybe reducing some of their costs, most, I guess, related to transportation of the, the transporting the items from wherever the farm is to the grocery store. Is that something that the food bank has done, or do you partner with any agencies in the community that do that? And if so, has that, positively impacted your operations in any way?
The Ottawa Food Bank itself actually has a farm located out in Stittsville near Carp. So we grow about 180,000 pounds every single year of some of the best food you will ever encounter. And I have to say that because my farmer, Jason Gray, is incredibly dedicated to that. So we do work not only at our farm, but with community gardens. Unfortunately, as I look out my window, community gardens are only able to operate during some time of the year. And they do provide access to food locally, which is a critical piece. They also create community, which is really important for our agencies to create that community with the people in their neighborhoods. But the reality is that we are really not looking for more food. We are looking for supportive services that help move people out of food insecurity. And that has to be about addressing the root issues that drive someone to a food bank. And we know when people come to the door, they are looking for food, but we have a unique opportunity to speak to people about what is causing them to access a food bank, whether that is employment, whether that is childcare, whether that is mental health, which is a huge issue we are seeing right now. So although we appreciate the role that community gardens play, we really are looking for investments in those supportive services.
Okay, great. Thanks very much.
Thank you, Councillor, and thank you very much, Rachel. When I think about it, there are 4 operating food banks supported by the Ottawa Food Bank in the East End alone. And we know that this is an issue that is pervasive across the city, not just in certain sections. So thank you very much for the work you do. Thank you for coming here today. And I anticipate there'll be lots of conversations we have over the year to come in preparation for the next budget.
Thank you.
I now welcome Jeff Mason from the Somerset West Community Health.
Thank you, Community Service Committee members, Madam Chair. My name is Jeff Mason. I am an 8-year resident of Somerset Ward and volunteer member of the Somerset West Community Health Center Advocacy Committee. I'd like to thank you for the opportunity to speak to the budget today. Somerset West Community Health Center is a nonprofit community-governed organization that provides primary health care, health promotion, and community development services through the use of an interprofessional teams of health and social service providers. As a member of the Coalition of Community Health and Resource Centers, Somerset West works in partnership to reach the diverse residents of urban, suburban, and rural Ottawa with a shared vision of a safe, just, and healthy life for all. As a community health center, consulting with residents and grassroots groups is at the core of how we shape our services to respond to community needs. We bring deep community connections and strong organizational relationships to our partnership with the City of Ottawa. We leverage connections and relationships to respond quickly, effectively, and efficiently when the need arises. Community health and resource centers play an outsized role in promoting safety and well-being in Ottawa. Somerset West has 2 outreach teams that work in tandem, the Homeless Community Outreach Team and the Drug Overdose Prevention and Education Project, also known as DOPE. These teams operate in parts of the city characterized by significant levels of poverty and income insecurity, growing homelessness and housing precarity, and high rates of overdose deaths. The Homeless Community Outreach Team provides outreach and crisis response to unhoused and underhoused individuals in the Somerset West catchment area. The team carries a crisis response phone, which is heavily used by residents and businesses as an alternative to calling 911. Between July and December, the team responded to 2,366 calls and served 313 individuals. Over 55% of the requests for support were to help a person in crisis. The DOPE team operates in Somerset West, Carlington, and Centertown Community Health Center catchment areas and is staffed almost exclusively by people with lived and living experience who support drug users in this city. Since the program's inception in 2019, the DOPE team has had 28,875 individual engagements, including 1,796 engagements with African, Caribbean, Black, or Indigenous individuals since April 2022, when the program first started capturing this data. These are just 2 examples of interventions Social services offer that more efficiently and effectively respond to issues related to homelessness, mental health, violence against women, and the communities around them. City Council could better apply existing spending and improve community safety by funding social services to address crises related to these issues. This is not about spending. This is about funding resources that send the right person to the right place at the right time. It's about preventing calls from being routed to more expensive services. This not only makes a financial sense, but is what residents want. We hear from businesses and neighbors that they do not want to call police when someone is sleeping in their lobby, but currently policing is the only service available overnight. It is less expensive and often more effective for social services to respond to communities in crisis. This frees up the police to do policing work, including responding to the many policing requests coming from residents living in suburban and rural communities. We're here today to work with the mayor and council to find effective, affordable, and appropriate solutions to some of the city's most complex and pressing problems. I'll close with 2 calls to action and an invitation. We call on the city to invest new sustaining funding in social service infrastructure in Ottawa. Increases to city funding programs have not kept pace with inflation and impact our capacity to deliver critical services to support people to meet their basic needs. More funding is needed now in a system at risk of being stretched too thin. One small example is the Somerset West Shower Program, which serves approximately 20 clients per day and is addressing a critical gap in services for minimal cost. This program, like so many others, is facing a loss of funding as of July 2023. We also call on the city to foster a more meaningful consultation process for future budget cycles. As organizations working closely with grassroots groups, we are available to meaningfully connect the city with residents, but more engagement opportunities are needed earlier on in the budget planning process. Finally, for those of you who have not had the chance to see our programs in action or have not had the chance in a while, we invite you to visit, come for a tour, and see our work in action. Let's be leaders in this together. Thank you.
Thank you very much, Jeff, and I'm sure we'll take you up on that offer to see your programming at work. We have a question from Councillor Troster.
Hi, Jeff. Thank you so much for being here. One thing I just wanted to say, and I wanted to make this committee aware. Jeff mentions a program for people experiencing homelessness to take showers at Somerset West Community Health Center. It's the only one of its kind in that part of the ward. There were showers formerly provided by St. Luke's Church, which had a catastrophic fire this summer, which means it is literally the only location. So I've been working with the mayor's office to try to secure funding for that program. So you might see something come forward tomorrow, but I'm prepared to fight for it because it really is so important. Jeff, I was wondering if you could just answer a simple question. Do you think that the current social services that you provide through Somerset West are meeting the needs of the community?
I think that's a bit of a tough question from my perspective as a volunteer. I think takeaway messages that I think speak to this are that we acknowledge that there is funding and increase in the budget that's coming, but it's just it is not keeping pace with what's needed, and what's being proposed is effectively going to reduce the available services, the ability to deliver services in these communities. From my personal experience, you see so many more people in crisis when you walk around in our neighborhoods now. There's clearly a need. Programs like the Homelessness Crisis Outreach Program, I think are a great stopgap solution. Folks already today have spoken to the need for wraparound services, additional supports in the community. So right now, I think people are doing the best that they can with the money that they have. They use the money so well. They have so much impact with what little money they have. But there's always absolutely need for more. We shouldn't always have to be in a position of reacting to crises when there are better evidence-informed, more cost-effective solutions out there that social services like Somerset West can deliver for our city.
Thank you. I so appreciate that. And just to give folks a window into the work my office has been doing with Somerset West is we really have spent the last few weeks back and forth. I feel like we were on the phone with Somerset West staff every day to try to ensure that a lot of these crucial frontline services were not slipping through the cracks and facing cuts in this budget. And it seems that the last funding envelope that we really need to fight for is this shower program for people experiencing homelessness. So I hope to garner support at the council meeting for this very low cost initiative that provides an essential public health service in our neighborhood. And thank you so much to everyone at Somerset West for what you do for our community.
Thank you.
Thank you, Jeff. Our next delegation is Colleen Taylor from the Old Forge Community Resource Center.
Hello, good morning. You can hear me?
Yes, we can.
Excellent. Thank you very much. First of all, thank you for allowing me to be here, the opportunity to present to you today. My name is Colleen Taylor, and I'm the Executive Director of the Old Forge Community Resource Center, which is located in Ottawa's West End and more specifically in Bay Ward. Our organization provides community support services to vulnerable seniors and adults with physical disabilities, and we are part of a broader home and community support service sector across the city and the province. So these services come in many forms, including dementia day programs, Meals on Wheels, transportation to medical appointments, foot care, social, fitness and isolation programs, personal care to those with severe disabilities and chronic progressive diseases, assisted living, respite to caregivers, and more. Our services are provided to people in the community to give them the opportunity to live independently in their own homes. We are not to be confused with Home and Community Care Services, or formerly CCAC, but we are rather the providers at the front end of these services. I wanted to take the opportunity before I go any further to express my gratitude on behalf of the Old Forge and other services, community services like me, and the residents that we serve, to the City of Ottawa for the funding and support we receive from you for our programs. The City of Ottawa has actually been a strong supporter of CSS services and has demonstrated year after year that you see the value of keeping people at home and healthy. So I wanted to put that out there and thank you for that. I'm here today to ensure that you're aware of some of the challenges facing vulnerable seniors and adults with physical disabilities here in Ottawa. These are residents from every area of Ottawa, from Britannia to Centretown, Constance Bay, Orleans, Manotick, every area of Ottawa. Community support services are vital to our community, and as an example, the Old Forge offers a day program for seniors with dementia-related illnesses. We bring seniors to our center to provide their caregivers with a break and help them maximize their own abilities. That break for caregivers might be having a coffee with a friend, running errands, or simply sleeping for being up all night with their loved ones. There's always a wait list for this particular program, and that's reached up to 80 to 100 people in the last year. We get consistent feedback from people saying that they don't know what they would do without our services. Another example is a man who is visually impaired, and he attends our day programs. He is a single senior living in a community housing building down the street. He relies on our community support services from the Old Forge to get him his groceries, to his medical appointments, and he is one of many very similar looking clients across Ottawa. Ontarians have been very clear about where and how they want to receive their care. They want to receive their care at home in their communities, and 91% of seniors would prefer to stay at home if they were on a wait list for a long-term care facility, if additional supports could be provided to keep them living in their homes. But unfortunately, funding to the community support service has not kept up with the growing need, given the explosion of seniors requiring more support, nor has it kept up with the cost of living expenses. So we know that without additional funding, the sector will have no choice but to reduce services, leaving thousands of seniors with inadequate care, and there's a growing number of them across the province. As healthcare providers, the Coalition of Community Support Providers has come together to voice our concerns to the province and the challenges we face. And we have taken many steps across the last 6 months, speaking with Ontario Health East, discussing our concerns for our upcoming budget, which starts April 1st. We know that it will be impossible to balance our budget without a financial infusion from the province. We have assigned letters from our 31 community support agencies across the region. We have sent this to the province. We have gained the support of our 4 major hospitals. We had a meeting with 4 major hospitals to communicate our concerns with them and understand and make sure that they understand the impact on their emergency wards and the discharges that they won't be able to do. That letter has been sent to from 12 hospitals across the region. Was sent to the Minister of Health yesterday, the Premier and the CEO of Ontario Health, and CC to our provincial association. What I'd like to do today is I am not seeking further funding from the city. I'm seeking your support to amplify our voice to the province who funds healthcare. I am asking that you consider communicating to the provincial government the need for sustainable funding in the community support sector. And your support would be based on both a growing need for our clients and the fact that community support services is a preferred and more affordable option to institutionalized care such as long-term care and hospitals. Thank you.
Thank you very much, Colleen. And we have a question for you from Councillor Kavanaugh.
Thank you very much, Colleen. I appreciate you coming out today. And I appreciate you saying that how important that city funding is and how well used it is for our seniors in the community. What are the greatest needs facing seniors in Ottawa right now? And what are the gaps primarily that we need most? You talked about the programs for dementia and staying in your own homes. And what other prevention services are there that we should be looking at or supporting or getting the province to support?
There are a plethora of needs right now that keep people out of hospital and long-term care and help them to stay in their homes. These are relatively affordable services compared to stays in hospital or long-term care. And we see a growing need for adult day programs which are sort of twofold programs to help both caregivers and seniors and young adults stay in home and out of hospital. We see a growing need for transportation to medical appointments, for personal care services that allow people to stay at home just by simply having a PSW, for example, come into your home and make a meal, do some grocery shopping, do cleaning for you, and help you bathe and personal care. So we see demand in all of our services. Isolation issues have come up. Social isolation issues are massive since they're massive in general, but the COVID pandemic has certainly shone a spotlight on those services as well.
What about the NORC program?
Thank you. That was in my speaking. I ran out of time. That the NORC program, the OASIS program, is just started in Ottawa. It is the first OASIS program in Ottawa. It's run by the Old Forge, and it's taking place in 3 Ambleside buildings. And that program is one of a critical service that is helping people in very specific areas called NORCs, naturally occurring retirement communities, to stay at home with the help of social isolation programs and fitness programs, preventative programs to keep people engaged, volunteers and clients, so that they never reach that next step of needing more advanced services that you might find in medical care. It's a very valuable program. It's just starting, and it will expand and keep people at home.
Thank you, Colleen. I appreciate all the work you're doing with seniors in our community. And as you know, Bay Ward has the highest number of seniors, so you've got your hands full.
I do.
Thank you.
Thank you.
Councillor Hill.
Thank you, Chair. I appreciate the delegation.
Hi, I'm not sure if there was a question there for me.
Perfect.
Yes, we're just figuring out technical matters.
Okay.
Sorry about that. It wouldn't be a Zoom meeting if we didn't have something like that happen.
Of course not.
Colleen, thank you very much for the delegation. I appreciate this. Will be really quick. I'm interested in your comments about what we can do to help out in terms of advocacy with the province. And I would just ask if you could perhaps reach out to my office at some point in the next few days. We'll have a lengthier conversation about that. Thank you.
Thank you very much. I am hoping, my ask today is that that council would consider a communication, a letter of support to the province to express the concerns that we have here in Ottawa for our health and community support services, and in particular for the seniors and people with disabilities that will not be getting services when those services are cut in the near future.
Thank you very much. Thank you, Chair.
Thank you very much, Colleen. Our next delegation is Mostafazur Khan.
Do you hear me, please?
Yes, we can.
Sure, thank you. Thank you, Chair. Good morning, Boju. My name is Mustafizur Khan. I am a parent, a Canadian citizen living in Ottawa for 18 years and immigrated to Canada in 2005 from Bangladesh. I have Masters in Agricultural Extension Education and completed a diploma in community services from Harjing College, Ottawa. Also completed 2 certificate courses from University of Alberta. One is on food security and another one is on climate change. I am currently associated with the Ottawa Community Immigrant Services Organization and a significant experience in working with the Public Education, Ministry of Education, School Board, School Council, and a valued member of a Canadian Agricultural Economics Society. I am thankful for the opportunity to speak on the City Budget 2023, working together for a better Ottawa. The City Budget has been developed is a milestone. Thanks to the City Council, City Administration, and all other contributors who prepared the budget for Canada's national capital city. On a recently LinkedIn post provided by our Honorable Mayor, which is written, people often think of a budget as a bunch of numbers, but a city budget is about people and neighborhoods. It's also about programs and services, and it's all about intentions and priorities. We have seen the 2023 city budget with a broad range of programs and services on priority basis. More importantly, the Community and Social Services Department oversees an integrated continuum of supports through programs and services on the following services areas: children's services, community safety, well-being, policy and analytics, employment and social services, gender and race equity, inclusion, indigenous relations and social development, housing services, long-term care. I watched a YouTube published by City of Ottawa with the title, How Your City Budget Works. It is being said, Ontario cities like Ottawa receive only 9% of all taxes collected, but are responsible for over 50% of the infrastructure. Every dollar that comes into the city, 53 cents comes from property tax, 18 cents from provincial grants, 29 cents from user fees and other sources. Money collected is required for operating and capital budget. This is very important to know. Provincial government legislation in Ontario states, money coming in equals money going out is a balanced budget. In the budget, I especially liked the initiative, the development of a partnership with University of Ottawa to launch an innovative framework called the City Studio. City Studio Ottawa is an opportunity for the city to collaborate with the students and faculty staff to conduct research, explore ideas, and identify innovative solutions to civic problems. My opinion is, in this budget, programs and services, strategies, and initiatives are uniquely illustrated. I would like to give more emphasis on the budget process because it's a commitment to the people and how to measure the impacts time to time. The Ottawans are eagerly waiting to get benefited because high cost of living is really a serious issue now. Finally, if there is a question, what should be my role? The answer is to think about your goal. There are 17 sustainable development goals released by United Nations. Specifically, goal 11 is make cities and human settlements inclusive, safe, resilient, and sustainable, ensure good governance, the process of decision making, and the process is being followed to implement the decision made. 3 major indicators to ensure good governance: transparency, accountability, lobbyist rule. Ensure equity. We often confuse it with equality. Equality means each individual or group of people is given the same amount of resources or opportunities, while equity recognizes that each person has different circumstances and allocate exact resources and opportunities to reach an equal outcome. In fact, we are so much less without each other. Working hard, working together is key. To integrate resources and produce a higher productivity, we also need federal municipal partnership, provincial municipal partnership, public-private partnership, and multi-sectoral collaborations. Thank you, Messi.
Thank you, Mr. Khan. Seeing no, Councillor, no.
Yes, thank you very much, Madam Chair. Thank you, Mr. Khan, for the delegation this morning. I think you're presenting a very balanced approach and a common sense approach for how we look at this problem. And certainly, knowing that you're out of my neck of the woods, I'd be happy to have a further conversation with you on this over the next few weeks.
Thank you so much.
Okay, thank you, Mr. Khan. Seeing no further questions, we'll move to the next delegation. We have Marissa Moher and Michelle James from the Ottawa Guiding Council for Mental Health and Addictions. And I understand we have slides as well for this one.
Yes, thank you very much. Can you can all hear me?
Yeah, we can hear you.
Good. I can't see the slide up yet, but I will. Oh, great. Thank you very much. Thanks.
Yeah, you should see them now. You're welcome.
Wonderful. Great. So thank you for having us today. Michelle James and I are the co-chairs for the Ottawa Guiding Council for Mental Health and Addiction. As you know, the Guiding Council was established in 2021 at the request of Ottawa Police to explore a non-police response to mental health crisis, and was further supported by Council with a motion at that time. In particular, this initiative was sparked by incidents that specifically affected and caused significant harm to individuals from vulnerable and diverse communities. It was immediately identified that a strategy needs to be rooted in a community development approach that recognizes the recommendations of the individuals that are directly impacted by the current system. This includes an anti-racism and trauma-informed approach, acknowledging the systemic inequities that contribute to the overall crisis. Based on the extensive research and consultation conducted by the Ottawa Guiding Council, Ottawa residents that will be shared in a full report at the end of March. The initial analysis is clear that residents are asking for a crisis response system that provides an alternative to the current options that are available through the 911 system. The mental health strategy is being co-designed by the Guiding Council and involves input from over 1,000 Ottawa residents and 150 regional organizations that include hospitals, police, paramedic, community, and social services. The guiding principles that you see on this slide here that are visible to you will frame the short, medium, and long-term initiatives and activities that will be required to create system change for how we support and respond to Ottawa residents experiencing mental health and substance use crisis. Today, we would like to, one, thank you for the $550,000 that has been committed to this work and give you a sense of what we will be doing in 2023 with the initial investments. Michelle will speak to this a little bit more thoroughly, but in 2023, we are going to establish a process, mechanism, and work plan to achieve a call diversion and introduce a fourth line to the 911 system as quickly as possible. We're going to explore logistics for an alternative number outside of the 911 system, and we're going to find immediate ways to align with a successful pilot that's being carried out by the paramedics by including peer support into their interdisciplinary mental health response team, which they've been working on for over 2 years. I will now hand it over to Michelle to give some more detail into the specifics of the 2023 work.
Thank you, Marissa. So if we can just go to the next slide. So how did we come about all of this? So by incorporating the initial findings from the Guiding Council's community consultations, as well as additional study of critical race theory, as well as looking at alternative crisis response models that are currently operating successfully in other markets. Several common themes began to emerge that the Guiding Council identified as potential action items and interventions that will have a systems impact in 2023, 2024. If we can just go to the next slide. So here you'll see the key elements, the features, and the components that came out of this work. So the first key element is 911 call diversion, and this really features a no wrong door policy. The components of the model would include call diversion, including a fourth option for 911, so fire, paramedic, fire, police, paramedic, and mental health, as well as a separate phone line, which would link to a non-uniform co-response team. Additionally, significant training for both the 911 call responders as well as dispatch. The multidisciplinary teams is another key element, and this really focuses on providing culturally appropriate responses. These components would include a civilian response-led team, similar to what we see in Toronto, working with existing peer support and street outreach programs that exist in the city, providing additional training to peer support workers so that they can better support and provide navigation, as well as defining the process for how and when these multidisciplinary teams would be dispatched. And then finally, the last key element is really that community-based response that provides the wraparound support. So this is meant to really improve the overall well-being within the community. And the components for that piece is really looking at developing recommendations to scale up existing peer support and other outreach programs, looking at targeted supports for families and caregivers, as well as responding with specific supports for priority populations, for example, the Somali community, 2S LGBTQ community, as well as potentially geographic communities in priority neighborhoods, recognizing that this includes rural and urban centers with unique challenges. So similar to what we see in other cities, there's been significant investment.
Thank you very much, Madam. I'm going to stop you there. I do know we have questions for you, though, and I do appreciate that. So the first question is from Councillor Carr.
Thank you very much. Thank you for the presentation. And I'll say that I cannot wait to see this work rolled out. Thank you for all the work that's already been done. I'm certainly buoyed by the success of similar pilots in municipalities such as Toronto and Hamilton. I know that the pilots are planned for 2024. I'm wondering if there's any opportunity to accelerate those based on your ability to get the work done, and if there would be any financial ask that would be attached to that. If you could speak to that, I'd really appreciate it. And again, thank you so much for this work. Can't wait to see it all roll out.
Yeah, so I can speak to that. So the full report that's going to be released at the end of this month is really going to be able to provide some of those specific costs around if we had the full resources for fulsome pilots. So we know what those are going to be that are coming out of the consultations. They're really, really clear. It's certainly a multi-year, multi-partner, multi-system and sector initiative that's going to require all of us to be working together. I think we sort of heard from some of the other delegations where some of those points of pressure are. This all wraps up in what we're seeing in terms of who is responding to mental health and substance use crisis right now, and why it's maybe not working. So those costs will be available, and that's what we'll be presenting for the 2024-2025 budgets as well. But again, as you said, Councillor Carr, Toronto has invested 12 million into alternative responses, Calgary 2.5, and Waterloo about 8 million. So that really is the potential scale and scope of what the investment is. And I think it's also going to be working with council to advocate for various arms of funding coming into this. So that will be some of the requests that will come to you, is certainly funding directly from the city, but also how can we collectively go to other sources of funding to get the adequate resources for the system change that's required.
Thank you very much.
Thank you, Councillor. Councillor Troster.
Hi, Michelle and Marissa. Thank you so much for being here. And I'll tell you that this is the number one thing people were begging for other than affordable housing. When I was knocking on doors in my neighborhood, and the absolute need for this kind of a service is also coming from business owners and business improvement associations. They're very, very, very eager to have an alternative mental health, poverty, homelessness, addiction response. My concern, and it's, how do you envision a pilot? Do you envision a pilot working in a specific concentrated area initially? The reason why I ask this is we have such a vast city, and I'm concerned that a relatively modest budget for an initial pilot project may not give us the data that we're looking for if it's spread too broadly over our city. Is that something you're thinking about as you put these numbers together?
Yeah, I think, go ahead, Michelle. Yeah, go ahead.
I was going to say, I think I can answer that in that, part of the work of what we're looking at is specifically when we talk about priority populations, we're not just talking about populations like, let's say, the Somali community, which would be citywide. We're also considering, targeted geographic populations where there's a high need in priority neighborhoods that are specific to an area of the city. Recognizing again that, initially, without a significant investment, any pilot would need to be, appropriately scaled based on funding.
Thank you very much. And just to say, I think initially targeting Somerset Ward and Rideau Vanier, which are two extremely high needs wards in terms of homelessness, might help glean the kind of data to build out this program. We certainly need to start somewhere. And my concern with some of the money that was diverted from a potential police budget increase last year was sort of, I wouldn't say frittered away, but it's not necessarily effective if we've got $20,000 here and $50,000 there, and we're not developing an actual pilot of a functional service that we can get some really good data on. And I'm very eager to see this off the ground and eager to see it in the community that I represent. So thank you so much for being here.
Thank you, Councillor. Thank you, Michelle. Thank you, Marissa. We're now on delegation number 8, Mark Racine. And I understand we have files, Mark, so we'll set that up.
Hello.
Just so that the speaker knows, Chair, we're sharing the slides on his behalf and can advance the slides at his request.
So I'm just trying to see if there is a laser to sort. No, okay. Anyway, thank you very. Oops.
I would just suggest that when you're ready to go to the next slide, just say it out loud.
Next slide. Thank you very much. That's helpful. Thank you. The objective of this presentation are outlined. I'd like to support this committee in its important work in doing the budget review and approval, and also its terms of reference in terms of the parks, recreation, culture, and facilities, and providing guidance and direction to park services. Secondly, I'd like to encourage the committee to go beyond the absolute macro level budget numbers that you're dealing with and ensure that strategic community engagement and value by Parks Department is occurring. I'd like to present you a little case that identifies what the issues are and 2 recommendations. Next slide, please. The next slide outlines the location of Borough Gaffney Park. It's actually not labeled as Borough Gaffney Park on this picture from Geo Ottawa, but it is the park on the right-hand side going along the Rideau River. This park is not winter maintained, yet there are hundreds of people that use the park daily for their enjoyment, both in terms of physical and mental well-being. The park is now newly listed as being Ward 3, as being the main ward responsible for the park. It has 2 wards that are actually directly associated with it, Ward 3 and Ward 21. And it's adjacent to actually 2 other wards, Ward 22 and 24, many of whom are actually here at this table, around this table. Note that the Ward 3 portion of the Borough Gaffney Park is mostly forested and stone dust path, and that actual park open area, an actual park area, is actually split between Ward 3 and Ward 21. So for those of you who are interested, next slide, please. I provided some information regarding the myself and which are available. I just want to highlight that the Friends of Beryl Gaffney Park is made up of about 40 names on an emailing list. It's an informal group, an informal social group, which is completely focused on Beryl Gaffney Park. We have no terms of reference. We have no precedent. We have no money. We have no registration. We're not incorporated. However, we do exchange respectfully the different views that are associated with Beryl Gaffney Park. And we have members that are part of this group in terms of from Manotick, from Stonebridge and Barrhaven, from Riverside South, many from Ottawa Core, actually from the city of Ottawa, to actually travel out to the Manotick area, including North Gower. And the group has indicated support for me to present to you today the information that I have, and we can go to the next slide. The next slide is really the most important of the presentation I'd like to make today. This is the budget. This identifies the budget associated with Beryl Gaffney Park, which was tabled. And I've highlighted in yellow, and it's a little bit difficult to read. However, I just wanted to point out that the budget item itself seems to indicate $921,000 in capital funds that will be spent in Beryl Gaffney Park this year. However, if you try to find out what was proposed or where these numbers came from, it's not publicly available. I cannot, and my understanding is that both Ward 21 and Ward 3 may have actually sought to get information of what's being proposed, what's going to be done. It can't be found. Which is really a little bit of a strange situation. This line also seems to suggest that there was an authority for $1.7 million that was at one point or other identified for Beryl Gaffney Park, and yet trying to find out what was done, when was that done, what was done, how was it done. There's no information publicly available. There's probably some information somewhere, but it certainly isn't accessible from a public perspective. And then on top of that, it shows that there is an expenditure of $782,000, which has already been done in this park. And yet we're regular users of the park, and it's really hard to find out what's been done. I mean, it's not obvious there's any big capital issues. You'll also note, although I'm not a forensic person in terms of being able to identify or follow the money completely, but I did try to find out if there was any Beryl Gaffney information in budgets 2021. And I couldn't find anything. And similarly, there's no identification of operation dollars that are associated with Beryl Gaffney Park. All of which I'm saying is that when we're trying to find out what's happening, it really we can't really find it. So this is not new. This has happened before in budget 2018. If you want to go to the next slide, in budget 2018, there was an identification of $560,000 for Beryl Gaffney Park, and we have no idea what was used. Thank you. We're at the end of the part.
Yes, thank you very much. But I do know you have a question from Councillor Hill.
Thank you.
Yeah, thank you very much, Mark. I can assure you that both Councillor Brown and I, we've spoken on this topic. We're going to ask a specific question to staff on your behalf after this is finished. So thank you very much for the delegation.
Councillor DeRoche, and then we'll go to Councillor Brown in one moment.
Oh, thank you. Thank you for the presentation and for the work you're doing. It's great that we've got a very involved community there, and that park's got a long history dating back to the city of Nepean, and some pretty ambitious plans that I think we've really scaled back, right, to I think preserve a little bit more of a natural look to it. And I think there is sort of different views in the community in terms of how much activity they want to see through that stretch there. What are people looking for, I think, in terms of sort of future activities or future infrastructure along that path?
Yeah, thank you. And you're absolutely right. We certainly, Beryl Gaffney folks, are very interested in keeping it very naturalized instead of having baseball diamonds and amphitheaters and all kinds of things that seem to be kind of being advanced, which we're questioning, well, why is that being advanced and what is the public consultation? So we would like to see, I think, the park maintained as a natural a place where actually dogs are There's ample opportunity for dogs to be out there, families to walk. The pathways are excellent. So that's what we're looking for, and we'd like to be engaged with what is this money. I mean, we're very excited to see the money, and whenever there's work that's being done, it's excellent work. But the question is, what is it? And what is the process by which we can do that? And that's what we'd like to engage on. But I have to admit, I'm stressing this for this committee, is that your role is essentially to make that information, or to support the idea of making that information available so that good decision budget management can occur.
Yes, so good answers, and thank you for being here today. This is exactly, I think, the kind of public engagement we want to have on things of this nature. So thank you for that. Just briefly, I've spoken to Councillor Lowe about that entire corridor there, because with the Vimy Bridge, we have the ability, I think, to provide more connections so that we have a much better network through there. Hopefully we can do that with the police station on Lodge Road, make sure that there's a connectivity. And then eventually when we do work on Prince of Wales, having a better pedestrian crossing there, which will really connect the community. So no question there, but look forward to hopefully seeing some good things here. Thank you.
Okay, thank you very much.
Thank you, Councillor Brown.
Thank you very much, Madam Chair, and thank you very much, Mr. Razine, for coming and delegating today. I was able to speak with staff late yesterday evening, well beyond business hours, so I would like to start off by thanking staff for their flexibility. There is an answer. It's a little technical, and given the format, we'll have to hold our questions for staff until the very end. But I would encourage Mr. Razine certainly to continue to work with my office, Councillor Hill, Councillor Lowe, and Councillor DeRoche. You know, there are 4 councillors here. We all want what's best for the park, and I think that's evident, and we're all certainly very willing to work together. So we'll have to wait to the end there, Mark, to get our questions asked, but they are forthcoming. We do have an answer, but I'm going to hold that for staff until the end. But thank you very much for coming out today.
Thank you.
Thank you very much.
Thank
Mark.
you.
It sounds
Thank you
like
for the
you have the A team behind you in terms of councillors willing to chat and figure this out for you.
Thank you.
Okay, wonderful. We're on to delegation number 9, Claude Bouchard. Thank you, sir. Please proceed.
Bonjour.
Bonjour, monsieur.
Merci.
Good morning. Thank you for allowing me to present to you today in front of your committee. I'm very happy to do so because I think I have some good items to bring to your attention. I'm Claude Bouchard. I'm from the Bywine Market. I was recently elected president of the BMSC, of the retailers in the Bywine Market. My presentation will deal with the concerns that we have, and I'll try to limit myself to 5 minutes. I eliminated quite a few points. In 2016, a consultant firm was hired to prepare a plan, an action plan on the Bywine Market that we call revitalization of Bywine Market. I don't believe I missed one single meeting. And in the report presented by the consultant, it was mentioned that some items dealt with Bywine Market, namely the second floor development and the public bathroom and things like that. But several things had to do with the area of the Bywine Market and not necessarily the market. I was convinced that the focus of this redevelopment would focus exclusively on the existing market, which attracts tourists for several years. For the past 4 years, we noticed that the round signs indicating Bywine Market were installed here and there in this area. And there were other signs that were installed to indicate that the sector was to become the by-wire market. I intervene often in the media that were giving all the drama in that area, but that everything was happening in the market. But at several times, there were some dramatic events on Nelson, 2 streets past the by-wire market, that were identified as being right in the heart of the market in the media. I checked with the city for the survey to find the difference between the sector, the area, and the market itself. Obviously, the market and the area were zoned differently. There are 2 different things. I would have liked to have slides for you, but I think it's clear enough. Several times I tried to explain that that could have negative effects on the image and the reputation of the market when us, the retailers, are doing everything we can to attract the tourists and to represent Canada. Obviously, we know that you can't use the name of someone to other ends, but since January 2023, it is officially said that the zoning in the zoning bylaw that the by-wire market has become the by-wire market. The whole area has become the market. How can we contribute financially to the redevelopment of the market and to the celebrations of the market, which will turn 200 years old soon, when the market is not keeping its original state? It does not exist anymore. The negative effects are the following. All the events that take place in the by-wire market, like this week, there was a murder on King Edward in New York. It was identified as being in the market in the newspaper, which means that all the businesses in the market benefited, in a sense, of this bad publicity for something that happened 5 corners away. It's bad for everybody. Instead of simply focusing on one address, we are generalizing it to the whole market. If we continue to want to invest in the revitalization of the market, this has to change. We want the market to continue to attract tourists from everywhere in the world. The by-wire market management should not be neglecting the attraction of the market. The second floor of the building at 55 Byward could have been revamped to make it accessible to everyone on several occasions. So making a meeting room, a exhibition hall, a showroom, press conferences place, but now we just can't use that. With the revitalization, we were supposed to close the second floor so that it would become more accessible. It's on. Oh, your time is over already? And I see that there's no question for you. Ah, yes? I'm sorry, I didn't follow the procedure here. Thank you for your presentation. I think it's the first time I meet you. I'm the new counselor for the area. I'm very happy to meet you. Maybe we can meet separately to discuss this. The revitalization of the by-wire market is very important to me because it's the jewel of the community. It's a place that we must take care of. And I think that there will be delegations in the future that will talk about the over-concentration of services in the by-wire market. And it's not working too well with the revitalization. I'd like an area that's welcoming to everyone, artists, retailers, the Rideau Center, students, and so on. But I'm very happy to meet with, I'll meet with you again after today. We'll talk about solutions and we'll organize a kind of a town hall at the end of March. I'll keep you informed. And this is only to be discussing with the retailers in the market to see what's important for them. Well, what's important here is the impact of all this. It's not really local, it's citywide. It's at the national capital level. We are the ears and the eyes of the market. We're there on a daily basis. So we can answer questions because some clients come to see us and said, well, listen, we went on the street over there, but no, that's not the market. So there's an exercise to be done here. We'll think about it all and assess the impact of the current situation on something that is the most visited area of the city and the most representative area of our culture. Thank you so much for your coming here. And could you please leave me your coordinates and we can talk together next week.
The next delegation is Ms. Trish McPherson from Align Vest Management Corporation.
Thank you very much, Madam Chair and committee, for the opportunity to come speak with you today. Just by way of introduction, Align Vest Management Corporation is the parent company of Align Vest Student Housing. The company launched in 2018 with the goal of consolidating student housing and providing student housing across Canadian university and college markets. Our goal is really to provide safe, secure, and convenient living for post-secondary students within in the country. We're now Canada's largest university and college-focused student housing provider. By bed count, we provide housing for over 5,208 students across the country, of which 1,400 beds, a little more than 1,400 beds, are in the Ottawa market. So in context of this particular conversation, to give you a bit of geographic context, we own 3 buildings and operate them in the Ottawa market. One is in partnership with the University of Ottawa. You may know the Annex Student Residence and on Laurier. We also own 111 Cooper, known colloquially as 111. Right near City Hall. You maybe even park in our parking lot on occasion. And we also own the Theo, which is at the corner of Rideau and King Edward. So again, in the context of this, I really wanted to talk to you a little bit more about the day in the life of students and our employees at the Theo in downtown Ottawa, at King Edward and Rideau. We purchased this building in 2021 with the goal of expanding kind of our safe, secure operating model into the Ottawa market. We purchased it from the Catassa Group, and some of you may know that it was a converted office building. And as part of that purchase, we are a proud taxpayer in the Ottawa market in that area, with over almost $1 million in taxes paid per year for that 12-story building. That one building I'm speaking of at Theo has 528 beds, and we provide 1, 2, and 3 bedroom and 4 bedroom accommodations for students, mainly at the University of Ottawa. They have an ideal living environment within their 4 walls. They have quiet places to study. They have a gym to work out. They have basketball courts, a games room, a cinema room, even a place to do art and to record their podcasts if they so wish. But what I wanted to talk to you about today is the challenges based on the conversations that we've already heard today that we are dealing with within our kind of built environment in that particular neighborhood. I'm thrilled to hear from some of the past delegates about the supports and the support that is coming for mental health and addiction within that neighborhood and across the universe and across the area. In terms of what we are dealing with, again, just to give you context and to support all these programs and encourage you to continue to support all these programs that are coming, we have an ongoing issue with security, safety, and the well-being of our students in that area. Our operating company on average has to call private security at cost that we would bear 6 to 10 times a day. Additionally, when that private security comes, they're doing regular rounds to ensure the safety of our students within their surroundings. Parents are concerned, for those of you that may be parents, and students are concerned walking into their own homes. We are doing the best we can to support the problems in the area and show empathy to the people that are in the surrounding area, but it's becoming an increasing challenge to continue to do business and to provide, again, that safe, secure home for our students. Our maintenance team is working up to 2 hours, 45 hours a week, every day, every week, to clean up around the area. They're dealing with safety issues with the drug paraphernalia that we find in the area. We are dealing with fires that we're calling, with people setting garbage bins on fire, and we're dealing with excessive amounts of human waste that we have to clean up from around our building, again, at our own cost. We have Class A retail tenants in the base of our building. And again, just giving you context, the Dollarama that's located at the corner is having a monthly cost of almost $7,000 to provide security because they cannot provide safe entry to the customers coming into their building. Bank of Montreal has security present from 9 to 5 every day at a cost to them. They've recently had to adjust their hours. They've had to replace ATM machines. They've had to replace broken windows, as have we. So the ongoing cost of doing business for our commercial tenants as well in that area is becoming excessive. We just like to support, ask again for your support for all of these programs to help maintain a safe, secure place for our students, to help reduce the amount of prostitution that's in the area, the threats that are happening, and the damage that's happening to private property on that corner.
Thank you very much, Trish. I see we have a question from Concierge Blanc.
Thank you so much, Trish. I may have missed it in your presentation, but for your 2 student units on the Rideau, how much are you paying in private security?
So there is the commercial private security and our private security. So it's upwards of $10,000 a month between the commercial tenants and us as the owners of the residential portion of the building.
So you are paying for private security, and then as well as the retail on the ground floor is paying for the private security, correct?
Correct. We've also brought in night auditors, for example, which is really just a night concierge. So it's probably even more than that when we start to look at all the ancillary costs of bringing in extra staff, et cetera. But between the commercial and the residential, we own the whole building, but it's around $10,000 a month that we're paying in private security. And that obviously does not include the damage that is done to the building on a regular basis that we're having to repair.
Do you foresee those costs going down? Like, how are you budgeting this going forward? And will the students, I guess your renters, be absorbing the increased cost in security?
We do have a large capital budget going into this year to do more improvements. Unfortunately, we're almost going to have to create a gated community, which is not what we want to do. We're looking at putting large gates that block entrance into the back parking lot at a cost of hundreds of thousands of dollars. We are putting in more security and more key fob access. Unfortunately, we have people that are able to, we call it tailgate, and enter the garage by following people, or enter the common areas, go into the elevators by following people. So we're putting in much more kind of technology solutions as much as we can to avoid that type of thing. So our capital budget is going up immensely in the next couple of years to do what we can, but it's really, as you know, a band-aid for the problem as opposed to addressing the problem.
Can I ask a follow-up? Sorry.
Absolutely.
Through the chair.
And I'll just encourage, not just on this particular delegation, but we are speaking about the Community Services Committee budget. So let's just keep it within the realm.
Sorry, my last question. I know you said you have units in other universities around Ontario. Would you say that Ottawa is where you spend the most in private security?
Absolutely.
Last question.
No question. It is, I would say, more than tenfold worse than anywhere else that we have.
Thank you very much, Trish. I'll move on.
Thank you for the opportunity.
Thank you. I'll move on to our next delegation, John Borston. So we don't see Mr. Borston on the call at the moment. If he does show up in the next little while, we'll add him to the list at that point. But we'll move on to the following delegation, which is number 12. It's Simal and Zinab as Arslan.
Chair, they're not here. They were here earlier. I saw them leave. They're residents in my ward. I'm not sure where they went, so.
Okay, and they're not online by chance? Okay, well, we'll keep an eye open for them. So we'll move on to number 13, Meredith Kerr from the Parkdale Food Center. And I'll just ask you to turn on your mic. Good, thanks.
Good morning, Chair and members of the committee. I'm Meredith Kerr, Director of Communications and Development, and I'm here today with my colleague, Rebecca Doris, Manager of Community Advocacy Program. Since our inception over 30 years ago, the Parkdale Food Center has evolved from a traditional food bank into one of the leading voices and trusted advocates of food security and poverty in Ottawa. We believe in an Ottawa where everyone has the means and opportunities to live a healthy, connected, and fulfilling life. PFC's advocacy efforts are rooted in the human right to food and informed by our annual Knowing Our Neighbors survey. 2022 results revealed that 63% of respondents identified as being severely food insecure. Additional findings from the survey include 45% of neighbors had an annual income of less than $15,000, classifying them as living in deep income poverty. 50% of neighbors have been accessing emergency food support for more than 5 years. 75% of neighbors reporting eating less than they felt they should because there wasn't enough money to buy more. The inability to access the food you need is often linked to poverty, but it is more closely related to income inequality. Until structural and political systems can provide a suitable social safety net for all neighbors, the Parkdale Food Center will continue to raise awareness about the important role nutritious food plays in the physical and mental well-being of each of us, and the cost to society when we neglect one of our most basic human rights, the right to food.
Honoring the Community and Social Services Department's commitment to work with community agencies to ensure strong social infrastructure of coordinated and responsive programs and services for families and individuals in need to improve their quality of life. We ask that this committee consider the importance of food specifically. It is our recommendation that the City of Ottawa prioritize food as well as the people and programs behind it by creating a dedicated line across all community and social service departments, one with robust reporting for transparency. Imagine the resilient communities that would exist if social housing had no-cost produce markets, if community centers hosted lunches for isolated seniors, grew community gardens, and much more. These invaluable food supports would provide much needed relief to social services like the Parkdale Food Center and others in the city who have shouldered this financial burden for far too long. Food is prevention. Food is medicine. Food is community safety. And food is well-being. So let's put food in the budget now. Thank you. Keeping it short.
Thank you very much for your presentation. We do have a question for Councillor Troster.
Hi, I know that we have many delegations today, so I do want to keep it quick. I wanted to thank you for being here. And I will note that, when we had the conversation, when we set the actual projected tax rate for this budget, one of the mayor's arguments was, well, a lot of the inflation is food inflation and our city doesn't buy a lot of food. But the reality is the organizations we fund need to buy food for their clients. You may have heard earlier, I spoke about the impact, or I asked about the impact of COVID-related funding cuts, that funding that was brought in during the pandemic and then taken away. And I know that one of your key programs, Cooking for a Cause, was one of the programs that had to close because of that. I'm just wondering if you could speak briefly about that program and what we've lost with that funding disappearing.
Great question. I think during the SSRF funding, a lot of the funding that came through asked us to expand, asked us to address an emergency that was existing already, but provided us with the valuable funding to do so. So we were able to expand in that way. And at the time when that money first came in for Cooking for a Cause, it really was, people were living in isolation. They were living alone. People were using alone. And food was this door to the touch point for health. So people were able to come out, they were able to access healthy food, but we were also able to have a better indicator as to how they were doing at home. Senior residences, Cooking for a Cause, volunteers could knock on those doors. Now, this is the very early iteration of Cooking for a Cause in those early days of 2020, but it really was this important touchstone for health. And it evolved into this ability for people to access food when they needed it, and it would be consistent. And that funding and losing Cooking for a Cause really was, it's really too bad for our communities, especially in the harm reduction areas in Eccles at Somerset West. People were, users were reporting healing, feeling healthier. And so this is all kind of these pieces that fall to food and how significant food is with our health, but also how we interact as a community member. Thank you.
I'll just add to that. Really, when funding stays stable or when it goes away, but even when funding stays stable, it is a loss, as Rachel Wilson from the Ottawa Food Bank pointed out, when the rising cost of living, not only of the folks that we support, but also of staff raises, when the price of food raises and funding goes away or stays stable, it's a huge cut. And just like the last presenter mentioned, that huge cut is not only felt by citizens and community social service agencies, but also businesses, also visitors like university students. But really the loss is the human element. So when we lose whole programs, we lose all of the relationships that have been built as part of that program, as part of that agency. We lose relationships between service providers and the folks that access the service. We could talk about this for a really long time, but the loss is not just financial or closing certain doors or stopping handing out sandwiches. That's not actually what it looks like on the ground, and it's absolutely devastating. COVID-19 is not over. So the social service relief funding that did disappear, really like the crisis is poverty, it's income inequality, it's continuing, and it is getting worse. So, yeah.
And just to add really quickly to that, this expansion happened for Cooking for a Cause, and Cooking for a Cause really is that example of when the money dried up, the fire hydrant was turned off, and these programs just ceased to exist really quickly. So thank you.
Thank you. Councillor Carr.
Yeah, thanks. I just have a comment, just noting, I know the good work that Cooking for a Cause did, and I know in my community we had Food for Thought that we're also making meals and delivering them to people. And I think it's really important that, we have those programs in place because not everybody has access to a kitchen, not everybody cooks. And so that's what makes it so important. And just, I just want to say that I think it's really one thing that I'm really dedicated to doing is over my term is making sure that we take a look at having a whole food systems approach in terms of how we think about food and quite a lot of different partners and areas of the city would be involved in that. And likely I'll be reaching out to you. I won't keep you here, but thank you very much for all your work in advocacy.
Thank you. Perfect. Thank you, Councillor. Thank you both for being here today, and thank you for the work you do. It's very vital and appreciated. Our next delegation is Anna M. Cruz Valderrama.
Good morning to all. My name is Ana Maria Cruz Valderrama. I'm speaking as a private citizen on issues of funds that come directly from the Community Service Committee budget. My remarks are solely mine and do not represent any group or person. I would like to acknowledge that I am speaking to you from the unceded lands of the Algonquin and Ishavet peoples. Thank you, Madam Chair, and all members of the committee for the opportunity to express my views and concerns regarding the allocation of resources of the older adult plan budget, senior roundtable, and sustainable grants. As a community leader committed to advancing senior issues, I am deeply concerned about the lack of equitability, accessibility, and inclusion of the allocation of resources. Seniors from across the city, from east to west, from north to south, from the urban core to the rural areas have needs, and all shall benefit from the free programs financed with the funds from the already cited older adult plan budget. COVID-19 increased social isolation and continues to pose a threat to a senior's quality of life. A more equitable management resources will offer greater programs with greater impact on the life of older adults across the city. To the point, a funding proposal of $22,000 included expenditure, among others, live stream technician, artist fees, venue rental, piano fees, advertising for $5,000, $5,000 for hospitality, and a reception after the event for $1,500. When on the opposite side of the city, in a small community center with a beautiful kitchen facility, I could only host 13 seniors because there are no 20 chairs that could accommodate seniors. A proposal of $34,000 approved in 50% included healthy eating supplies, meal plans and preparation, recipes, social games, and art supplies. In contrast, seniors from another area of the city have to pay $4.75 every time they gather to socialize and do some crafts. Information and coordinates regarding concert offered in partnership with the Bronson Rise in person and live streamed from July to December. Those coordinators were held. Therefore, the private seniors across the city or other adults to take opportunities of the free entertainment opportunities. Sustainable grants. An organization provided social and recreational activities for 1,500 seniors and people with disabilities, received $246,000 in funding, while other organizations working with over 3,000 seniors got only $75,000. This concern practices causes stress, frustration, and mistrust. While the city, to a certain point, failed to provide free physical exercise for seniors, with some efforts, I found two organizations out of the city, one in Toronto and one in the state, providing activities for seniors free of charge. Dancing with Parkinson for Toronto, with the rise of COVID, opened the doors for seniors and people with Parkinson across the country to join the activities every single day. Today, we are over 3,000 members. Senior Planet in the state offer opportunities for seniors, and it's an overwhelming, from Monday to Friday, it's an overwhelming feeling to feel welcome for somebody outside your city, to know that somebody else cares about us. My recommendations: the city must assume the sidewalk repairs rather than taking the scare funds for the older adult plant, a small budget. The City Transportation Committee approved $7.7 million to renew, repair sidewalks and pathways. Training and education and awareness for city employees so they understand that the older adult plan is to address needs of all of the adults across the city rather than picking and choosing neighborhoods. We all must learn to deliver programs with limited resources. Increasing taxes is not the solution. Those in position of leadership at command shall pay attention to valid suggestions and answer questions rather than ignoring communication that bring to life concerning practices. If the seniors table is not to address all the adult needs with the lens of equity, inclusion, and accessibility, it's better to dismantle. Thank you for allowing me to share these uncomfortable truths and experiences that call for equity, accessibility, inclusion, and kindness. Thank you so much.
Thank you very much. We have a question from Councillor Kavanaugh.
Thank you very much, Anna, if I may call you that. Appreciate your delegation. We just heard earlier from Old Forge, who gets funding for seniors that from the city. Is this the kind of program you're looking at? Because that is something that we do fund, and perhaps we should be doing more of that in our budget.
Yes. Councillor Kavanaugh, I'm not looking for increase on taxes, just that the pie has to be cut in equal pieces, and we all share more responsibility in delivering programs with more, how to say, conscious responsibility. Okay, that's all, because it can be done. I work with a very small budget. It can be done. It's commitment and equitability.
Yeah,
Thank
no,
you.
and that's what they do, and I thank you for your delegation. Keeping seniors healthy in our community is in the long term saving us money, as we all know, in the healthcare.
Yes.
Thank you.
Thank you, Councillor. Councillor Bradley.
Thank you, Chair. I also wanted to thank you, Anna Maria, for your delegation today, and particularly for your advocacy around more equitable distribution of funds and programming across our city. I know that's something that you and I have spoke at length with. I have met with staff on many of the issues that you raised, and certainly want to connect with you again on your concerns. And I'll have some questions to staff later. So I really just wanted to say thank you again for all your work with seniors in our community.
Thank you, Councillor Bradley. And again, I'm not speaking on my behalf. I'm thinking in others that don't have the ability and the skills I have to find resources to keep me busy and entertained. It's very hurting. We have to seek outside the city. That's my concern. We should allocate the funds, the small funds that we have, in an equitable and inclusion manner. Thank you.
Thank you very much, Anna Maria. Very much appreciate that. We'll be moving on to our next delegation, Sylvie Bigras from the Lower Town Community Association.
Bonjour et un grand merci à vous tous. Je suis la présidente de l'association.
Thank you very much. I'm the president of the Lower Town Community Association.
I have lived in my little tiny house in Lower Town for 41 years. I always say I was 8 years old when I bought it. I babysat a lot and put away some money. Anyway, I love my community. I love my little house. And I want to do what I can to help everyone in this community. So today, what I'd like to share with you is the reality of living and working in Lower Town. I know that today is actually a budget exercise, and I'm not going to be asking for more money or attributions here and there. What I'm going to be asking you to do is look at more how you use this budget envelope that you have to reframe and sort of re-strategize, replan, and how you deliver social services in a very big picture sense. Right now, there's a lot of fragmentation. There's a lot of non-alignment. There's a lot of incredibly hardworking, exhausted, well-intentioned agencies, providers, volunteers who are working together. But I think the City of Ottawa can take a huge leadership role in non-fragmenting and putting together a more big picture, 10,000 feet strategy as to how we can do things better. The reality of living and working, visiting Lower Town is not a good one. You just heard from Trish about Theo and the staff having to clean feces off the front, you know, thinking of gating that community. And it's incredible that we're actually having this conversation about downtown of the nation's capital. You know, we have families whose children can't play in their front yards because there's too many needles. The same thing with parks. I have a homeless friend. We've gotten to know a number of homeless people. In 41 years, you get to know them really well. You know, who said yesterday, walking back from Center 454, she went to do her laundry there and she was assaulted on the way back to her shelter. You know, so the vulnerable are having as hard a time as we, the residents, as the businesses, as the tourism sector is. And so what, you know, people say that the system is broken, that we need to do something different. So what I'd like to do is talk to you about how we can work differently. This is arising out of many meetings and conversations that I've had with providers, with mental health experts, with city bureaucrats, with elected officials. And basically what we need is one, a citywide strategy led by the mayor and you, members of the council, that follows a strategy and plan on supporting the vulnerable. Right now, there's no real mechanism in overarching governance for all of these organizations. Two, we need to go with small service models spread out throughout the whole city. Can you believe that a Fitzroy Harbor, Carly told us, Fitzroy Harbor youth has to drive to George Street to get services. That sentence in itself is a snapshot of what is wrong with how we're delivering services. We're bringing them all to Ward 12, centered a lot in Byward Market, Lower Town, Sandy Hill, and Vanier, and yet these people are not getting the help where they need. Mental health experts will tell you a small scale model, not next to a mega shelter, away from others, will have success. In my little house, there was a 12-bed detox across the street for many, many years. The guys, we call them the guys, were our neighbors, our friends. They were members of the community, and there's a lot of dignity in their being considered neighbors and friends. There is no dignity in living in a shelter. So small scale models spread throughout the city. And number 3, a moratorium on any new social services in Lower Town, Byward Market, Sandy Hill. You'll hear from Vanier later. We cannot keep bringing more services in an area where students have to walk through feces to get to their frigging dorm. You know, come on now, let's be realistic here on how bad the situation is. We're not NIMBYist. We're not saying not in my backyard. We know the homeless by name. We help them. I meet with them regularly. You're going to hear from someone soon who advocates for the homeless, and we're listening to her. Her voice is very important. The bottom line, we, the entire city of Ottawa, all of you, all of us have a duty of care to share the responsibility. Don't tell me your ward doesn't have mental health, drug addiction, and homeless issues. It's everywhere. We can be much more strategic in helping the vulnerable and helping our citizens be able to walk around their own neighborhoods safely, helping our businesses create a clientele and grow their business, helping more tourists come to the jewel of Ottawa that is the Byward Market, the historic community that is Lower Town. I will use my last 10 seconds to say merci beaucoup à vous tous de votre attention aujourd'hui. Happy to take questions from any of you. Thanks very much.
Merci, Madame. You do have a question from Councillor Troster.
Hi, Sylvie. Thank you for being here. And I do appreciate the compassion that you are expressing towards people experiencing homelessness in our city. Although I do just want to say I represent Somerset Ward. We do have a great number of shelters. We have the most rooming houses in the city and the highest rate of poverty. So I understand what it's like to live in a neighborhood that has a concentration of services. I just want to pick apart one argument, though, because to say that you want a moratorium on services, the argument that I make in my community, where we also have a safe consumption site, is the problem is not that the services is there or is that there's too many of them. The problem is that they're not able to meet the needs because they're not funded enough to do the whole job. So in my ward, for example, we have a safe consumption site that closes at 5 p.m. Well, people who use drugs don't stop doing drugs at 5 p.m. And so I'm really interested not in, certainly in my ward, not in moving services out of the ward or preventing more services from coming in, but ensuring that the services that are there are able to meet the needs. I do agree with you that we do, rural and suburban communities absolutely deserve services, but I do think we need to understand that people experiencing homelessness are our neighbors, and moving them out of neighborhoods against their will, moving them out of neighborhoods that are not necessarily walkable or transit rich for folks who don't have cars could also be of great detriment. So I understand where you're coming from. I share the view that we need to decentralize some of our services, but I really think it's a mistake to say no more. I think we do need more. We need more everywhere. And
we need more across the entire city. And also what the mental health experts tell you is the small scale models are actually much cheaper. So longer term, we actually could put more money back into the system because people do get better and they get off the street. And so, I'm not an expert on mental health, and I would love, for people's mental health experts to be involved in this big strategy and plan. But I do admit that your ward does do a lot. Is St. Luke's in your ward? Is St. Luke's in your ward?
It is, yeah.
So when it burned, I was just so impressed with the community's response. They said, this is important. And there is just this whole, work done by volunteers, by yourself, I'm sure. I think it went to Bronson Center as a temporary. And so right away, the community rallied around St. Luke's and made sure that that service wasn't lost. So kudos to you and your community. And I know I speak from Ward 12 because that's where I live, but I know the reality that you have as well. So thank you very much.
Yeah, and I also share your belief and your conviction in supportive housing with wraparound services. And I know that Councillor Plant shares that view too. And I think there is tremendous support on this committee to move from shelters to homes. The question is how quickly we can do that. So thank you so much.
Thank you very much, Councillor. Thank you very much, Trish. So our next delegation is Christine Vincent.
Can you hear me? Hello?
Yes, we can. Please proceed.
Okay. This is new technology for me, so I'm just learning how to do a Zoom call. Okay, thank you. My name is Christine Vincent. I was once homeless. Now I'm helping the homeless and also have been a resident for a number of years in Lower Town and experienced the impact that both the homeless and residents are trapped in our never-ending cycle of what I can only describe as insanity. These are the messages I wish to share in the 5 minutes that I have to share. One, we need a triage system towards affordable housing. The difficulties of putting everyone together in a mega shelters is not working. You cannot put people who suffer from different issues, such as poverty, homelessness, drug addiction, mental health, together in one huge shelter with no proper supports in place, or total chaos erupts as we are experiencing today in Lower Town. A possible solution to this would be have 2 small buildings, for example, for the mentally ill to live with a full support of mental health workers, social workers, etc., taking care of the 2 buildings in another ward. 2, mega shelters so close together with the many problem clients have led to major harassment, violence amongst clients, even predators following the clients. This is the reality of the problem. 3, this is not only the reality in the shelters, but it follows them in the drop-in centers and places the homeless eat as well. There is prostitution, drugs, sexual predators, rape, transvestites don't have their own space, masturbation, robberies, shootings, stabbings, police searches, along with police harassment. In other words, Lower Town has become a shit show. Not only as a former homeless person, as well as a resident of Lower Town, I feel both for people who are homeless, as well as the never-ending cycle of backlash this has caused for my fellow residents of Lower Town. I could not ignore my calling from my heart towards everyone to rise up and speak out on behalf of everyone. In doing so, I became involved with the Lower Town Community Association, the councillor for our ward. Also, I give a voice to the homeless by setting up a YouTube channel called Christine Lower Town, so the homeless would have a voice, a safe place to have a conversation about their concerns. If you want to know more, go to my YouTube channel, Christine Lower Town. As there is more to come as well, I'll be happy to answer questions as well. I wish to also state before I wrap up, please do not ignore Lower Town, as Lower Town once was and can still be the jewel of the heart of the city of Ottawa. The diversity we have here is unique and should be treated as such. It brings tourists from all over the world, as well as City of Ottawa residents to the Ottawa core. Residents and the homeless as well are.
Oh. Christine, sorry. Are you still there? Okay.
Yes, I'm sorry. I'm also a senior. I'm on Meals on Wheels. They just are bringing in, I had to open my door.
Okay, that's okay. So I see we have a question from Councillor Plant, so I'll turn the question to her.
Okay.
Thank you so much. Again. Thank you so much, Christine. One of the items I had campaigned on was possibly putting together sort of an advocacy group for people who are living in shelters to sort of advocate for better conditions in the shelters and see what they wanted and what some of their needs were. I admit I haven't had time to really develop this or look into it much further, but you've motivated me now to get off my duff and do something about it. So I will be reaching out in the coming weeks, or as will someone from my team, to reach out to you, and hopefully we can get something off the ground of men, women, children, and all the people who have to use our shelter services to advocate for a better system for everyone. Thank you so much for your advocacy.
Well, I also wanted to add that when you were talking about Theo, I've had to escort some homeless people back and forth to the bank at the corner there because when they want their drug money and everything else, they'll escort them right to the bank and they'll even try and extort more money out of them. I've seen it myself firsthand. So we have a serious problem down here, and I agree with you. We need to do something, and I'm fully on board with you, Stephanie.
Thank you, Christine, very much for being here. I just want to advise before we move to the next delegation that we'll take a break shortly. I gave you hope and then I took it away. We will take a break. I'm hoping to get through at least half of the delegations. Right now, we're at number 17. So I'm assuming our break will likely come at about 1-ish, depending on how many questions we all have and how long delegations take. So I'm just flagging that, but we'll try to continue through because I recognize that these delegations are taking time out of their day and it's important that they have the opportunity to speak to us. So now I'll move to number 17, Jessica Rodig.
Hello, can everyone hear me okay?
Yes, we can.
Okay. I'd like to start by thanking you so much for allowing me to speak during this meeting. I truly appreciate everyone's time. I have been working downtown Ottawa for over 7 years, and over the last 2 years, I've noticed a big difference in my experience in the market, and especially inside the Rideau Centre, including the store I work in, which is what I'm here to speak on today. I would also like to mention that I live within Councillor Wilson Lowe's ward, which is Barhaven East. However, my biggest concern as an Ottawa citizen is the downtown core. All right, I'll just dive right in. So I pay for a parking pass to park in the mall's underground parking lot in order to come to work. Down there, I have experienced being followed, yelled at, and have seen numerous overnight camps and drug administering going on. I was leaving one evening and a woman in an SUV was sharing her concern with one of the parking attendants as she paid over $20 for parking and 2 troubled men were banging on her car door, scaring the children inside that she had in the back seat. It often takes me longer than usual to get to my store entrance because I refuse to use the mall stairs due to blind spots and many troubled people administering drugs, fornicating, or using these areas as washrooms. Having to walk around needles and every bodily fluid you can think of, and this is not just something that I have to avoid in those staircases. This is something that is prevalent all around the mall and downtown area. From the parking garage, instead of taking the stairs, I take the elevators up to the 3rd floor of the Rideau Centre where I work. When the elevator arrives, I will not take it if there is a troubled person in it already, as I have been harassed inside the elevator before. A man twice my height lunged at me in a closed elevator and cornered me inside on my way up to work. I was thankfully able to escape past him when the elevator doors opened. This experience is something that haunts me daily and has only added to the constant shoulder checking and fear that I have when downtown Ottawa. I also often must step out of the elevators in the mall if there's a troubled person that steps on at another floor in the middle of my ride up or down from the parking garage, slowing down my commute to work even more. Inside my store, my staff have witnessed and been targeted by many troubled individuals. We have been on the receiving end of verbal abuse, aggression, use of weapons, inappropriate gestures, hate speech, public masturbation, and vomit. And we have had to clean up after broken glass pipes, thrown food, used needles, human feces, and many other bodily fluids, just to name a few things. And when we ask for our in-store security team to help, and it gets to this point, we're asking these individuals to leave. Sometimes watching the exit of these individuals is traumatic, as some do not leave peacefully. This holds up our customer experience and blocks off public or private areas such as bathrooms and baby rooms for nursing mothers for lengthy amounts of time. It concerns me that people will be scared to come to Ottawa to tour it when this is the way that I am feeling, and I may be even a little desensitized at this point. So imagine what this will eventually do to tourism and Ottawa's downtown businesses. In a world where it is easier to shop online than in store, why would people make the trip to shop downtown or just visit within itself, walk the streets of the market and enjoy the surrounding areas if I come here every day and am terrified by what may happen to me or my coworkers? I have hope we can help these individuals that so clearly need our support from our city. It is not a simple solution. It is one that requires long-term support in areas such as mental health, safe places to detox, support with rehabilitation, first aid, safe injection sites, long-term supportive housing, and food. Thank you again so much for your time today.
Thank you very much. You have a question from Councillor Lowe.
Thank you, Chair, and thank you for your presentation. Unfortunately, I was away for half of it because I had to take a meeting elsewhere. I'm told you are a resident in my ward, so if you'd like to reach out and chat a little more about what you presented here at the committee today, I'd love to do that.
Yeah, for sure, I will.
Thanks very much.
Okay, thank you. We have a question from Conseiller Plante.
Hi, thank you so much for your presentation today. I hear a lot of stories about women, especially young women who work in the Rideau Center or who bartender waitress in the Byward, and who are very, very scared and face on the daily basis the same challenges that you are facing. So thank you for speaking up. I know you're not alone. I know you're not alone. So thank you for not only speaking up, but for also advocating for long-term solutions. It's really, really a tough challenge, and we need all hands on deck. So thank you very much.
Thank you.
Thank you so much, Jessica, for being here. And you know, as my colleague said, thank you for sharing your experience with us. It's certainly being heard. So appreciate it.
Thank you.
Our next delegation is Marilyn Wall from the Child and Youth Permanency Council of Canada.
Hi, it's Marlon, actually. No I. Everybody keeps thinking I spell it wrong. But so thank you, Madam Chair, and thank you to the committee for allowing this opportunity, and not just for myself, but for so many others that came ahead of me. I'm the Executive Director for the Child and Youth Permanency Council of Canada. And for those that might not know it, we're a national nonprofit voice that's really supporting and looking at the children and youth and finding permanency for especially women and children and youth that come in and out of care of the child welfare system. So if you're talking about a vulnerable population, which so many ahead of me have spoke about, this is the work we do. We network with provinces as well as territorial governments in terms of finding safe, affordable permanence for our children, whether that be in a home with a family, kinship care, adoption, or looking at permanency for our youth that age out of care with no supports and no family. So one of the things that why we're here today to speak with you is that we have done reports and we're listening, and we value the voice of lived experiences for the children and youth that have aged out of care. And we've worked for over 5 years on a study and wanted to present some of their representation. You might not be aware of it, but in terms of this demographics, 89% of the young women that age out of care are homeless. 89%. The overrepresentation in terms of Indigenous and Black women in care is tremendous. And that's not just in Ottawa, we're talking across the country. So now you're looking at a population of primarily BIPOC, young women plus, and 89% of them are homeless. 91% of them report mental challenges. 66% in terms of some early childhood adversity, that they've gone through some adverse experiences, especially neglect or violence. 80% of them become involved in the justice system. 63 in terms of self-reporting for addictions and substance misuse. 37% talk about sexual assault. We just heard some incidences of that now. And 23% are survivors of human trafficking. I wanted to give you a little bit of the sense of who we're talking about. And these are young women and children that have come out of the child welfare system. So I'm actually challenging you to think that we're actually their parents, that the city is actually their parents, and we're talking about providing homes for them. We have actually done some research. We're working with Carlton U and a number of other partners to look at providing housing, affordable housing, and it's actually would be free for many, but to look at providing a community and a home for them within the city of Ottawa. We want to use the city, mentioned before, national capital. We want to use Ottawa to pilot the project and actually bring it across the country. And initially thought I'd come out and say, hey, here's what we need. And I'd actually changed it after listening to so many of these presentations to tell you, here's what I could offer to this city with these young people who are resilient, who could give back, who could be part of the solution for some of the challenges that were already presented here today. Our plan for this holistic hub that we would like to design and build for these young women involve giving back to green space, involve mentorship. It involves growing and maybe self-maintaining in terms of a food source, but it could also give back to food banks. So I'm actually wanting to switch this around to say, here's what we can do for you. What we need some help. So for the city actually to look at any surplus buildings or lands that's in the city. One of the things you've talked about lots is how to refurbish or how to do this. We actually have worked with Carlton U to help to do that. And then not to play on words, but for the city to adopt us as one of their projects. They would like to move forward towards CMHC for their granting, but adopt us as one of the projects that you might want to put on your shelf and dust off and take our ideas forward with you alongside beside us. Thank you so much for your time and thank you for the opportunity to speak.
Thank you for your delegation, Marlon, and thank you for correcting. We have a question from Councillor Kavanaugh.
Okay.
Thanks, Marlon. I appreciate this. And it looks like you're looking for supportive affordable housing.
Yes.
And okay. It sounds like a great idea for this community. I'm the chair of Ottawa Community Housing, so I'm trying to figure out how it could work, and I can't speak for them right off the top, but it's something, and it's an idea we could bring back. But I think that it's important to talk about where it would fit in, because obviously it's a smaller scale and not, which probably be better for everybody.
Would it help you to say that you've been on our radar? And I definitely want to know how we could work together, because I know you might have some property that you might want to refurbish and repurpose, and it would be an absolute fit.
Well, we're talking budget today, and it's all about the money. One thing is land, another thing is capital funding to build things or refurbish, what the case may be. But it's an interesting concept, and I cannot speak for OCH off the top of my head but I think it's worth a conversation for sure. And I appreciate your delegation. And frankly, the thing is with supportive housing, OCH doesn't specialize in supportive housing. It's a different category, but it can be partnerships. So just to make that clear.
Awesome. Thank you.
Thank you.
Okay, thanks. Thank you, Councillor. Councillor Hill.
Thank you very much, Madam Chair, and thank you, Marlon, for the delegation. It was great to speak with you as well a few weeks ago. And just with some of the statistics that you gave, I'm looking at the number of people that we're looking out from the Aging Out program, 80% getting involved in the justice system, disproportionately from, vulnerable populations to get from the get-go. And I would just strongly encourage that, we have an offline discussion about perhaps how Crime Prevention Ottawa could provide some support to that initiative. Thank you.
Thank you. And just to add to what people have said before, this is more preventative and hopefully will be self-sustainable. So it's not about a long-term need for financial support, but definitely a program that is intended to be self-sustained.
Wonderful. Thank you very much for your delegation.
Thank you.
Next,
Thanks again for the opportunity.
The next delegation up is Nathan Pryor from Childcare Now, Ottawa. Okay. My understanding is he's stepped away, so we'll keep an eye if he returns back. The next up then would be Ray Shinada from Nordstrom Cadillac Fairview.
Hello, everyone. I've come before you today as someone who manages a business in downtown Ottawa. Nordstrom Rideau employs over 250 people who live across the Ottawa region and serves countless customers who come to us from all over. I must bring to your attention the dire issue of safety for my employees and customers and address a pressing matter that affects not only our downtown core, but also the communities that surround it. It is a matter that requires our collective attention and meaningful action. As you are all aware, we are faced with complex issues that require multifaceted solutions. Yet in my experience, time and time again, it does feel like we resort to an either-or approach that fails to take into account the broader context. The issues, as you all know, are stemming from an opioid crisis that then creates the domino effect of mental health issues, homelessness issues, lack of enforcement, and ultimately leading to the safety of my employees and customers. Based on what I've heard from many of the speakers today, sounds like we all have a common ground and shared interest in tackling the issues that I am highlighting today. So perhaps the best use of my time is to share with you some of the outcomes of not funding everything from social programs to appropriate levels of enforcement. Jessica's concerns are especially near and dear to my heart, as this is exactly what we are looking to address. So earlier I had mentioned an either-or approach to dealing with our issues. Let me draw to you the attention of Vancouver's harm reduction approach, being a longtime resident, born and raised in Vancouver. While I feel this approach is commendable, it lacks balance as it neglects recovery and addiction help services and enforcement measures. This has resulted in a continuing and escalating issue that affects not only the residents of Vancouver, but everyone that visits and frequents Vancouver, both domestically and internationally. While Ottawa hasn't come to that point, we are starting to see similar problems in our own city. Like Vancouver, the incidents we have witnessed in our community and Rideau Centre are being committed by repeat offenders with a criminal record, and most commit these crimes in the attempts to fuel their addiction. Despite arrest, these individuals come back to the mall, sometimes the very next day, to commit the same crimes. One of many examples is that we have lost over $12,000 in sunglasses to one individual who is particularly aggressive due to this. Moreover, another one of our repeat offenders is banned from using shelters, leaving him with no other option but to loiter in a public space or in a mall. The systems, in terms of a repeat offender, may be the product of federal policies, but as a city, how are we taking responsibility to work towards reforming it to reflect the current reality that we live in? I understand that this is not a problem that can be solved overnight. It requires time, money, and resources. However, we must take actionable measures now. We owe it to the residents of our city to provide them with a safe and healthy environment to live, work, and visit. I apologize that I'm not versed enough to speak to a specific dollar amount or policies that can contribute meaningfully and propose these actionable measures. So I'll share just a small portion of what my employees and customers go through on a daily basis. My employees have been physically and verbally assaulted. Most recently, one of my employees was pepper sprayed directly in the eye and beat by a swarm of young girls, 14 to 16 years old, who were known to the police and mall security for concealing weapons. My asset protection manager has been verbally abused by repeat offenders on a daily basis. I can't imagine the toll that takes on someone's mental well-being. He's even had a box of syringes thrown at him. We've even had a known arsonist set fire to product on our floor. Fortunately, no one was injured, and one of my staff was able to smother the flames before it spread. But this is not part of his job description, and having worked in the retail industry for over 20 years, it's unbelievable that he needed to take action. Like Tristan Sylvie before had mentioned prior to me speaking, we have also had to clean up feces from our property as well. Drug use and thefts are rampant. Our location has lost an estimated $250,000 due to external theft, and customers are scared to shop in the area. The worst one involving an 8-year-old girl having her shopping bag grabbed from her, gifts that were meant for her newborn sister. This is unacceptable. Every single one of these examples, they've happened between December and February. What we need is a comprehensive solution that addresses all aspects of the problem, from homelessness to enforcement, harm reduction to recovery services. It is an approach that balances all sides of the equations and creates a healthy downtown core that benefits everyone. Tackling the repeat offenders portion of the problem, I believe, is a low-hanging fruit that could be a catalyst in moving the needle in the right direction. Therefore, I urge you to consider this matter and fund it appropriately and work towards a comprehensive solution that ensures the safety and well-being of all residents and visitors to our city. Thank you.
Thank you very much. We have a question from Conseiller Plante.
Hi. Every time.
Sorry, Ray, do you just mind telling me what is the average age of your employee at Nordstrom's, would you say?
Probably between the ages of 23 and 33, but we have people as young as 20 right up to the age of 75. So.
And would you say because of the situation downtown, you experience a lot of staff turnover?
Yes, that is definitely a big piece. In fact, we have employees that quit their jobs in bywords thinking that Rideau would be a little safer.
Okay. Yeah, I was also just going to ask, do you ever speak to the other sort of stores in the Rideau? Do you guys ever get together to talk about this?
Yeah, most recently, I've spoken with the I believe she's the merchant director of Simons, who's our direct competitor right across our store. The Sport Check general manager is someone that I've been trying to connect with, as well as Brian Ohoski, who is the general manager for CF Rideau. We just had a meeting with their security manager, Matthew Little, just this morning, right before this meeting.
Great. I look forward to keeping that conversation open. I think it's going to be a bit of a gnarly summer, but hopefully we can get things back on track. Thank you so much.
Okay, thank you. We have a question from Councillor Troster.
Hi, Ray. Thank you so much for sharing your perspective. And I do have to say, in many ways, it reflects similar things that I'm hearing from business owners in Somerset Ward because we are neighbors. I just want to pick apart, though, because, this is Community Services Committee. So we're not the police board. We're not involved in enforcement. So I just want to be really careful about the conflation between criminality and poverty. I just think we need to, it sounds like some of your employees have dealt with some terrible incidents, and I am sorry about that. And I agree that unmet social needs are more likely to lead to crime. But I'm just interested in what specific social services response you are here to advocate for.
Well, one simple one is that if someone is, say, banned from a shelter, what options does he have left other than loitering in a public space?
I agree with you. Absolutely. And I mean, you mentioned that calling the police on someone, they come back the next day. And I think that's the point that I'm trying to make, that it really is our role to solve homelessness, and police enforcement is certainly not going to end it. But I do wish nothing but safety for your employees, and thank you for bringing that forward.
Thank you.
Thank you very much, Ray, for being here. Our next delegation is Bethany.
Good afternoon. I firstly want to thank you for the opportunity to listen to me speak. My name is Bethany West. I work at the Rideau Center. You actually heard from one of my colleagues, Jessica, earlier, and I've recently connected with Ray, who just spoke. So this is a big problem that I would like to talk to you about. So I've been employed at the Rideau Center for 6 years. I genuinely enjoy my experience working downtown. I have the opportunity to meet people from all over the world when they visit the Byward Market, when they explore Parliament Hill, and I feel really blessed and fortunate to have that experience. Unfortunately, within recent months, it's not quite as nice of an experience. I'm sure it's not lost on you, and as many of the people before me have mentioned, the conditions downtown are rapidly deteriorating, and we want help. I'd like to share with you some of my personal experiences working at the Rideau Center. So I arrive at the center early in the morning most days to find people sleeping on the floor, sleeping on the benches. Often I must step around them to access my place of employment. These encounters are uncomfortable, but they're the least of my worries. I've been spat on while walking through the mall in the middle of the day. I've been cornered by a man with an uncovered needle, who later approached me another day and yelled profanities at me as he approached. I had to close the gate to my store and lock it to keep him away from me. I've encountered people overdosing in the back hallways. I've encountered groups of people who appear to be living in the underground parking. I have witnessed people masturbating. I've witnessed people smoking and injecting substances out in the open, and have even had to hold the door to our store open so that smoke can dissipate from our customer spaces. And I'm not talking about cigarette smoke. I'm not talking about marijuana smoke. Like it's bad. I've witnessed customers being assaulted. I've cleaned up blood, urine, feces, and vomit. And I've held my colleagues while they cry about the experiences that they have had. If that isn't enough, last week I told some of my teammates that I would be speaking here today. I asked if they wanted me to share their stories with you. They gave me a 3-page list in point form, and I'm going to share some of that list. One associate was attacked on the O train on her way to work. Were followed to our employee entrance. One associate said they don't feel secure when they're outside of the walls of our store, and people will bang on the windows of our lunchroom to harass the people inside while they're having their lunch. One associate was asked for change and then screamed at when she didn't give any. Another was chased down Rideau Street. Another was followed through the market onto the LRT and to her stop. We witnessed multiple people overdosing in mall bathrooms and on Rideau Street. One witnessed a man be beaten so brutally that he started to have a seizure. Another associate saw a man sleeping on the ground outside of Joey while another man urinated on his face. There are groups of men constantly getting inebriated outside on the rooftop of the mall. While working in a display window dressing mannequins, men make lewd gestures, knock on the glass, and take photos of our associates. We see men touching themselves on the street often. We see people running into traffic. And some associates have witnessed a man running through our back store with a needle threatening to stab their colleagues. For 5 days of the week, many of us are living in fear. And I know, Councillor Truster, you said that this is not the place to bring sort of these policing concerns, but the solution is helping these vulnerable populations. The opioid crisis is just that. It's a crisis. The mental health and substance abuse issues taking place in and around the mall have reached a terrifying level, and the problem is continually getting worse. Take a walk through the Rideau Center. I please invite you. I will give you a tour of what we see every single day. We need your support to address the safety concerns for the sake of our staff and patrons, and to improve the services available to the most vulnerable residents of our city. We would like to see more community spaces and youth programs, as well as supportive housing. We want to see efforts made to end the stigma attached to homelessness, mental health, and addictions. Our community is hurting, and they need us to make them a priority. I believe that an investment in our vulnerable population is an investment in all of us. Thank you for your time.
Thank you, Bethany. We have a question from Councillor Troster.
Thank you so much. And I'm so sorry for what you're experiencing. And I really want to thank you for coming here. And I hear similar challenges in my neighborhood that I represent in Dundonald Park, particularly from women who feel unsafe. So I want to clarify, I think everyone has the right to feel safe and be free from harassment in our city. But just to clarify, so you're suggesting that more resources would help?
Absolutely.
Right. Okay. So this is the challenge. And this is why I want to question some of the assumptions that are coming from folks in the neighborhood, because I think while I agree that we absolutely need services all over the city, it is clear that this area needs more rather than less to target the real challenges. And, something I will also add, you mentioned the opioid crisis. One of the issues that hasn't been brought up yet at this committee is the actual toxicity of the drug supply and how that leads to a lot of the erratic behavior that we're dealing with here. So I know I've personally been advocating for more access to safe supply, which seems counterintuitive, but truly the more that we can prevent people from becoming seriously ill from toxic drugs, I think it will help some of this erratic behavior. And that is a complex response that requires more than just our level of government, but
yes, absolutely.
Thank you.
Thank you.
Thank you very much, Councillor Plante.
This is going to sound really shishi, but can I give you a hug?
Of course.
Okay.
Does that hug come with a question or?
That's it. That's all.
Bethany, thank you so much for being here. And, I'm going to echo my colleagues' comments that, once again, while this is a policing matter, but it's also a community services matter. It's also a community matter. It's a stakeholder matter. It's a people matter. So I really, really am sorry to hear you're going through this. Sorry to hear that some of our other delegations have also experienced similar situations or know of people who've gone through this. And I think you'll see in this budget that we'll be talking about today, as well as future budgets, the city is determined to address root issues as much as we can. We're advocating with our provincial and federal partners to see how we can help fund these things, but we're also adamant that we work with the community to address them. So, once again, your delegation is so very important. And thank you very much for sharing what must have been a difficult situation for you and your colleagues. So thank you for that.
Thank you so much.
Okay. Our next delegation is Chris Pierce from Les Suites Hotel, Ottawa.
Good afternoon, and thank you for providing me with the opportunity to participate today. My name is Chris Pierce, and I have the pleasure of leading our team of hospitality professionals at Les Suites Hotel, and I've been working to increase visitation to our great city for over 20 years. The single largest tourism product of our city is under siege. The Byward Market and Rideau Street are saturated with shelters, injection sites, and crime. I thought the best way to participate in today's budget consultations is simply to share with you the average life of someone trying to run a business in this Byward Market. I arrive at work around 6 a.m. and often find individuals around the property perimeter trying to seek entry to stay warm. I often am requested to meet our team members at the O train station on Rideau Street in order to provide them with safe escort to the hotel. I tour the property to ensure the integrity of all of our entry and exit points, which have been previously checked and confirmed by others moments prior to my arrival, but I still feel the need to do the same moments later. I meet with our team members to reinforce health and safety expectations and our 24/7 locked entrance door mandate with only registered guests permitted entry. It's now 7:30. I take the time to review social media feeds, guest comments on various social media platforms that positively or negatively impact the future marketing potential for our hotel and our city. Yesterday alone, that included an email from one of our high commissions that is located here in Ottawa. This key trading partner country of Canada shared with me, we recently had a senior member stay with you guys and had no complaints about the hotel. However, there was an incident whereby this diplomat and her young family had someone get in their taxi with them and violently started demanding money. We realize that you can't control the environment that your hotel is located in, which is why we can no longer have our diplomats stay with you. Thank you for your support and friendship for the past 2 decades. We're terribly sorry to be in this position. I respond to that email with each of the initiatives that I'm aware of: the Downtown Revitalization Plan, the City of Ottawa Task Force, the great work by Kent Hugh and the team from the Community Services Engagement Team, the pending move of the residents out of the Ottawa Jail Hostel, and the potential inclusion of the OPS Detachment Center in the Byward Market. I also share with her that many downtown cities across North America are working through the exact same challenges. I submit to the fact that this loyal 20-year account generating approximately $150,000 per annum is likely lost. This account would support 2.5 full-time employees each year in our housekeeping team, which most likely are landed immigrants starting a new life in Ottawa supporting their family. I decided to go for a quick walk around the community to clear my head and refocus my attention on driving my employee culture, driving our guest experience, and our financial results. This sequence of the start of our tourism day is real and consistent, and we have another 10 hours of the workday. In our 24-hour business, there are many bright spots, but lately, those moments are increasingly difficult to find and share. Excuse me. This hotel is one of the most secure downtown hotels in Ottawa. For the past number of years, all entrances, exits are locked with keycard access for registered guests only. Everyone is validated. This exposes us to potential challenges, however, protects us in an environment where our city is no longer able to. We have been tracking the incidents in the Byward Market for many years, and the situation in this area is just getting worse, and it's very troubling. As chair of the marketing committee at Ottawa Tourism, my mandate and our goal is to grow visitation for our city. Unfortunately, given the current state of downtown Ottawa, more and more visitors are simply experiencing total dissatisfaction and sharing it on social media platforms. A couple of recent comments to share with you. Rideau Street is the epicenter of disgusting street people culture, syringes and pools of vomit on the sidewalk. Bring a hazmat suit. It's such a scary area. Lots of drug addicts. It was visible. They were on hard drugs. So I'm just reading the actual comments. It's dirty now, and I wouldn't want to stay downtown anymore. Location's good. However, the Byward Market area feels less safe at night than it did a few years ago. I realize many of our other stakeholders have shared some of the pain points that exist on the day-to-day, having to work and live and host individuals within this immediate area. But at the same time, I definitely want to commend the great work by everybody that is here today. Also want to recognize specifically Kent Hugh and the Community Services Engagement Team. As we all know, this team provides a level of in-person compassion to those in need, and also supports the business community to provide assistance when required, and also a level of understanding that may assist bringing the entire community together to support. I hope that the budget increase for this specific initiative
Chris,
is
I'm
enough
sorry.
to cover the 24/7 support that's required.
Chris, thank you
Yep.
very much for your delegation. I'm gonna cut you off there just because we're keeping an eye on the time, but
Yep,
your point is
respectful of
well
that.
taken. I appreciate it. I'm looking around the virtual and the real room here, and I don't see any questions for you, but thank you very much for being here today and providing your experiences and your thoughts on this. I'll now move to number 23 on the delegation list, Steve Ball from the Ottawa Gatineau Hotel Association.
Thank you for the opportunity to address you today. I only hope my presentation is stimulating enough that the councillor wants to give me a hug. As president of the OGHA, I am privileged to speak on behalf of the hotel industry and to be part of an exciting tourism community. I also sit on the board of the Shepherds of Good Hope. The visitor economy is important to our economic well-being. Pre-pandemic in 2019, 11 million visitors spent $2.2 billion, and approximately 2 million of those guests stayed in local hotel rooms within about a 10-minute walking distance of the Byward Market. It's twice our population. These visitors are people that need to eat out, they shop, and they frequent attractions. They are a critical market segment for the sustainability of our downtown core. But the balance of our downtown core has changed, and this is highly concerning for the members and the other businesses that depend on the tourism community. It's getting progressively harder, as you just heard, to run a hotel in the Byward Market and to ensure a positive experience and a level of safety for our valued guests. We are seeing potential convention organizers scouting out our destination and questioning whether Ottawa is a desirable place to host their delegates. A recent survey of 8 hotels in the Byward Market, in fact, it was yesterday, showed spending of upwards of $1.6 million on private security costs alone. That's 8 hotels. That's just the new cost of doing business downtown, and it's very frustrating expense for them to occur, particularly when, according to city records, Ottawa hotels paid a total of $30.5 million in property taxes in 2022. The question I'm being asked by downtown accommodators is, what are we getting for this money and how is it helping our situation? The current impression is Ottawa is quickly falling behind and it can't meet the demand for people needing a place to sleep. I hear a number like 200 people are living on the street, but what happens when that number is 2,000? And when is that going to happen? What I'm hearing from my members is that we've reached a tipping point and it's time to change the game plan. We need to seriously address what is working and what is not working. The conditions are deteriorating and we need to think differently. In my opinion, what I have seen through the delegations this morning is that we have all the necessary talent, compassion, and motivation in our community to improve the situation. We just need to wrap our arms around it. So let me share with you 4 ideas that I've heard in the marketplace. 1, we need to establish a community responsibility for the unhoused and the vulnerable population. Everyone has a right to feel part of the community, no matter their status or position in life. All wards in Ottawa should take responsibility and contribute to the solution. The oversaturation of services in the Byward Market in Lower Town needs to end. 2, depending on governments alone for managing the issues of homelessness, mental health, addiction, etc., is destined for failure. The well-being of our community is everyone's responsibility. This concept needs to be socialized along with a new governance model to fulfill its mandate. 3, we need to deliver on little wins while we're developing a vision for a better tomorrow. Building more homes will take time. Let's initiate new pilot projects now in the areas of mental health supports with the community engagement team and to work alongside with OPS in the Byward Market. We need to improve community meeting spaces downtown and create day programs that build positive opportunities for community cohesion. And we need to establish pathways to care and to service targeted and various groups that need it. 4, we need to educate the community on how to engage with people in crisis and to map out care pathways which are an alternative to police. Courses on nonviolent intervention exist and should be part of an overall community training program. In fact, as a hotel community, we plan to roll that program out to hotel employees in the coming months. So my commitment to you today on behalf of my hotel constituents is that we are very prepared to play a large role. In fact, on February 14th, the OGHA delivered 2.5 tons of food to the Shepherds of Good Hope through our Hoteliers Have Heart program. It's a small effort, but a big impact. But we can do more. I encourage the city to build into your strategic plans to continue to include community groups and maybe non-traditional partners in an all-of-community approach to solving homelessness. And in closing, I want to special shout out and thank you to Donna Gray for her tireless efforts toward improving our community and through her work at the city. Her dedication has been stellar. Thank you.
Wonderful. Thank you very much, Steve. And I think we all echo your shout out to Donna, and I'm sure we'll mention that at the end of the meeting. She's done a phenomenal amount of work over her career to help our community in general. We have a question from Concierge Plon.
Hi, Steve. Thanks so much. And I guess I'm sort of thinking a bit ahead because if it's okay, I have a motion coming up and I just want to ask him some questions that could be pertinent to that. Is that okay?
I would ask that any questions related to that motion, wait till that item comes up.
Okay.
So if it's related to the budget or operating or capital budget, feel free now. Otherwise, it can wait till after.
I'll ask the question. I'll let you rule it out of order. Okay. I was a bit surprised to learn that the City of Ottawa uses recreation facilities as part of their sort of homeless and housing strategy. And I sort of looked into other municipalities and Toronto, Vancouver, London, et cetera. A lot of them use hotels instead of using recreational facilities. Do you know how that works? Do you know if they enter into long-term contracts? Like, does Marriott, for example, have contracts with several cities? I'm just wondering if you can elaborate on that, because I think we can all agree that, you know, hotels may be better suited than, say, a recreational facility to house people, even temporarily.
I'll give you the quick answer. So during the pandemic, hotels were declared essential service and we're operating at 5%. So we did a lot of housing for the community at that point. But the challenge is when you're operating as a hotel, it's very difficult to mix different sources of clientele. And some of the brand hotels actually risk losing their flag if they operate outside of what the expectation of a property is. So it's not as simple as just picking a bunch of hotel rooms for a long-term stay. The other challenge is when a hotel gets into a long-term stay to support the community, they're not sure when in our community, when the occupancy rises and falls throughout the course of the year, whether they're going to have availability to actually operate as a hotel and command the kinds of rates they need to turn a profit. It's a very cyclical business that's very much demand oriented and it's dynamic pricing. So it sounds simple, it never is, right?
But it can be done.
Some hotels have given up their whole properties.
Okay.
I've 5 or 6 of them in town for sure. But it's hard to maintain a hotel operational business and also
Right.
provide the kinds of services. Very challenging.
Thank you. And thank you, Chair.
Excellent question. I don't see any more questions. Oh. Councillor Carr.
Apologies, I took it down early. I just wanted to thank you for your presentation and note you talked about sharing resources in different areas. And as a councillor for Alta Vista Ward for the last 3 years, I have two of my community centers have been used, one constantly, one on a majority basis to house unhoused individuals. And when you talk about a new model, I will tell you that although I've only been the city councillor for about, well, I don't know how many months, 3 months, sorry, 3.5. I was community association president before. I have almost never heard a complaint about these individuals in our community. And I think part of the reason is because the supports that have been offered. These physical distancing centers have been opened for, you can go there at any time of the day, so 24/7. You can have, so people are able to work, people are able to have shift work. There's been supports offered by the city. I heard a shout out from you from Donna Gray. It's been her team that is providing those services. And even people in my community, unless they know that there's been no youth programming in my community in Heron Gate, where Heron Road Community Center is, or on Russell Road at Dempsey, unless they know that their programming has been impacted, I've had very little concern about this. It's something that we'll be discussing tonight, I think. I think it needs to be addressed. We're past the point of using recreational centers, but it's been very interesting to see the difference. There's never any people congregating outside, so I absolutely support the move to that sort of a model in different facilities. But thank you very much for coming today.
Thank you very much, Councillor Carr. I will just note, and I'll state it again and again, because I know we're going to get tired over the course of the day. We are going to stick to budget because we did add that item at the discretion of the committee. We will talk about that in a fulsome fashion. What I'm going to suggest is we are going to go to our next delegation, Steve White. But before you join us, Steve, we are going to take a break after Mr. White. So our next delegation following that will be Chris Greenshields. So Chris, if you can be on standby, we'll take a break of 20 minutes. I'm going to be a bit of a slave driver on this. We have so many folks lined up and I want to be respectful of time. So we will take a break from 1 until 1:20. So Steve White will be our next delegation. We'll have time for questions and then we will go to Chris. So Steve, the floor is yours.
All right, thanks very much. Let me just find my thing here. I'd like to thank you very much. You can all hear me, for allowing me to share my experiences with you. Basically, I represent one of the major condos down on the Rideau Street Strip, and I'm the president of the condo board. And we've over the years have had to adjust to the rising street people, drug abuse, mental illness, homeless in the Byward Market. And I'll just report on some of the things that we've had to do in order to compensate for and keep our residents safe. We've taken security measures. We have always had a 24-hour security guard who monitor the indoors of the building and the garage area. We have 3 levels of garage, which are, it's a big area for one guard to support. But obviously, the garage door at the back of the building is a huge space to try to keep people out, and they do get in, and they do create some problems for us. We just don't have enough resources to monitor the exterior of the building. It's just too much for one guard. His main purpose is to monitor the front door and control the entrance. We've actually added more cameras to the garage area, and we've added more monitoring equipment to try to maintain control. We have ongoing thefts in the garage, mostly bicycles, lockers, vehicles, contents. We have people that come in and door check all the cars. If people haven't locked their cars, we always encourage them to not leave any valuables in their car, but it's not much safer than being out on the street. Unfortunately, one guard just can't be everywhere. Our security reports catches some of these people, and we even have security footage showing what has occurred. We call 911. A report goes through. Within a couple of days, we see the same people out on the street. So it's like a revolving door, and it sort of never ends. We see drug deals taking place everywhere in plain view, outside of the building and in the market area. We see individuals passed out on the sidewalk or shooting up or camped out on Rideau Street. We're always amazed at how the police respond for the 911 call. We get one guy passed out on the street, and next thing you know, there are 2 fire trucks, there are 3 police cars, and 2 ambulances all there attending to this one guy who's passed out. They may apply something to him, and after about 20 minutes, he walks away. Everyone else goes home. So this sort of addresses the concern that maybe our resources are not applied properly, and a different kind of response is needed. Personally, I think having more police or more patrols out walking the street, getting to know what's going on, would be more effective than having fire trucks and things pile it in at the last second when something happens. It's using our resources smarter, I think is what's needed. We see aggressive panhandling. You see yelling, occasional fist fights breaking out. I looked at our records. We spend approximately $25,000 a month on security to keep the building secure for our residents. And that's we have 250 units, so that's about $100 a unit per month for security. That represents a fair portion of the condo fees just for security. We also have ongoing projects every year. We have to think of some other ways that we can improve our security in the building. This year, we're proposing to put a fence at the back corner of our building. We have a very nice secluded tree area on the back corner, and it's a great place for drug addicts to hang out and shoot up. We have homeless camping. There are a very complicated series of gas pipes and valves and meters right in that corner. We see them smoking underneath these pipes. This can't be good. We're just waiting for the whole thing to blow up. But so the city is looking into allowing us to build a fence along there. It's probably going to cost us about $10,000.
Mr. White, your time is up. If you just want to finish your thought on that very quickly.
Okay. Just going to say, so we're turning into a gated community. Basically, I guess we've been a gated community. Fewer tourists, more petty crime as we've seen the pressure. And
thank you very much for attending today. We appreciate it. We're hearing from a lot of residents in the core, as well as service providers and businesses, about the need for additional supports for our most vulnerable communities. I really do appreciate you taking the time to be here today.
Okay, thank you.
Thank you. So I am going to call a recess now. Everyone, if I could ask you to be back promptly for 1:20, I appreciate it. And then we'll start again, as I said, with Chris Greenshields as the next delegation. minute.
Here.
Test for the audio stream.
Okay. Thank you very much. We're going to begin again. But as we restart, I just want to take a moment to apologize. Before the break, I carelessly used a term that I absolutely should not have. So I just wanted to issue that apology. We're now moving on to delegations. We have Chris Greenshields. Thank you for being prompt and ready to go. And Chris, you're from the Vanier Community Association. So please proceed.
Thank you, Chair. First, I want to acknowledge and welcome the city's investment in the Gignul Indigenous Housing Project in Vanier. This appears to be the third city capital investment in housing in Vanier since amalgamation. But such investments over 20 years of some 60 units for a neighborhood of 18,000 residents represents a poor record to promote housing first while increasing shelters. There are other signs of progress, which I hope are reflected in the housing services budget. This relates to the city's follow-up to the report addressing family homelessness at the neighborhood level from the CMHC supported housing lab project of community associations in Ward 13 and Ward 12, including the Vanier Community Association. We understand there has been some shift in resources allocated from family shelters to resources aimed at preventing shelter admission by finding alternate, appropriate, and affordable housing. Moving from behind the shelter door to prevent shelter admissions is fully consistent with the report's recommendations and aligns well with best practices unearthed during the lab research phase. As the city rolls out a phase 2 rapid response team pilot by next month with new programming, community-based delivery, and across expanded boundaries in a scaled up manner, we hope to see similar efforts to address homelessness among other groups, including single adults. For too long, Vanier and other neighborhoods have seen families, for example, staying in shelters in our community for an average of more than 6 months. Despite this progress, there appears no end in sight to housing homeless families in our neighborhood. Staff reports some declines in shelter use in recent years, but a substantial share of the housing services budget continues to be devoted to shelter accommodation for all groups of homeless clients at the expense of housing first. And considering the 2023 housing services budget, we urge this committee to reallocate resources to the housing first approach, not to fund new shelters, such as the mega shelter proposed for Vanier, to freeze and then reduce such shelter expenditure. Invest instead in getting homeless into their own homes. The relevant committees need to take into account neighborhoods which have carried for too long and for too much, the burden of emergency shelters. They have proven unsuccessful in getting the homeless into their own homes, resulting in greater city costs and harm to neighborhoods, particularly vulnerable neighborhoods like Vanier. The Rita Thompson supportive housing, on the other hand, that project in Vanier does work. The city has to stop digging a deeper hole in opening new shelters, including most recently to open a new temporary shelter in Vanier beyond the 4 permitted in Ward 12. This has been done without consultation, despite the city's own guidelines for emergency shelters, and displacing community access to the Grand Maître facility, which has been closed for most of the last 2 years and now reopened only a couple of months. The excuse given was that there was no programming at Grand Maître. The VCA has been calling for some years for at least some indoor recreational athletic facilities and programming in Vanier. There is none in Vanier, again, for 18,000 residents. Progress has been elusive, although city staff has been trying to innovate. Meanwhile, it is evident that it was decided that Grand Maître was the best location in the city, smack in the middle of a dense, low-rise housing estate, in close proximity to 2 elementary schools and the Inuit Family Center. It seems convenient for the city when it offers little in the way of recreational facilities to a vulnerable community and little programming to give priority to Vanier for shelters. I recommend reading Denis Gratin's recent article in Le Droit, À bout de passion. Mayor Sutcliffe has assured the VCA that a housing first solution is coming. We hope also that recreational services for Vanier will be greatly enhanced in this budget in the short term. Thank you. Merci.
Thank you very much, Chris. I'm not seeing any questions for you. Thank you for being here today. Our next delegation is Peter, and I'm apologizing in advance if I say your last name incorrectly, Kuchipura from SOS Vanier.
Hi, everyone. My name is Peter Kuchirapa. I'm a barrister and solicitor. I'm speaking on my own behalf and that of SOS Vanier, not that of any employer I have. Just want to make that clear as we start this off. These are opinions of myself and the organization. So currently, the housing situation when it comes to budgetary activities is a policy of heads I wins, tails you lose. This is how the community of Vanier, and I think the entire Ward of 13, sees in regards to housing policies that are going on right now and how budgets are being invested. We understand that shelters is an emergency need, and it's a need that's going on right now. However, the current policies of the Ward 12, this policy decision process provides the ghettoization of the most sensitive areas of our city, and outsourcing problems from one section of the city to another section of the city are not constructive, especially when those second areas or target areas are the most vulnerable. This creates an opportunity for reform. The most influential constituents, meaning rich communities, are outsourcing all of this to Ward number 12. So, heads, rich community wins, tails, Ward 13 loses. Ottawa policies going back to 2008 provide that there should be reducing a proliferation in this ward. There should be a cap on the number of shelters. There should be separation distances, and we should reduce them in residential areas. However, the City of Ottawa continues to ignore these policy principles, as a high concentration of social delivery happens in this ward. We think that the rule of law here is not equally applied, and policies are influenced by probably lobbying and create an exemption clause for this ward. Meaning Vanier seems to be the exemption of citywide policies based on convenience, not principles. In fact, right now, there's a new shelter being proposed, as Chris mentioned in Carmel, and they ignore the entire city policies on shelter just by renaming it a physical distance facility. Again, politics wins, tails, citywide policy loses. Also, the current fiscal budget to assess housing is lacking a competitive application process. There are no contracts, there's no assessments, and there's no results measured. In fact, the vendor sets the price with no results, and the city complies without any review or assessments. It's actually cheaper to pay someone's rent in Ottawa than to pay a service provider like the Salvation Army the per person rate that they charge. But again, they set the price. So this is called poor budgetary planning and execution. Lobbyist wins, taxpayer loses. The financial budget also don't reflect the needs of the community. They don't allow women, children, or families who are the most sensitive and require the most support to access these facilities. Heads politics wins, tails everyone who needs it loses. What we need is a solid budgetary process here that takes in all these aspects of consideration for this ward. We need an investment in housing that does not concentrate homelessness in our ward. We need something that provides higher return on investments for everyone and reaffirmation. We do not want to proliferate poverty in our city. The budgets need to ensure that the priorities of non-proliferation of shelters and respect to 2008 policy objectives. We should be really focusing on the objectives here of distances between facilities, because to not follow your principles in times of crisis means those principles have no weight at all. And we should also invest in the shelters that include budgetary financing on accessibility, minorities, women, with clear results and the best results, using the best models, not the worst. So we need to invest in our system here in Ottawa. And we need to ensure that we're not moving resources to vulnerable parts of the city. We need to change the heads I win, tails you lose to a heads I win, we all win, a win-win scenario. Winning for the communities, winning for women, winning for Vanier, winning for downtown businesses, winning for actual policy principles that apply equally to the entire city. Heads, we all win. Tails, the city of Ottawa also wins. Thank you.
Thank you very much, Peter. I don't see any questions for you at this time, but thank you very much for being here today. Our next delegation is Alain Garceau, and I understand there are slides that go with this presentation.
Yeah. Thank you, Madam Chair, committee members. So I'm Alain Garceau, a citizen, a resident of Ottawa, and I happen also to be the president of our condo board. Next slide, please. And this is where we are located. You can see the bottom center, 260, so that's 260 Bessemer Street. This is our 50-unit condo. And you can place yourself at the Shoppers Drug Mart on Rideau Street. And so I can say that I would be speaking on behalf of anybody on Bessemer Street east from King Edwards. So so you can see all the area of concentration in that map. Next slide, please. So who are we? Well, we are a small residential condo building with 50 units. It has 1,200 feet of street frontage. Altogether, we pay roughly $300,000 in municipal taxes. And most of the residents of the condo corporations are owners, and the vast majority of us are older retirees. Next, please. Next slide, yeah. So what have we done? So it may seem like a little bit of money when you're talking about your budget. However, 50 of us and many of us are retired. This is what we have done for security measures because of where we are located. $16,000 for additional fences, door reinforcements, motion detection lights. We're looking at cameras, but the issue with cameras is we are told that if we have cameras and something happened, unless it is a very serious crime, it will not be used very much. And we had to increase security in our lock boxes, move the real estate boxes, and improve lighting. Next, please. We have set up a group of volunteers, all owners and residents, some renters who got together. And we have picked up in the last year, and we made a report and we sent it in some places, hundreds of needles picked up by us, those volunteers, tons of garbage all over. The drug users constantly are very active on our property, including inside our building. They find a way in. They snort, they inject, they smoke, they defecate, prostitution, we have it all. The owners are targeted or are threatened by people suffering from homelessness and addictions. And many of us are very afraid for our safety. My wife, as an example, was assaulted with a crowbar from one of those people. Next slide, please. So building at 302, 304, 306, that's the building that you've seen in the news that burned 3 times. The fire was set up in there. The property manager can no longer rent it because it's unsafe. Unofficially, they had offered the building to the city to see if they will help, if they will purchase it to help for their housing difficulties. However, the city apparently have said, well, we can't because it's unsafe. We cannot have residents in there. Drug users purchase their drugs in our facilities or nearby, and we must ask, where do these funds come from? I think having heard from the Rideau shopping center and the hotels, we can tell why, where. 260 Besserer and its vicinity have become a drug user hotspots. Next slide, please. So services for people suffering from homelessness and addictions are concentrated within the vicinity of our building. There's a heavy concentration. So I believe that the city of Ottawa needs more social services area, but not in the same, not here. It's no, there's way too many here. And here is the Lower Town area, Byward Market and Sandy Hills. The supervised consumption site has attracted people who trespass, threatens, and assaults people, discard needles, garbage, fornicate, and use the neighborhood as toilet and so forth. The health center has security and garbage cleanup for their staff and on property, but for a radius of 15.1 meters. We found that out by getting the report that we got through access to information. Next slide, please. And these are some of the pictures. I only have a few seconds, so next slide, please. Next slide, please. Next slide. Okay. We have sympathy for those people, for the growing sense of danger, the constant break-ins. So some people are pushing the limits of our compensation. And last slide, which is the request. And because my time is up, once the next slide comes up, please, I'll let you read it. Again, we believe there are too many services concentrated in this area. We need more visible help. The safety of the resident must be a priority. This is very important. And the next 2 points, you people know that very well, and you're much more an expert at it. So that's all I have. Thank you.
Thank you, Alain. You have a question from Conseiller Plante.
Merci beaucoup, Alain. Je t'ai dit de présenter en français, comme ça on aurait augmenté le nombre de présentations en français, mais bref.
I asked you to speak French, André, but you didn't anyways. We would have had more presentation in French.
Resource team, like, can you just sort of give an idea of what kind of supports the city has been providing, given everything you're dealing with?
Well, our volunteer group has got involved, and Kent Hughes, I heard him mention earlier on this morning, has been a great help to help us out, to help us connect to the right places, the people who need to hear our concerns. And so he has been fantastic in this area to open the dialogue at the right level with people that it requires. We're very much involved with ASH as well, the Action Sandy Hill, and we're trying to further all the presidents of condo boards or members of the boards. We're trying to get together as well to see what we can do as a group to make the area safer for all our residents.
No, I appreciate that. But, and just so I'm clear, so the only communication or venues of communicating with the city are through that team, or do you have other ones?
To communicate with the city? Yeah, besides you, of course, yeah. We also communicate with the police, with the NRT. Matter of fact, just this Friday they came in here, and so we have a discussion. We go around. We see where the points of failures are for security and safety, and so yeah. Otherwise, I'm not quite sure which other unit you're talking about.
No, it seems like it's just a lot of whack-a-mole. That's
Oh,
what I'm getting at.
yeah, most definitely. It's
Yeah.
Yes. I participated in a group. I forget what it was called. It was set up by Dr. Duxbury from Carleton University 2 years ago now, and I think we had to disband it because we couldn't get all the organization participating. Many of them spoke today. Couldn't agree on the solution, so the study was disbanded. It was sponsored by your predecessor, Matthew Fleury.
Merci beaucoup.
Thank you very much.
Anytime, bienvenue.
Our next delegation is Philippe Deneau, and I understand there's slides to go with this presentation as well.
Oui, bonjour. Merci, Madame la Présidente, et merci aussi de...
Thank you, Madam Chair. And thank you for inviting the delegation to speak today. My name is Philippe Deneau. I am a resident of Vanier, disadvantaged area, a downtown area where the city of Ottawa seems to want to focus the problems in the city. And I agree with what the Lower Town Community Association said, and Chris. I'm here as a private citizen. I'm not here as an expert. Listen, what I did is, we know that the city of Ottawa is faced with a housing crisis, a crisis that's on the rise because of economic problems and drug addictions and mental health problems. So I wanted to check the progressions of the budget for housing since 2018, so almost 5 years, if you include almost 6 if you consider this year. So we can see that the budget during the COVID was very stable. I didn't put any picture, but there's no difference between budget items every year. The total go between 190 million to 2 per year. In 2023, the budget is in the average about 198 million. It's the third highest amount on the 6 that you see on the screen. Here you can see the stability. In constant dollars, taking into account the inflation, it seems that the housing budget of the city has diminished since 2018. Based on a non-scientific calculation, I'm not an expert, it would be a 16% reduction. Just to maintain the budget at the level of 2018, we should be at 235 million. So the only item that seems to have progressed is the one for the federal program, Reaching Home, which is a very good thing since it is focused on housing, but the rest remains marginal. There's an issue of priority here, considering that the problems are on the rise and that the budget in constant dollars is diminishing. My question is the following: how do you intend to settle this housing crisis? Seriously, it doesn't make any sense. And I invite you to ask yourself the question, how can you attack this crisis when the budget has gone down? With this budget, well, considering the situation, there's only two solutions: change the approach or increase the budget. Regarding the approach, you haven't settled the problem by opening arenas and things like that with Bernard Grandmaître, for instance. You will not find a solution by building shelters of $200,000, 200 spaces in a residential area. Do you know how long it takes to deal with mental health problems, dependencies, vulnerabilities? It may take months and even years. And so people can't stay in shelters all that time. The treatment approach from the Salvation Army in Vanier is the most common one, but that's not a solution. You need housing. Oh, that's the housing first approach, which is favored in the National Strategy of Canada in the Federal Act on Housing. The federal government recognizes as a policy that the right to housing is a basic human right in international law. So there, the other solution, as I said, would be to increase the budget. So if we look at the numbers, why not keep the money? Yeah, I have two more lines. So why not keep the monies that we had to answer for this housing crisis, 93 million? These were to meet the needs during a crisis period. So you could try and recover these emergency COVID fund to meet the needs of the crisis, that is the urgent need for housing. You have to increase the budget. Thank you for your time. I don't see anyone with a question. Thank you for your presentation.
Notre prochain délégué, Trevor Doche, Laurie Trevor Doche, intervenant numéro 30. Désolé d'avoir mal prononcé votre nom. Vous venez du Dream Mind Group. Vous avez une présentation.
I think our time here is just going to reinforce everything that you've heard this morning. But we come with a little bit different perspective in that we are a business that is embedded in the market, have several businesses in the market, and therefore that is where our experiences is. So the Dream Mind Group, next slide, please. Actually, 2 slides over. I'll introduce, my name is Laurie Trevor Deutsch. Beside me is the owner of and founder of Dream Mind, Abbas Mahmoud, who will speak shortly. Next slide, please. Dream Mind Group consists of restaurants, construction, and nightlife. As I said, primarily in the market. You probably are familiar with many of the venues. Maybe you've even been to some of the venues in the market. It's been around for over 20 years and employ over 300 people, full and part-time in the area. Next slide, please. DreamMind is also involved in corporate social responsibility, having founded an organization called Operation Ramsey, which delivers food hampers, seasonal food hampers, has been involved in supporting relief in Beirut after the explosion. We've also sent a container of supplies to Kenya for humanitarian aid, and therefore we consider that we contribute back to the community as best we can. Next slide. The Byward market is our stomping ground, and it's on this perspective that we'd like to make our comments today. We're here as business owners, as people who visit the market, as Ottawa residents, and as parents who'd like to bring our families to the Byward market area. Next slide, please. Byward market, as you've heard, repeatedly today has a number of social issues. These are distinct from the policing issues. We want to stay with the social issues, which is that there is chronic homelessness, there is aggressive panhandling. You've heard several stories of many incidents. We don't have to go over that again. The difficulty it is to live and work and visit in the market, both as business owners, as visitors, and as parents. Next slide. You've seen several examples today. We're just going to put out a few more that in the past couple of weeks alone, I've spoken with people who work in the Rideau Center. There have been robberies at Kate Spade, at Coach, extra security required at Tiffany's. They're sleeping in the mall. Again, this is nothing that's new. It's just we're here to reinforce that. What I find a little bit disturbing as a resident of Ottawa is the international press surrounding what's going on in the market. Ottawa is supposed to be one of the safest places in the world, yet I get emails from colleagues all over the world, including cousins overseas, that are saying, what's going on? Why do you have the most dangerous McDonald's in the world? And it's gotten quite a bit of press coverage. So this makes it really difficult to do business. It makes it difficult to attract people. Next, please. Okay, I think we're just going to skip that again, just for time, because we have, this is just reinforcing what we've done already. I do want to say that I've heard a lot of interesting things today, and I support a lot of the initiatives that people have talked about. We researched one particular initiative that seems to be working, which is Operations Byword, which is something to deal with the chronic shelter situation. I've been in Ottawa for many, many years, and the shelter situation has been around for a long time. I think that it's really something that needs to be revisited, and the amount of money that the city is spending on it is disproportionate to what should be spent on it, as opposed to dealing with solutions. And now I'd like to pass it on to Abbas for his perspective as the owner and the founder of DreamMind.
Thank you very much for having me. I'd like to speak on numerous fronts. I've been on the market. Okay. I've been on the market for a long time. I actually live on the market, so I'd like to speak as a resident of the market. I live at 90 George. We pay a lot of taxes in that building.
Just before you continue, being that you are listed as one on the delegations, I'm happy to give an extra minute for you to summarize, because you're representing yourself as a resident. However, just for future knowledge, if you come as one item, I'm going to treat you as one delegation, just for time and consistency.
Sure.
So I'll if we can add another minute on the clock.
Okay.
I do want to hear from you, but just for future, okay?
All right, thank you.
Thank you.
The reason I speak about the residents is because it's really important. I'm a resident of 90 George. Recently, we had somebody come into the building and steal all the art in the buildings. We've had numerous break-ins where we have very expensive cars and people are coming in and breaking into our cars. But what's really scary is I have a lot of people that live at 90 George, and they're really scared. Every time you leave the building now, the concierge is telling you to be careful. Going out after 8 or 9 o'clock at night is really scary with a lot of people doing drugs and needles all in front of us. So I could say that the residents are really scared right now. And some of them are actually willing to sell or trying to rent their apartments and move somewhere else. As a business owner, I've been on the market for 23 years. I've never seen it this bad. I can tell you that landlords are really demoralized. There's a lot of buildings going for sale. A lot of landlords are trying to sell their buildings right now. A lot of the business owners, we suffered greatly during COVID, and now we're back open and we're suffering even more. We have staff that don't want to come to work anymore because they're scared. We have a lot of parents calling us saying, I don't want my daughter working there. We're walking all our staff to their cars. And I'm here actually more importantly to speak about the business owners on the market. A lot of them are friends of mine, and a lot of them are in deep trouble, and they're going into a really bad situation. If we continue to lose tenants on the market, it's just going to get worse and worse. For the city, it's less taxes. The landlords are nervous. But more importantly, what are people going to come down to the market? I think we need two solutions. We somehow have to deal with the violence on the market, with the drugs being used on the market, the homeless situation. And also we need to look at, before it's too late, the city needs to think of doing some things to really draw people to the market. We need events to bring families back. We need events to bring people back to the market. and just to help out the business owners who are really, really struggling right now. I just came from the market right now, and everywhere I go, it's just the same thing. How long can I hold on? Is it going to get better? And they're in really bad shape right now. And I think everybody really needs to realize how bad it is for the owners. At the end of this year, we have to pay back.
I'm going to cut in here. I do know you have a question from Conseil Plan,
Sure.
who may ask you about probably where you're going to head with there. So thank you for that.
Absolutely.
Sorry, I just have one clarification to make, Abbas. I just looked up, there's 53 condos for sale now in the Byward market. I believe that's an all-time high. So I just wanted to make that clarification. And Laurie, can you clarify, even though you're here as a concerned resident, you do not live in the Byward market, correct?
I don't live in the Byward market, no.
Where do you live?
I live in Alta Vista,
Okay, just wanted to, because I think some people think that it's.
but I work in the market and I visit the market. My kids work in the market.
Okay, thank you so much.
Yeah. Yeah. So,
I'm
basically,
sorry. I'm going to cut you off unless I see any other questions for you. Your time is up, so
Okay.
we're gonna move on, but I do appreciate you being here.
Yeah.
We do have another question for you from Councillor Hill.
I am interested in the State of the Union from a business perspective downtown. I appreciate very much your delegation. And I know that you did have one more thing to add there, please. If you could just make that quick point and get that finished, and then we're good. Thank you.
what I've been trying to do for a long time is we need a police force at night. When I first got into the business on the market, we had a unit that patrolled all of the bars and the market area, and they knew who a lot of the troublemakers were, and it was the same unit. I think the police are doing a wonderful job. I think they need more support, but we need more policing. We really, really do. We need an active unit at nights, on the market, on weekends, because there's a lot of fear, and I've been pushing hard for that to try and get a regular unit that's set up just for the market. I have a lot of employees that work for me. I rent a.
I apologize. I keep cutting you off.
No problem.
The situation is, this isn't the police services board. I do know that there is a time and place for that kind of delegation to happen. And while it's all intrinsically intertwined as to how we deal with social situations in the core, this committee is not the time or the place to bring up the needs for police or the questions about their budget. So I will ask if there's any other questions. I see Councillor Troster has a question, and if I could just ask for both councillors and delegations to stay within the mandate of this particular budget and committee.
This is actually a question for you, Chair. I'm sincerely appreciative of everyone who has come to speak to committee today, but it seems that there are a large number of people, specifically from the Byward market, expressing a very similar sentiment. The points about security and lack of services for folks who use drugs and experiencing homelessness is really well understood. I'm just a little concerned that, I'm proud of people for organizing. I think that's great, but I think the substance of these delegations is really, really similar, and we're facing a really long day here, so I don't know what the solution is, but I just wanted to make that point.
Thank you. And point taken. So that's not a question to the delegation. So thank you to the delegation.
Thank you for having us.
Thank you for your time.
Thank you for having us.
I will just note in regards to that, this is our first committee meeting of the term. We're going to have many more, and there'll be opportunities to discuss all these. And while the conversations that the delegations have been bringing to the table can be a little bit fluid, I am giving a little more leeway today, being that it is budget and that we have only till tomorrow. So I agree with you, and I'm keeping an eye on the time. But that is certainly a point well taken, and I would encourage colleagues around the table as well as upcoming delegations to stay within the realm of the budget. I will note that Sandra Milton, we had passed Sandra because I understand she wasn't in the virtual room. She may be here at the moment, so we're just going to see if Sandra is on the line. I'm happy to take your delegation now. Sandra, are you with us? Okay. I'm going to keep moving on then. So our next delegation is David Mangano, who is with Grand Pizzeria. Anticipating once again the delegation and what's going to come forward, I would suggest once again to stay within the realm of this committee, which is the capital and operating budget for Community Services Committee. So, David, the floor is yours. We don't seem to have David at the moment. He's on. David, if you could.
Oh, I'm here. Sorry, can you hear me?
Yep, we can.
Okay, sorry about that. I was on mute. I didn't notice that. I'll start over. I'm Dave Mangano. I own the Grand Pizzeria. I'm here on behalf of on our business, which we own at 74 George. We also own the building, and I'm speaking also on behalf of John Borston, who owns Zach's and Starling and Apothecary, and John does own that building down there. So we're landlords and business owners, and we don't live in the market, but we work here every day. I'm down here every day. I'm not going to go on too much about what the other two gentlemen or everybody else have been talking about in regards to policing and stuff like that. But I just want to reiterate the fact that I think we have a real public safety issue down here. And if you refer back to the one category, a couple of gentlemen before me talking about international press, it's just a matter of time before something serious happens down here. And I've been warning about this for a long time. And so if you're talking about international press, something serious is going to happen. A tourist is going to get killed. And I'm not exaggerating when I say that.
David,
yes.
I'm going to jump in. And I've said it a couple times. I'm just going to reiterate it. You may have been on mute and missed this. This is the Community Services Committee.
Okay.
And if anyone, any delegation or council member is going to delve into the realm of police services, or like, once again, I understand how things are connected. If you could stick within the operating or capital budget, which is the item we're on right now for social services or services to the community, I'd appreciate that. And otherwise I'd have to excuse you. So I'll let you.
No problem. No problem. I won't go on about the safety and security. I think it's all pretty well known anyways. But, you know, I'm just hoping that we can see some more money being spent and more budget being sort of allocated to the Byward market. You know, not so much in policing, but also in bylaw and social services. I find that, you know, it's not only an issue with crime, it's also an issue with, you know, for example, people setting up speakers and preaching and causing all kinds of disturbance in that respect. This is where bylaw is required. And so, you know,
David,
yeah.
Bylaw is actually another committee. So once again, you're jumping into another committee's domain in terms of the budget.
Okay.
Specifically, I would suggest in terms of community services, unless you have something to say about a line item in this budget, I would suggest maybe you provide a written submission to a future committee meeting. So I will ask you if you want to summarize, if it has to do with funding for housing or something of that sort, that would fall in our realm, but bylaw is absolutely not.
Okay, well, you know, as far as funding is concerned, yeah, we need, it's more than obvious. We need plenty of public housing, and we need to do, you know, and this is just sort of one link in the chain to prevent, to keep people housed and keep them off the street, and one step in bringing them back to, you know, to rehabilitating people and allowing people to get healthy and treat and focus on treatment and stuff like that. I get it. We need the funding to go towards that, and that type of social services that'll really help in terms of, you know, keeping the people off the street and keeping our residents, our tourists, our workers, our staff, and everybody else who's in the market safe. So that's really what I was trying to get at. So I'm sorry if I went off topic there, but the funding is important to start at a sort of a ground level and get people treatment and get them housed and get them off the drugs and get proper mental health treatment, and for people who are, or for single moms to get the proper treatment who are live in abusive relationships. The whole gambit. We need as much help as we can, and that will lead, I think, at some point to helping you know, get people off the street and you know, get the people who are mentally ill or homeless, aggressive panhandling. That'll help reduce that, I hope. So really that's where I think the focus of, in terms of budgetary money, that's really good. And I hope that it goes to that.
Great.
And that's really all I got to say.
Thank you very much, David. I appreciate it. And I get it's a little difficult to understand the different nuances of the city and which funding flows through which committee and which group. So I do appreciate you attending. I appreciate your delegation.
Yeah, I didn't study who funds what. That's really not my area of expertise. So,
Thank you very much. Thank you.
Right.
Our next delegation is Anya Fraser.
Hello, my name is Anya Fraser and I'm a Sandy Hill resident. Sorry, my lighting is terrible. I want to thank you for giving me the chance to share my concerns about the Sandy Hill Community Health Center today. Now, personally, I want safe injection sites and other harm reduction measures to work. My stepbrother died of a heroin overdose nearly 20 years ago, and his death rocked my family. Criminalizing drug use does not work. But when the organizations providing harm reduction services don't do anything to address the negative impacts those services have for the surrounding community, then they don't work either. Make no mistake, the safe injection site run by the Sandy Hill Community Health Center has a very real impact on our neighborhood. All the 911 and 311 calls you get for this area are just the tip of the iceberg. Alain has already spoken to many of these issues already. So let's start with some of the minor issues, but even minor issues can become serious when there's too much. These include the Sandy Hill Community Health Clinic's clients leaving garbage everywhere, discarding dirty needles, loitering in public spaces, trespassing on private property, stealing, vandalism, going to the bathroom. Now, the last one is not their client's fault. Sandy Hill Community Health Center does not provide bathroom facilities for their clients, and people gotta go. I myself have cleaned up human feces from my backyard. Now, when some of my neighbors have asked the Sandy Hill Community Health Center to help clean up some of their garbage that their clients leave behind, they refuse to help. When I asked them to pick up a used syringe that was just lying on Besserer Street right behind their property, they refuse to pick it up. They can't or won't do anything about the problems they cause. Trespassing and loitering might not seem like a big deal, but a lot of Sandy Hill residents are not comfortable confronting Sandy Hill Community Health Center's clients because we're never sure how they're going to react. The Sandy Hill Community Health Center makes this problem worse because when their clients act belligerently on site, they kick them out or refuse them service, leaving them to just roam our neighborhood in that state of mind. One day I saw a guy leave the clinic and walk up Nelson Street when he suddenly attacked a parked car, just like kicking and wailing on it. Just like, when the Sandy Hill Community Health Center's clients, while the Sandy Hill Community Health Center's clients are usually harmless, that's not always the case. Almost everyone living here has witnessed one of their clients do something scary, dangerous, like self-harming, verbally or physically assaulting someone, or setting a house on fire. The presence of the safe injection site also lures drug dealers here, who prey on their clients and threaten residents. I personally have witnessed 3 physical assaults, one of which included a weapon. It's like playing Russian roulette every single time you leave your house. And the Sandy Hill Community Health Center does nothing to address these problems. My neighbor was walking home from Loblaws one day and she saw someone overdosing on Nelson Street. She called 911, but the ambulance was taking a while. And meanwhile, the guy was in medical distress. So she asked the Sandy Hill Community Health Center's security guard to get help from one of the medical staff there. They refused to come help, even though this guy was overdosing less than 60 meters from their property. Right now, the Sandy Hill Community Health Center is a poster child for why safe injection sites should be shut down. I have 2 suggestions for how these harm reduction programs could be improved. 1, these programs need to have protocols and resources in place to address their neighbors' concerns and mitigate some of the externalities, like providing regular litter and needle pickup in the near vicinity. Or when neighbors have an issue with one of their clients and it's not an emergency situation, they should be able to ask the provider organization to step in. 2, these programs should not be located in or next to residential areas. I'm not suggesting that businesses won't be bothered by trespassing, litter, vandalism, etc., but individual households are the least equipped to deal with these externalities. We cannot afford 24/7 private security. Trespassing feels more violating when it happens in a private space than in a public space. And people have a right to feel safe in their homes. Maybe someday when we have adequate wraparound programs in place, safe injection sites could be located in residential areas. But until then, the city needs to triage and relocate them to non-residential areas in order to minimize the risk these programs pose to other people. We need harm reduction measures for harm reduction programs. Thank you.
We have a question from Councillor Troster.
Hi, Anya. Thanks so much for being here. And, I'm the counselor for Somerset Ward, where we have a lot of similar concerns. I just did want to let you know, though, because you were mentioning human waste, which is a huge problem for people experiencing homelessness and addiction in my neighborhood, too. Sean Menard and I have worked on a motion that's actually coming tomorrow to the full council budget meeting to provide porta potties in public parks, a certain number per ward, which is just a drop in the bucket. But I'm also really pushing for a public bathroom strategy at the city level. So there'll be more on that in the future. And the other thing I'll say is, my sincere sympathies on your own family experience with addiction. I think there are so many surrounding issues with safe consumption sites, but what I've always said, because there are similar challenges as my own ward is, and public, by the way, safe consumption comes under public health, not under community services. It's very confusing, but they are run by community health centers. The only thing that I'll say is that in cases where the service is not able to completely meet the need, the safe consumption site in my own ward closes at 5 p.m. Well, people who use drugs don't stop using drugs at 5 p.m. So I think sometimes there's a mistaken notion that a service draws people to the neighborhood who aren't already using drugs, when in fact, it may draw people to access a service that's not open when they need it. So, and at the end of the day, I absolutely take your concerns about some of the community challenges, but these safe consumption sites are stopping people from dying from overdoses. It's terrible to find needles in our neighborhood, but I'd rather find that than bodies. And that is a harsh and terrible reality of our poison drug supply right now. But I hear your concerns, and this remains a really challenging issue, but I firmly believe the challenge is to adequately fund those services to do the whole job and not half the job, rather than removing them completely. Thank you.
Just to clarify, I'm not suggesting that we remove them or cancel them. I'm suggesting that until we have more social supports in place, we relocate them to where they'll cause less harm on their immediate surroundings.
Thank you, Councillor Troster. Councillor Plante.
Thank you so much, Anya. I'm really sorry to hear about your stepdad. That's very, very sad. And it sounds like that happened too before the opioid epidemic. So my sympathies to you and your family for that experience. I just wanted to make a clarifying comment that a lot of porta potty companies will not rent or put porta potties in my ward because of the needle issue. It causes problems with the lining, and it means that they won't install them in parks and stuff in my ward because they don't want to ruin their product. And that's understandable because they're very expensive. So I don't have a solution, but I also too believe in having public bathrooms and access to public bathrooms. I actually just sent Dan a message about that this morning, so we could have a chat about it. But there are companies that will not rent in my ward, and I don't know what to do. So thank you, Anya. I really appreciate it.
Thank you, Anya. Our next delegation is Lee Santa Street. Okay. So I don't see Lee in the virtual room at the moment, or in the actual room. So we'll move ahead with Andrew Lumsden.
My name's Andrew Lumsden, and thank you for giving me the opportunity to talk to you today. I've heard a lot, we've all heard a lot about the problems, and so many of them seem to require more money. Going outside the mandate of this committee, if I had my way, I'd scrap the LRT project and find billions of dollars. But that's outside this mandate. Let me address the problem that's well within the community service mandate, committee mandate. And that's the problem of homelessness. We're all aware of it. We see the homeless everywhere and in increasing numbers. And it's very sad. It sometimes makes me almost ashamed of our city. But there is a solution. I'd heard about Helsinki or Finland and what they had done. So last fall, I took a trip to Helsinki and spent 2 days there. And what I discovered was that they too, Helsinki especially, had a problem with homelessness, which was really bothering everyone. But fortunately, one politician, in conjunction, or perhaps more than one politician, but politicians and an organization called the Y Foundation in Finland did some research. And what they discovered was that shelters are degrading institutions, however temporary. People go there, many of them through bad luck. Perhaps they get injured at work. They go to hospital, they put on drugs to remediate the pain, and that sometimes puts them on the path to drug addiction. So what they, as I said, what they discovered is shelters really don't do the trick. They're breeding grounds for more addiction. That's what shelters are. We've got to break that mold. So what Finland has adopted, and you've probably already heard, successfully, what they call the housing first. And we hear that here in Ottawa. But what housing first really means is that before you think about treating people, you've got to give them the dignity of their own home, or as they say in Finland, their own front door. Before you can do that, you don't have a hope, or much hope, of reintegrating or helping these people. So that's what Finland has done, and it has become very successful. So many of the formerly homeless are now being integrated, reintegrated, or rehabilitated into normal society. The homeless have all but disappeared in Helsinki. And that's not just hyperbole, it's a fact. And lastly, which is very much the mandate of this committee, is cost savings. It's cheaper to get people out of shelters and put them into their own homes, however small they may be. And that's what Finland has discovered. It's a cost-saving program, but we've got to focus in the short run on finding accommodation for these people. And the last point I would make is there will be many naysayers. The shelter industry is a big industry. Pardon me for being cynical, but it's an industry. But in Finland, believe it or not, the Salvation Army converted its largest shelter into small flats for the homeless, which they actually rent according to their means. Thank you very much for your attention.
Thank you very much, and thank you for being here. And I believe you've been here all day, so thank you for staying with us. It's appreciated.
Thank you.
We have two counselors that have questions for you. Actually, Angie, if you just want to stay. So Counselor Carr has a question for you to start.
Hi there. It's not so much a question. I wanted to thank you for your presentation and for bringing solutions forward. I really admire you for going to Finland to check it out. I just want to say I absolutely believe in housing first. I believe that now in the city, just recently, we actually have more supportive housing beds than we have shelter beds. I can see Donna Gray nodding for the first time. We need to make more progress on this. I believe that we have people around this table who are dedicated to making that happen, but I really appreciate you bringing solutions to the table and waiting all day to speak to us. Thank you so much.
Thank you.
Thank you. There's another question from Concierge Plante.
I'll say it again, I have the best residents in the entire ward, but I'm biased. So thank you so much, Andrew, for your presentation. I just wanted to say myself and some other counselors are going to Options by Town, which is based on everything Andrew was describing, I believe on the 2nd. So if any of you would like to come and see Options by Town and see the wonderful work they do, we invite you to join us. And the residents of Options by Town are just so special and lovely. So all are invited. If you haven't been yet, I invite you to come. A special invitation to you, Chair, to come and check it out. So thank you so much, Andrew. And thanks again. It's a snowy day. Thank you for waiting. I really appreciate it.
Thank you.
Thank you. Our next delegation is John Hennessy.
Good afternoon and bonjour to everybody. Thank you very much. Just want to make sure, by way of nod or yay, can everybody hear me?
Yes, you're good.
Okay, perfect. So I'm a Byward Market resident. I've been in the Byward Market area in Ottawa for over 43 years. I'm amongst the newest business owners in the Byward Market. I have a business called Zups Byward. Sorry for the shameless promotion on the camera here, but I've been doing media interviews. So please forgive the lack of protocol on that one. We've created a pretty unique business. I just want to frame it in context that can help me then speak to the issues at hand. So it is a French-Canadian themed post-COVID kitchen poutineery that's sophisticated with a French-Canadian grocer and a tourist destination, a food tour destination. I put that context out there. We opened up in August and in the Byward Market building facing onto William Street. I knew there was a problem in the Byward Market and a broader problem, both for homelessness and finding and shelters. I was well aware of that when we opened up. I took a position that we were going to lead and try to affect change in our building and on William Street in the Byward Market by leading with some kindness. An example of one of the acts that I did is that we gave over 1,000 cans of water and Gatorade to residents who were in need. And I think I've identified a problem that I've never heard anybody talk about in terms of dehydration that may be able to temper and tone down some issues. So at an appropriate time, I'd like to talk about some of my discoveries in that regard. I would also like to give due regard to all of the other wards and everybody else. It is a citywide problem, and the focal point is clearly in the Byward Market. One of the things that I struggle with is understanding the handoff of the duty of care from shelters who are openly supporting people as they should, and in the morning those people are asked to leave. And a flood of people then come into the Byward Market with no handoff to anybody other than the community. And I find that troubling. When I look at the concentration of people in specific areas around shelters, and I look at nobody there to try to offer some services or some contact points or anything else or guidance on how to manage or do something during the day. So I struggle with the business model of hoteling people overnight, gating them when they come in, making sure that they have no drug paraphernalia, that they're not high, they're not drinking, they're not drunk, you can't come into the shelter. But those who do get in the morning, they're released back into the community, and they have no recourse, nothing to do other than to be free range in our community. I think there's an opportunity for us to divert some funding and look at some programs that can help with that exchange. And I think it would take some of the pressure points and the tension off what's happening. I believe there's sufficient money and willingness in the community and the business owners to try to find a way to do some of those things. I also think as we talk about budgets here, and we look at something like the Byward Market building, which is an anchor point. It's in this municipal corp design right now. That building should be more accommodating in every possible way to the constituents who need help the most. And it's not. It's a closed ecosystem with limited hours and choosing not to help people. So lastly is that there is a loose group of community-minded people who are looking at trying to come up with something, some way of helping in the community in the gap that goes in that duty of care, dropping the baton. And I should have said that I'm finished. Sorry about that.
Thank you, John. I appreciate it. And I did note you have the business name behind you, so you've got it all laid out. It's great promotion, great marketing.
No, it's not designed for that at all. I'm literally, we're supposed to be on the canal, and the press won't leave me alone. They want to keep talking about the impact of that for our business. And I've got lots of interviews that have happened. So sorry about that.
Oh, no, it's fine. Thank you very much for being here. I don't see any questions for you. Thank you very much for your delegation.
Thank you.
The next delegation is Steve Manook from Ottawa Venues. We don't currently see him, but I'm just calling in case he is here and he can accept the prompt. Okay, we don't seem to see Steve. So our next delegation is Amanda Quince from the Child Care Now Ottawa.
Hi, everyone. I'm just going to pull up my information. I've been waiting for a while, as I'm sure you're all aware. This is an intense meeting for you guys to be at. And I'm really glad for the chance to speak to you. Just gotta get my wits about me a bit. This is a very different topic. Childcare in Ottawa has been we're in a point of major change. With the last municipal election, folks are coming into this committee with perhaps lots of experience and perhaps new to the community services world. And as you're coming in, you guys are going to be the architects for a childcare system, like an actual childcare system in Ottawa. So the Canada-wide early learning and childcare system involves a lot of funding coming from the federal government to the province and down to the municipal government, who gets to decide where childcare is going to go and how that expansion is going to happen. And so this is a really important role. And I would like to talk to you a little bit just to encourage the committee to take this expansion seriously and to really have a growth plan that supports not-for-profit and municipal public childcare expansion, which is going to take a lot of work on the part of committee members and on the part of the city to proactively develop those plans, to proactively use the tools at the disposal of the city when it comes to identifying spaces and identifying areas of the city that need childcare. So what's happening right now is that childcare in the city of Ottawa, there's about enough childcare for almost a third of the children in our city, which is not very much, given that the cost of childcare as of December 2022 has dropped by 50%. And is going to be going down again. And that funding is going to make a huge difference for families, because families had been paying, I, as a parent, paid $1,200 a month for a toddler spot in downtown Ottawa, and that was a lot of money. So those fees going down is going to make a huge difference, and it also means that so many more people are going to be able to afford childcare as those fees come down again to an average of $10 a day per child. And when those fees come down, that means that more people are going to be looking for childcare spaces. So that's why right now, the funding that's available through the Canada-wide Early Learning and Childcare system is going to, it's going to be used for expansion. So that expansion that you are promoting, if we as a city emphasize quality, which is known to be more frequently found, almost only found in not-for-profit and public childcare settings, we can prioritize that. We can prioritize that quality childcare expansion. And the other thing that we can do as a city is we can start to think about what it is that quality is, and what quality means actually is educators who are qualified and who stay in the profession. So early childhood education is not a field that draws a lot of folks because it's fairly underpaid. So I think that it is the role of the city to recognize that expansion can only happen by paying early childhood educators well enough, which the city does. So I think what I'd like to speak to is that the city, in your budget, you need to be planning expansion and making use of those dollars from the federal and provincial budget to expand municipal childcare centers. You guys had a very high bar for what is good quality childcare, and you do provide that as a direct operator of childcare settings. And so continue and expand along with the not-for-profit operators who are interested in doing so. And please, as you're thinking about this, a growth plan is necessary, a growth plan that identifies the supports that the city can give to not-for-profit operators who are interested in expanding their childcare settings and spaces. But also, we've got to address that workforce, the workforce crisis in early childhood education, and we can only really do that with wages. So being aware as you're looking at applications, how do centers pay their educators? Are they likely to actually be able to staff the spaces that they wish to expand? The city is at a pivot point where the money comes in and then you're passing those dollars on for expansion. So I hope that you take this role and this opportunity and do good work with it. So thank you very much.
Thank you, Amanda. You have a question from Conseiller Plante.
Hi, Amanda. Hi, Amanda. Thanks so much. Obviously, we all agree that childcare is a necessity, especially to get women back into the workforce after giving birth. It's so important that those childcare centers and those spots are there because women's obviously participation is very important. I just wanted to flag for you. So I'm not sure if you know what happened with the Sandy Hill daycare. They had a fire and they had to relocate. And now we're dealing with a situation where they got a temporary license, and trying to turn that temporary license in their new spot is turning into a bit of an interesting situation. I was wondering if you could speak to sort of the licensing component. Obviously, we want childcare centers to be licensed and to be in good standing, but is it, in your view, a bit of a bureaucratic morass, especially in situations like the one I described?
So licensing is actually done at the provincial level. It's the responsibility of the provincial government, and licensing for childcare is it provides a floor for quality. So it's ensuring children are safe. It's ensuring that ratios are met. It's ensuring that that there's emergency numbers and that the people who are on the emergency list get called. All of those little details are all within the licensing requirements for a childcare center, including the number of square feet per child. And although I recognize that the city definitely should be working with the folks over at over doing licensing, and so the Ministry of Education is actually the body that licenses childcare settings. yes, there's a lot of bureaucracy. Yes, there's a lot of paperwork. Ultimately, I worked both in Ontario and in Quebec, and I appreciate that all of those levels of paperwork represent an attempt to try to make children's spaces and days safe, interesting, and positive. So when it comes to the obstacles that we face in early childhood education, in finding spaces and in making those spaces meet the requirements, those obstacles are often overcome with dollars and know-how. And so at the city, there is know-how about how to meet getting permits, because all childcare spaces also have to meet, like anytime you have electrical work done, it has to be approved and permitted by the city. And so having people who know about that within the city supporting childcare centers as they go through expansion or as they go through the licensing requirements is important. And it's a huge way that the city can support and maintain and expand childcare spaces. I don't know about the experience of the Sandy Hill Child Care Center. I'm not sure which center that was. But I do know, having worked in childcare for a long time, we aren't just because we know a lot about how to work with children doesn't mean that we're necessarily good at figuring out how to expand and renovate a building. That knowledge is acquired in different fields and sometimes in our home lives when we're going through renovations, but it doesn't mean that we all have it when we're working in childcare settings. And so the city can definitely support the work of not-for-profit centers in expanding with this funding by linking up with services and parts of the city infrastructure that knows how to make those changes.
Thank you very much. You have a question from Councillor Troster.
Hi, thank you so much. I thank you so much for your advocacy on childcare and for a reminder that the role has to play. One of the greatest joys of my day is that there is the city childcare center is right outside my window at work. So sometimes I take a break when I hear little children in snowsuits playing. It's very cute. But it's also very important that we have this public childcare where the staff are unionized, which is exceptionally rare. I did just want to let you know that in my ward, in Somerset Ward, there's 2 new developments coming in at LeBreton Flats and also near the new Gladstone Station. In both of those developments will include childcare centers. One, I believe, run by the city and one run by Andrew Fleck. So I know it's just the beginning, but I encourage other councillors to really think about working to get childcare into new developments. It is so important. Thank you.
Thank you. And I'm so glad to hear that there's that there are additional municipal centers planned and in the works, because the city of Ottawa really is, the city of Ottawa has 10 municipal childcare centers, and they set the bar for decent places to work for early childhood educators and high quality centers for children to spend their days. That role that the city has played for a long time now, for many decades, it needs to continue. And the only way to continue to lead and support high quality childcare center across the city is to continue the expansion of municipal centers as well as the not-for-profit centers. So I think that those go hand in hand and are really important. And I'm glad to hear that there are new centers in the works. That's excellent.
Thank you. You have a question from Councillor Lowe.
Thank you, Chair. Councillor Trost actually stole the first half of my question. I foresee a really good opportunity in partnering future developments with childcare centers. My other question is, I think you mentioned that right now we have capacity for about 1/3, I believe, of children in the city. In terms of a short-term vision, what do you see as an ideal capacity? Let's say 2-3 years.
Actually, those numbers aren't even. It is becoming a requirement for that provincial and federal funding that the city expand. And if we want to talk about my ideal and what I think we should have, I think that every child and every parent who is looking for a childcare space should be able to access one. Right? I think that that's we live across the river from Quebec, where they lowered the cost of childcare back in, 1997 or 1998 to $5 a day, and they saw huge expansion in the need and the waiting lists as well. And they're still addressing that. Here in Ontario, we're beginning to lower the fees for childcare. We know that that is going to mean that there's an increase in the demand for childcare. Gosh, did you guys know that kindergarten is optional and you don't actually have to send your children to kindergarten, but everybody does because it's childcare? The uptake for programs for young children by families is phenomenal. It's almost 100% when things are affordable or free. And I think that we as a city, we might not be able to afford to expand to enough childcare spaces for every single child right now, but we should aim for that. We should, because that is actually what the demand is. Every parent wants to have a safe place for their child to be while they're at work, whether they are working on their own schooling, whether they're working on a business, whether they're working for the city, whatever their employment might be. We all want to have safe places for our children to socialize and to play and to learn with early childhood educators. And so I think we can, that might be, a ways down the road. We don't have the funding currently for that, but the municipal governments are required to expand by a fixed number of spaces. And we're only this year aiming for, I think, a third of the children. But with COVID and the pandemic, we've actually seen the number of spaces decline in our city, right? So if you look at the system service plan from, I think it was 5 years ago when it was written, and it's kind of expiring this year, we did have almost a third coverage for a third of the children in the city. But that has gone down because early childhood educators have left the field. This is a very demanding job and it's quite underpaid. And on that note, municipal centers have a starting salary that is quite decent. So that you have not seen as employers, all of you counselors and committee members are actually the employers of those ECEs in the municipal center. And you guys are good employers and you keep your staff and you have seen low turnover. But across the sector in early childhood education, we've seen very high turnover. We're finding centers closing rooms and closing programs because they don't have enough staff. So how are we going to ensure that staff stick around and that we can see the expansion that we need?
Amanda,
yes.
Thank you so much. I don't know if Councillor Lowe has some more questions. I'll just ask that you keep your answers just.
Sorry, yes. I'm very passionate about this. I'm sorry to be long-winded.
Councillor Lowe, did you have any other further questions?
No, I really do appreciate that information. Thanks very much.
Wonderful. Councillor King has a question as well now.
Thank you, Chair, and I want to thank Amanda for the advocacy. And maybe I'm not going to be the most popular person here because my question was primarily about how do we address those workplace challenges in the context of the municipality. Yeah. So I just wanted to leave.
No, it's an important question. And as the municipal government, you guys have as an employer in those municipal centers, the wages that ECs make working in municipal centers are good. The starting salaries are good and people want to work there and they want to stay there. They see their careers as being in childcare. Encouraging not-for-profit centers to maintain that same salary grid would be wonderful, and advocating at a provincial level for better funding, because currently the provincial government thinks that expansion is going to be possible just by funding just by directly funding the childcare centers without addressing the workforce crisis, really. So advocating on behalf of educators to say we need decent wages to be able to recruit people to this field.
Well, I appreciate those comments and also the suggestion of a growth plan. I think it will be very important since we'll be seeing a intake of a tremendous number of federal dollars around childcare, and I think it will also behoove us as well to consider childcare when we consider our term of council priorities. So, thank you so much for your advocacy and for your answers. Really appreciate it.
Thank you.
Thank you, Councillor King. Thank you very much, Amanda. I appreciate it. Our next delegation, and I don't know if she is with us, but Monique Delisle. I'm not seeing that Monique is here. We'll move to the next delegation, number 41, Jane Doe. Okay, I understand Jane might not also be here with us. So our last delegation is Calla Barnett.
I'm here.
Calla, welcome. You have 5 minutes.
All right, thank you very much. So yes, my name is Calla. I'm a Sandy Hill resident. I'm a 40-year-old white cisgender queer woman who is also physically disabled, and I'm a single parent. All right, this is all very important for understanding where I'm coming from today. I've lived in Sandy Hill off and on for 20 years. The last stint I did in Sandy Hill was 7 years on 117 Daly, and I moved to Chapel Street, still in Sandy Hill, in November because I couldn't take it anymore. I love Daly Street. I loved Daly Avenue, but we only had a front yard, and that put us at risk. Another thing to mention is that I sit on the Action Sandy Hill Community Association. I'm also a member of the Parent Involvement Committee of the Ottawa Carleton District School Board, and I sit on Lambda Scholarship Foundation, which gives scholarships to queer students, and queer and trans students. So I like my diversity. I like the diverse neighborhood. I'm actually rather good friends with some of the shelter users in the area, and I've noticed that absolutely no one has talked about the needs of shelter users other than they're addicted sometimes and need help with that. And so I want to say one thing that's incredibly important. The shelter users and unhoused people in the downtown core who were not living here before don't want to be here now. It's constant. They don't want to be here. They want to be in their neighborhoods, but there are no services in the rest of the city. And I'm not even just talking about people who are addicted. I'm talking about people who are not addicted, who lost their homes for any number of reasons that have to do with our very poor economy right now. And they are stuck in the Mission or in the SHEPs or at the Salvation Army, right? Because there's like a triad of shelters right around Daly Avenue and Besserer, that, they have nowhere else to go. And then they walk between services. Center 454, who, like the Sandy Hill Community Health Center, doesn't really help cleaning up the area after their clients leave. Everybody's got a zero tolerance policy. What does that mean? That means that people who are high are kicked out of the shelters and out of the services and into my neighborhood. There is no support for them in that situation. Zero tolerance isn't working. It's just offloading the problem from a business who is supposed to be helping to a community that is simply sitting by. And so we've got people coming in from neighborhoods who don't care about this neighborhood. We've got people coming in who need help and aren't getting it. And then there are systems in place that don't allow them to get the support they need when they find housing, for example, like some women who were at Cornerstone, not my ward, but who were at Cornerstone. They wanted to get an apartment together, but the shelter worker said, no, we don't want you to do that. You need to live alone. So just stay in the shelter, right? We won't sign off on that when we apply. So there are many, many things wrong with the systems. And I am also, I should mention, a doctoral candidate in political science. So like I do this for a living on different levels. And I'm just so tired of it. I'm exhausted. I moved because I didn't want my 10-year-old to have to watch people OD on their front step. This is my 10-year-old. All right. And I'm like, I feel bad for the employees of the Rideau Center. I feel bad for everybody, but my kid would run home after school and knock on the door and say, Mom, someone is passed out and I can't tell if they're dead or not. Please come and help me. Right? Which is the right thing to do. But my God, why do they have to do it? And so I've been looking at this budget and I've been looking at allocations. 13 housing first organizations. Why do we need 13 to be funded? 1,000 new emergency shelter beds. That's great. or 1,000 shelter beds. Where are they going to be? Are they going to be at the Mission and at Sheps and at the South? Because, we got enough beds. We need something else. So, and the other thing I wanted to mention is that the entire City of Ottawa budget is based on a competitive model. But this should not be a competitive industry. It should be a collaborative one. And I leave you with that.
Thank you very much. There is a question from Councillor Plante.
Thank you so much, Kellen. Thank you for all the work you do on ASH. I just wanted to ask you something a little particular. You referred to shelters as a business. Can you elaborate?
Absolutely. So I liken it to international development. So, and which is where I am educated at a master's level. But essentially, when you funnel money through the shelters, people are making money off that, right? Somebody is making a lot of money for being the CEO of a shelter. Other people are making a lot of money for providing the beds for the shelters, for building in the shelters, for providing private services to shelter users, if the case may be. It's a business. There is an economy attached to homelessness. That is what I mean. And it is a self-fulfilling economy that allows people to continue to make money off the poverty of others.
Fair enough. Thank you.
Thank you, Kala. And thank you to all the delegations who appeared in person or online today. It was very valuable to hear from each and every one of them, and it is appreciated that they took the time to spend with us today. That is it for our delegations. I now will be inviting staff to resume their seats so that we can move to questions to staff. And while we're waiting for them to once again set up, I will ask the Vice Chair Bradley to read into the record the roadmap motion for the budget that we will be considering.
Great, thank you, Chair. So here's the motion that the Community Services Committee recommend that Council, sitting as Committee of the Whole on March 1st, 2023, approve the Community Services Committee portion of the 2023 draft operating and capital budgets as follows. Number 1, Community and Social Services operating budget as follows. The General Manager Office Support Services and Community Safety Wellbeing Policy and Analytics Operating Resource Requirement on page 4. B, Employment and Social Services Operating Resource Requirement on page 7. C, Children's Services, I, User Fees, page 11. 2, Operating Resource Requirement, pages 9 and 10. D, Housing Services Operating Resource Requirement on page 13. E, Long-Term Care Services Operating Resource Requirement on page 15. F, Gender and Race Equity, Inclusion, Indigenous Relations and Social Development Services Operating Resource Requirement, page 18. Number 2, Recreation, Cultural and Facility Services Operating Budget as follows. A, General Manager's Office and Business Support Services, Part 1, Users Fees, page 22. Part 2, Operating Resource Requirement on page 21. B, Community Recreation, Culture and Sports Programs, 1, User Fees, pages 26 and 28. 2, Community Recreation and Cultural Programs, page 25. 3, Remaining Operating Resource Requirement on page 25. C, Complexes, Aquatics and Specialized Services, Users Fees, pages 32 and 34. 2, Operating Resource Requirement on page 31. D, Parks and Facilities Planning, Part 1, User Fees on page 37. Part 2, Operating Resource Requirement on page 36. E, Facilities Operations Service, Part 1, User Fees on page 41. Part 2, Operating Resource Requirement, page 40. Number 3, Public Works Department Operating Budget, Parks Maintenance Services Operating Resource Requirement on page 33. And finally, Part 4, Community Services Committee's portion of the capital budget, pages 44 through 46. Individual projects listed on pages 86 through 138, including revised pages 92, 104, 106, and 111.
Thank you very much, Vice Chair. I'm also going to ask just to allow the opportunity for staff to comment if there is anyone else with any other motions or Anything else that they haven't brought forward as of yet, if they could do so now, that would be greatly appreciated. Okay, seeing as none, then we'll now go to questions to staff. Conseiller.
No, sorry, it's for afterwards. Thank you.
Oh.
I was confused. Sorry.
Okay.
I'm always confused. It's all
Chair.
good.
That's fine.
Chair, I just put,
Councillor Hill, you're first up then.
okay.
Councilor
thank you for-
Kavanaugh's been trying to get your attention.
Chair.
Councillor Kavanaugh, yes.
Yeah, I did. I just submitted a motion. And it's with the clerk right now. And he's just making some minor changes to it.
Is it,
It's on seniors.
perfect. Okay, if I can ask you to read that in right now, and then we'll have the opportunity to ask any questions that we may have.
Okay. Whereas Ottawa has a significant growing senior population who are living with a range of social and health needs, and whereas research demonstrates that the large majority of seniors, 80% plus, overwhelming express a preference for aging at home as opposed to institutional settings, whereas community agencies have further demonstrated the cost of providing home-based services, seniors, transportation services, home-based personal and health supports, programs to combat isolation and food insecurity are cost effective and lead to significant savings in use of emergency servicing, and delay in move to long-term care settings. And if you could just move it up, please. Whereas senior serving agency across Ottawa, including the Old Forge, are providing effective and preventative services for seniors aging at home and are only limited in their capacity to provide these services by financial restrictions. Whereas the naturally occurring retirement communities NORC model for supporting seniors at home, particularly the OASIS model, which has been operating in Kingston for over 10 years and has proven successful in decreasing emergency room visits by 26% and hospital admissions by 40%, and has led to a 45% reduction in need for home care services for seniors living in OASIS supported facilities. And just wait for you to move it up. Whereas the NORC OASIS model saves significant taxpayer money by leveraging existing community resources and empowering seniors to create, drive, and delve supports in a way that meets the unique needs of each building or neighborhood. And whereas Ottawa is currently hosting a 2-year OASIS pilot project to demonstrate the efficacy and cost effectiveness of the OASIS model in partnership with Queen's University, the Old Forge, the Ottawa Council on Aging, and residents in 3 Ambleside condos in Bay Ward. And whereas OASIS pilot projects are also operating in Belleville, Hamilton, London, and are in the process of being launched by community groups in a host of other Ontario cities. And whereas several community groups and organizations in Ottawa are learning of the OASIS model and are seeking funding to initiate OASIS-type programs in their community. And I'll get to the therefore be it resolves. If you can just move it up, please. If you can move up the motion, thank you. Therefore be it resolved that Community Services Committee recommend the Council direct the Mayor of Ottawa to write to the Premier of Ontario and the Minister of Health and Long-Term Care to request a planned and intentional diversion of sustainable funding from outdated institutional models and towards community-based aging in place supports like the NORC OASIS model, which are proven to increase quality of life and self-determination, delay, prevent use of emergency services and long-term care facilities, save significant taxpayer dollars, and respond to the preferences of seniors across the province.
Okay, thank you, Councillor Kavanaugh. We'll have an opportunity to kind of revisit that or even touch base on that regarding as we go through questions to staff. I do want to think about that too, because you are asking committee to direct the mayor. So it might, let's chat a little bit offline in respect to the best process for addressing this. So, but this is on the table and we do have the roadmap motion as well. I am going to, Conseil Plante, you're still first on my list. I'm assuming that's, but that's okay. So I'm going to go to Councillor Hill.
I actually had an email from a resident. I'm not even sure who to direct it to. She was wondering if there is money allocated in the budget, and I apologize, I don't know it line by line by line, to any eating disorder organizations or and I honestly didn't know, and I thought I'd pose the question. And my understanding is, Donna, you've received an inquiry from my office about the breakdown of spending of money that comes from the feds, the province, and the municipality for the different shelters that are located in my ward. I'm not sure how you would like me to submit that officially through these channels, but if we could get that breakdown per shelter at some point in the next couple of weeks, that would be appreciated.
Madam Chair, so with regards to the residents' inquiry, no, we do not fund eating disorder programs. With regards to the funding breakdown and the funding source for shelters, we can provide that to you in terms of the funding breakdown by program area, of which shelters are a component of those program areas. And we're happy to do that.
So how would I get the funding? Like, say if I take shelter ABC and I want to know how much the province contributes, the feds contribute, the municipality contributes, how would I get that information?
We'll provide that in a memo, but I could do that today, right now. So emergency shelters, so 35 million is what we spend on that. 32% of that allocation is in the municipalities. 63% is funded through the province, and 5% is funded through the federal government.
And is there a way to get it per the individual shelters? Like how much they get each individually?
Madam Chair, yes, we can break that down. Yeah, we have agreements with each individual shelter that we actually fund in terms of the amount of funding the city provides to them from these funding sources of the $35 million.
Okay, so I will send you a list then of the shelters in my ward, and if we could get the breakdown through the 3 levels of government, I would appreciate it. Thank you.
Thank you. Thank you. Councillor Lowe.
Thank you, Chair. Thank you, Chair. I want to go back to one of the earlier public delegations that spoke about the state of, well, the availability of mental health services in the rural areas of the city. Has staff or has the city or have any community health organizations ever approached the city to maybe find a happy medium where some of these services get located in the suburbs, which are a little closer to the rural areas, while still kind of having that population base that we have to support them?
Thank you, Madam Chair. So when we do the community funding framework, we do look at geographic location as well as youth and demographics as well. And so when we look at mental health and we look at services, the investments for youth, we have about 75,000 for youth, and 2.3 million of the 28 million is actually with regards to youth. Or sorry, the total youth is about 4.5 million with regards to youth overall, of which mental health is a component of that investments. And what you saw today was the discussion about an alternate response to mental health that the Guiding Council actually spoke about in terms of trying to divert calls from emergency organizations and move it into an alternate response. The alternate response that they talked about, which is moving some of that into the health sector, which is emergency services, is going to be citywide. So it will cover all geographic areas. But with regards to the specific organizations that we fund and the funding investments that we have, I'll ask Suzanne Obior, our Director of Community Funding, to really specify that.
So thank you for that, Madam Chair and Donna. And just for clarification, are you looking for the organizations that are receiving funding for mental health? Maybe if you can just clarify the question.
Yeah, I honestly, it's been a while. It's been a few hours. So in my notes, I just wrote, I see opportunities to improve some of the services that we're providing for our youth, for the youth mental health in the suburbs with the suburban population base and geographic proximity to the rural areas, as the council spoke to. Yeah, it's been a while, so I honestly don't remember the context. I just have my notes.
Well, certainly I can speak to the approach or the process for allocation of funds, and Donna did acknowledge that there is considerations that looks at a priority population as well as geographic location. Funding is allocated based on the priorities of the community funding framework. Our applications are assessed by allocation committees in accordance with the council's approved city funding process. And we do have a lead allocation committee that's knowledgeable of the range of services available in the sector and the issues and emerging needs in the community, and select agencies and provide recommendations to the city on agencies that would require that funding. I should note that about 90% of the applications that the community fund did receive was from the urban areas. Approximately 10% of the applications came from the rural areas. And close to all of that 10% did receive funding through this process. In terms of the rural applications that did align with the community funding priorities, we were able to fund the Osgood Youth Association, the Rural Ottawa Social Services, Western Ottawa Community Resources, and the rural investments are about 5.6% of the funding envelope. I hope that helps to answer the question.
Yeah, honestly, if it all comes back to me later on, I'll just send you an email. Thank you.
Thank you, Councillor Lowe. Councillor Troster.
Hi, thanks to all of you. I have a couple questions that are a tiny bit in the weeds under housing services, Donna. I noticed there's a huge drop in revenues from federal and provincial governments from 2021 to 22. This is on page 13 in the budget. And then there's a smaller decrease from 2022 to 2023, but it's still trending down. Is the amount in the 2023 budget an amount we can expect to see moving forward, or do you expect those other sources of funding to continue trending downward?
Madam Chair, what you can see in the budget is the biggest drop is the COVID social service relief funding that you see that came through MMAH to the city as COVID response. We just got our allocations on the other levels of government. I'm going to pass that to Paul Levine, our acting director of housing, to speak to what those allocations are each year and the differential, the slight differential we've had in some, and what we're anticipating in 23-24.
Thank you, Donna, and thank you, Madam Chair. So essentially, they're based on provincial and other federal sources of funding. We are expecting a difference of about 12 million for 2023. That's not included in the budget book. These are programs such as the RHI 3 funding that you're familiar with. There's other provincial programs for capital repairs and retrofits to social housing providers that are added.
So
as well as the Canada Ontario Housing Benefit Program.
That's great. So I know we usually aim for a third from all levels of government. Do we have a sense of what the split is for housing services in this budget between, or just in the housing services we're providing between federal, municipal, and provincial? Or is that just, if that's too much in the weeds, that's fine. I'm trying to get at the root at where do you need us to advocate?
Well, certainly I can speak to the long-range financial plan that you referred to, a third. No, unfortunately, we're not close to receiving a third from the upper levels of government. We continue to advocate to get more funding for capital funding as well as operating funding for a variety of programs.
Thank you. And I just have a question for Dan on the recreation, cultural, and sports programs. So we see an opposite situation there where there's a significant jump in anticipated revenue. Is this just because we're scaling up programming that didn't exist during COVID?
Chair, it's primarily what I talked about in the introductory slides, that over the last 2.5 years, because we were essentially either shut down or significantly curtailed, the revenue estimates for the department were actually decreased to a significantly, what was thought to be a more realistic level. What's happened, and that was backfilled with provincial dollars to make us whole. What's happening this year is that we're readjusting the revenues by about 26 million to the department's bottom line to reflect full-scale operations, essentially back to 2019 being the base last normal year that we had. So you are seeing our revenue lines throughout the budget jump significantly. But that is a combination of two things, that adjustment plus the 2% increase on our revenues.
That makes sense. Thank you.
Thank you, Counselor. Vice Chair Bradley.
Thank you, Chair, and thank you to staff for your presentation and to all the delegates who came out today. I've got a bunch of questions. They're kind of all over the place, so I'll try to keep it concise. My first question I think is appropriate for Donna. In your presentation, you had said that there's the $550,000 allocated in base funding for the alternative call response model that money came into play in 2022. And I'm just wondering if you can elaborate more on how those funds will be spent in 2023.
Yes, thank you, Madam Chair. So part of what you saw today in the delegations was a presentation from the Guiding Council, which is really the organization, the arm's length organization that we've been working with to develop the alternate response. And you can see in that what they identified was a number of solutions that they see for the alternate response. The one that they spoke about today is the, option 4. So, when you select fire, police, paramedic, option 4, mental health, is that then that option being dispatched to Ottawa Paramedic Services, that being dispatched out to a non-uniformed response with a mental health professional on that team, and then a paramedic or a peer support group being attached to that to do the handoff and the additional supports. So really that one option is really where the funding for 2023 is going to start with the implementation of that. And the details of implementation of that. So some funding to some community agencies and some technical work. The other piece that they're going to start to do, and you're going to see that in the Q2 when the report comes, is the other options that they have where they're talking about a direct line coming in that is diverts away from 911 entirely and goes directly to an alternate call taking, whether that be 211 or the distress center. They're still ironing out those details. So that they're going to figure out the business case for that, the organization and what that looks like and the funding requirements. And then the third kind of component of that is the response team. So that's a multidisciplinary team that has mental health practitioners and other practitioners on the ground delivering that services that actually is also looking at really being culturally sensitive to diverse populations, figuring out the business case of what would be the investment and the requirement of that. As well, in 2023, that money will go towards developing training and implementing training for some of the service providers in that network. And in addition, police will be funding mental health practitioners in the 911 center as a first part of that triage call.
Sounds like that $550,000 is going to go a long way. Is the bulk of it funneled through paramedics? And I thought that program had already initiated. Has it not yet? I thought that they had already started to partner with mental health agencies in that response.
Absolutely, that had started, and that they received some funding for a pilot that they have been initiating and doing the evaluation of recently. And I don't want to speak for paramedic services, but we've been working with them with the university to do the evaluation and seeing some fairly significant results in the diversion activities. So it would really be expanding that model. So they'll be working with the province in terms of how do we expand that model. So the money wouldn't be going to paramedic services. It would primarily be going to the technical and the teamwork to do the call algorithms that have to happen in order to get those calls appropriately transferred, and to a peer support group, scaling up peer support on an existing services to be able to attach it to the paramedic service.
Thank you for that. I'll stick with questions for you right now. So we had a presentation delegate from Childcare Now, and so they were delegating on that there's a significant reduction in fees for parents now who have kids in childcare, and that they anticipate that there's going to be an increased demand for childcare. And so I'm just wondering if we've already seen that impact in demand for services for childcare, and if there are plans to increase capacity with our existing centers or potentially new centers.
Thank you, Madam Chair. I'm going to pass that over to Jason Sabra, our Director of Children's Services, to respond to the growth plan and the province's program around expanding growth.
Yeah, Chair, thanks for the question. Bit of context that the reduction in fees has happened. As of January 1st, fees in childcare are reduced by just over 50%, which many families have expressed as life-changing. We most recently just got the provincial plan around space allocation and growing the system, which many families, I think when they heard the announcement around this federal and provincial system, thought it was going to be universal. You know, everyone wants a space for everyone. The delegate spoke how we currently have one space for every 3 children. The provincial plan across the province is really trying to achieve the same thing. They are trying to achieve growth across the system of one space for every 3 children. So in Ottawa, obviously our limited growth is not going to meet expectations of families. And absolutely, we have seen already the increased demand from families. Our childcare waitlist and registry, we've seen a significant increase in families who are just registering because they are now interested in these amazing affordability aspects for families. I'll put the Ottawa growth in context of what we have to align to the provincial approach. Ottawa has just over 1,500 spaces to grow by 2026. Just over half of those are in school-based locations around new schools, which often help with growing communities. The remaining 800 spaces will be left up to the city to decide where those can happen in line with the provincial direction to focus on the communities that need them the most. Often these are the families who face the most systematic barriers, racialized, Black, Indigenous communities. And we are currently developing a process around that right now to target where those new spaces can be built. And as our service plan outlines, a lot of our priorities are being built based on evidence-based decisions and using an equity and inclusion lens.
Thank you for that. I'll take this opportunity just to plug a parcel of land in my ward at 250 Forest Glade that I noted is up for disposal, and it was held for a long time for a potential childcare center. So perhaps it's time to revisit that before we dispose of that piece of land. I'm going to move on to Parks and Rec. This one is very small and very ward specific, but I just wanted to understand on page 107 in the budget, there was funding allocated to do a type 2 building condition audit on a rink shack in Pushman Park. And I just wanted to understand, is a type 2 condition audit, do we do that if there's an issue with a building? Does it suggest that because it's a fairly new building, so it just sort of gave me a pause for concern when I saw that.
Chair, this is infrastructure services are the folks that generally do this as part of our asset management program. And my understanding is that they do condition audits on a 5-year regular cycle. So I don't suspect that it's because there's a specific issue. It's probably just a rotation of when the building is due.
Fantastic. Bear with me with this one because it was sent to me and I just want to make sure I get it right. So a resident had reached out with regard to programming at Dover Court. Their child has autism, and there's programming that was available there. Apparently, and I haven't done much investigation into this, but that the Greenboro Community Center used to have one staff assigned for their after and before care programs for a staff who specialized in dealing with kids with autism. And the family alleges that this funding for this staff person was cut, and now they've moved to a model where we have one staff person who rotates between different facilities in the city to support kids with special needs, and that this it's not adequate. It doesn't meet the needs of the kids that are using these services, and that the training that they're providing to the staff that have, that are there full time it's not working. And so what I want to understand is this as a result of lack of funding? So do we move to this model because we can't fund to have a full-time person at each center supporting these kids? Or is this a new model that many communities are moving towards? I just want to better understand if this is a budget issue or if this was a intentional change.
Chair, and I don't know the specifics of this case. I'm going to guess that this is part of our shared care program where the city provides a finite number of staff that are assigned to work with children who need assistance in our program. And so there is a limit on the number of weeks that each child can benefit from this, as well as the number of children that we can accommodate in any given season. The highest demand is usually during the summer for things like summer camps where there's extended stay for us, but there is also the after school program. It is a budget issue in terms of the fact that we have a limited budget to staff these positions, and the demand is growing. So I guess like many other areas of our budget, often the resourcing cannot keep up with the demand for assistance in programs. In all cases, parents can work with other agencies and often do to have somebody either volunteer or a paid worker in our program. But we do have, and I'd be happy to follow up with the specifics of this one, Councillor, but it is a budget issue from the point of view that the budget that we have for shared care is limited.
Thank you. And yeah, I will follow up with specifics because I'd be interested to know more about that. I think I'm actually jumping back to Donna, and it is my last question here, and it was on the EquiPass and Community Pass programming. So I understand that we're maintaining that funding at 2018 levels, and correct me if I'm wrong, but I thought that we were able to maintain it at 2018 levels because it was underutilized, and so we were able to reinvest that to maintain that level. And so I guess my question is, how utilized is that program? Because obviously the need far outweighs what we're able to provide. And so when it's underutilized, it suggests to me that it's not well advertised or that the people who need it most, an application process is a barrier. And we see that in our programs and in many services that we provide. So I'm just trying to understand if it's underutilized, why, and what we're doing to ensure that we're getting the best benefit out of that program.
Thank you, Madam Chair, for that question. You're quite right that the program has been underutilized, and as far as we can ascertain, it has to do with COVID. And during COVID, the work from home has now evolved as a result of COVID. The work from home has now evolved to more of a hybrid. That, in addition to the fact that there's just people are not traveling as frequently as they had been. The program itself has had sufficient budget for the demand to date. And so we continue to monitor that with our colleagues in transportation services.
Thank you for that. I think I will leave it there, but for me, that's a signal that it's a program. I know the demand is there, and I would think that most of the users that stayed with our transit system during COVID were likely, retail workers, low-income workers that would have benefited from that program. And so perhaps the way we're delivering that program is not best for those who need to use it. And we should be looking towards more barrier-free access to affordable transit. So thank you so much, Chair, and thanks to staff.
Thank you, Vice Chair. Councillor Hill.
Yes, thank you very much, Madam Chair. I appreciate that last line of questioning, actually, Councillor Bradley, and I'm going to follow that up because I'm also quite interested in the transit component and the intersection to our community services. I just want to clarify what the numbers mean for the EquiPass program. That actually, I believe it was 5 million was the budget for 22, and it came in at 10 million. And so if we were overspent in that last year, I don't understand how we undersubscribed the program, or maybe I'm misreading those numbers. So, but I believe it was quite a substantial difference in terms of the projected to the actual budgeted amount.
The EquiPass, excuse me, the EquiPass program traditionally was budgeted at 10 million in and around that level. With the fare freeze and the decreased ridership, the budget was underspent. And so we have amended the budget for 2023 to reflect the demand for the service. I hope that helps answer the question.
I think so, but I'll definitely pull on that thread a little bit, maybe point to point, because I'm certainly interested in ridership marketing and all of the good things that Councillor Bradley was mentioning as well. So thank you very much.
Thank you, Counselor. Counselor Carr.
Hi there. Thank you very much. I think some of my questions have already been answered, but I do have one for Donna Gray with respect to food security. The Sustainability Fund allocates a 26.4 million annually from January 2022 to December 2026. And during COVID, innovation occurred, of course, through the nonprofit sector because of the additional COVID funding that was provided from provincial funds and other levels of government. And I'm just wondering, as we go forward and we look at 2024, how are we planning to ensure that innovations such like new programming, new groups doesn't continue to be lost now that the funding is no longer available from other levels of government? And also, you know, it's not even just the nonprofits, but also like it doesn't, I guess I'm concerned that there won't be enough money for city staff to work or innovate on these issues. It's not just the nonprofits.
Thank you, Madam Chair. And we did see throughout the COVID pandemic that the additional money was really able to safeguard what we're seeing as some of the issues of poverty that were impacting people's ability to pay food, and, you know, are concerned about the impact of inflation on food. And food security was an issue even, you know, as we were coming into the pandemic. It was an issue that was identified across the city as one of the major pillars in our community safety and well-being plan. And that just has been exacerbated through the pandemic. And so the work of that, and the team has been working on that to develop with the community, to start to develop what does that food strategy, that broader food strategy look like for the broader city. And they are working with kind of a range of stakeholders, community stakeholders, private businesses, to really look at the full spectrum of food security. Right from some of the things that you heard this morning, some of the innovation that Ottawa Food Bank has done around the farm. You know, during COVID, our team was able to participate in that and harvest that food, a really innovative, creative program. So we're looking at that from the first start of food to food production, to food distribution, and then, you know, ongoing sustainability. But we're also looking at it in partnership, and it's part of the community safety and well-being plan with the poverty reduction strategy. Because the other piece that's related to food security is obviously income. And we can't look at one without the other. And so those two strategies, the food strategy and the poverty reduction strategy that are pillars in the community safety and well-being plan exist. And you'll see in budget 2023, we maintain investments in the community safety and well-being plan to continue the staff time and resources to work with the community to do that work moving forward. So we're hopeful in this year that we'll start to really look at the most urgent and pressing issues that need to get addressed in this community while we're building the longer term plan of sustainability.
Thank you very much.
Thank you. Councillor DeRoche has actually had his hand up for a little while, so I'm going to throw it to Councillor DeRoche.
Sorry, Chair, I was doing it the old fashioned way, just sort of waving at you there. I'm getting used to this new technology. I've been away 8 years. Yeah, what did I miss? What did I miss in 8 years? Wondering, Donna, if you could just talk about the capacity for additional, I certainly understand the imperative. I understand the urgency of additional funding for housing. But can you just speak to what is our capacity in any 1 year to build, right? We often go through partners, which I understand is effective. But we need to identify the sites. We need to go through, the planning exercise. We need to go through the procurement and construction. We need to have the supports, which, as I understand, are approved by the province, right? Because you can't build supportive housing without the supports that are funded by the province. That's unhealthy. So maybe you can just speak to, like, what is our capacity in any 1 year to actually get on a build?
Thank you, Madam Chair. So we have been working with the nonprofit sector to build capacity. build capacity to build in two aspects. We've been working with shelter providers who are coming to the city and really starting to transition their business model to supportive housing. And so we've had a pipeline of projects, and you'll see, Shepherds of Good Hope, Cornerstone, et cetera, has been building their capacity to build. I would say most of their projects will come into fruition in 23, 24, and we're starting the next iteration of what that would actually look like in the supportive housing. But understanding for supportive housing, our targets were to do 10% per year of affordable housing, and we're far exceeding that now. I think we're at 48% that we have in 2021 of our new units have been supportive housing. So I would say in the supporting housing field, it would be our capacity is kind of waning, and it'll resurface in 24 as those projects come to fruition. But in the affordable housing area, Ottawa Community Housing has been doing incredible work at scaling up their development capacity to do large scale development and to do multiple developments at the same time. And they have a number of large projects that they're building in phases. So you might have heard Mikinak, Gladstone Village, Rochester Heights. And so those are pretty large scale initiatives in various stages. And they have been, we've been working with them over the course of the last couple of years to be scaling up the funding to match where they are in their construction cycles. So I would say in the nonprofit sector as well, we have created a pipeline of nonprofit groups who we have been giving them pre-development funding, which is funding to do all the initial work to get them up so that they're investment ready and construction ready. We've been building that pipeline by carving off a little bit of that $15 million each year. And they're at various stages of readiness for investment. So I guess in summary, I would say, we have a significant number of projects in the pipeline that could be funded. We are still looking to ensure that both levels of government come to the table to fund those projects as per the LRFP. But there is capacity to move those forward, and there is capacity to advance that. It would really come down to the combination of federal, provincial, and municipal funding to make that a reality.
Yeah, that's very helpful. Would we have any funding that have been approved in previous years that are not committed to projects at this point in time?
Madam Chair, no. What we did is at the end of 2022, we were quite concerned about the contingency on our existing projects. So we did take any remaining funds that we actually had and asked council by council direction to allocate that towards construction shortfalls in the existing projects because the dollars aren't going as far. So all of that money is allocated. The only money that wouldn't be allocated to date is the new allocations that we had. So there is our, I think it's 5.7 million in our OFI program, and the $18 million in the RHI, which we're right now in the process of actually allocating that. The 15 million of this year, we have earmarked, and we will be providing that to council the end of this second quarter, what our capital plan is to spend that money. But we see it as fully allocated, both on contingency and maintaining what we have right now in the pipeline that's in construction or in various stages of readiness for construction.
Thank you. Thank you for the answers. Thank you, Chair. Those are my questions.
Thank you, Councillor. Councillor Brown.
Thank you very much, Chair, and I'll speak quickly. Back to Beryl Gaffney Park, I did indicate to Mr. Razine that I would follow up with staff. Are staff able to provide the explanation as to why Beryl Gaffney is showing up in the budget and why there's no spending plans from what I can tell? And maybe a little background on that would be helpful. Thank you, Chair.
Thank you, Chair, and happy to speak to what was presented and the current situation. What I can say is that there is no new 2023 money in this budget. The line that the presentation showed you was works in progress for funding that has been collected and in place for some time. This park and its development and the fund that comes with it dates back to Olympian days and has carried over for some time. I can say, and I've only been involved for the last little bit, but it has been a challenge to find a plan that fits this park and that can get consensus. There seems to be a division between those who want to see it left fairly natural and those that cling to the 1998 plan that had a much more developed array of amenities in the park. One of the things that perhaps has signaled interest in this year's budget is that in 2022, the Active Transportation Fund became available. And one of the priorities for this park is to create connectivity through the park. And more specifically, the crossing of Mud Creek. What's currently there is what's been described as stepping stones across the creek. It isn't adequate, and it is a priority to address. And so an application was put forward to the 2022 Active Transportation Fund to fund essentially a pedestrian, cyclist, multi-purpose bridge over Mud Creek. Unfortunately, we did not. We've recently found out that we did not receive funding under this program. Although in an abundance of transparency, when the budget highlights document was put together, we did list the Beryl Gaffney project as part of that, part of what was going on in that ward. We will now, understanding that there is no funding coming out of Active Transportation, we will now work with the ward councillors that have an interest in this park to see what we do with the remaining funds. There was a suggestion this morning that some of the money had been spent is unaccounted for. I can assure you that's not the case. There were capital projects in the park in the past years that have built 2 bridges, that have built a parking lot, that have remediated pathways. And so all of it is fully accounted for, and we'd be happy to share of that more broadly with whoever may want more information about it. Thank you.
All right. Thank you very much, Mr. Shaney. I think that's helpful. And I guess one more follow-up question to that, if I may. Am I understanding then that there are no active projects that are going to draw on those funds? So those funds are sitting there safe and sound in that account until we move forward with some kind of plan?
Chair, that is correct. The projects that we had entertained as part of successive consultations and discussions were all, we simply could not get consensus. Things like dog parks, which I believe what spun out of that is a dog park in Ward 3, the picnic gazebos and whatnot. All of those things have been set aside since there was no consensus on what to do next.
Perfect. Well, thank you very much for that explanation, and thank you very much, Madam Chair.
Thank you, Councillor. Councillor King.
Thank you, Chair, and I'd like to really thank staff for the hard work that they've undertaken in terms of this budget as well. I'd like to, and I know that a lot of my colleagues would join me, thank Donna for the incredible contributions that she's made to this portfolio and to multiple files, including the file around anti-racism. And, I'm really proud of being able to travel around the city during Black History Month and see the excitement in residents' faces and in terms of their concerns and their understanding that the city has established an anti-racism office, and that council has also approved an anti-racism strategy that will take substantive action. And I know that we were very pleased that in the previous term of council, we saw dollars allocated to the establishment of that office. And I know that the community members are also very excited about the fact that new dollars are being allocated in this budget to the gender, race, equity, inclusion, and Indigenous relations and social development growth portfolio. And we know that the spending is $400,000 across the anti-racism office, as well as the women and gender equity strategy and the Indigenous relations portfolio. I was just wondering if you could outline a bit in terms of where these dollars will be going, because as you can imagine, the community was excited, but they want to have a sense of where these investments will go to result in tangible results for diverse communities.
Thank you, Madam Chair, and thank you, Councillor, for your kind words, and thank you for the recognition of the hard work of the team in developing these strategies. And we're quite proud of the work that's been done under the leadership of Council to develop these strategies. The director, Suzanne Obiora, who is leaving the organization, I'd really like to give her the opportunity to take this question, because it's really been the fruit of her incredible leadership work and direct relationships with the community. And although the strategy will live on and the organization as a senior leadership is deeply committed, I'd really like Suzanne to speak to the work that she's done in leading that across the organization. Suzanne?
Thank you for that, Donna, and thank you for the question. And indeed, the strategy will live on. I'll make sure of it on the other side. So to answer the question, these investments will include staffing and operating dollars for the corporate priorities of the anti-racism strategy as it relates to learning and development, as it relates to community engagement, and as it relates to the development of the evaluation framework for the anti-racism strategy. This, in addition to departmental commitments, each department has made commitments to the strategy and may be putting forward their own financial or budget pressures to meet those. With respect to the anti-racism strategy, phase one will take place between 2023 and 2025, and the focus there is on building internal capacity and awareness within the workplace, and learning on the application of an anti-racism approach within our city processes and as relates to service provision. The investments will also look at the development of phase two of the Women and Gender Equity strategy, and following Council's direction to engage with a diversity of community members to shape phase two of the Women and Gender Equity strategy. We are forming a community table, and that community table, with collective efforts of community partners, stakeholders, and city staff, will help to build on the actions currently taking place, and also look at how we can improve the women and gender equity commitments through community input. And then finally, when we look at the investments for Indigenous relations, this is really to work in collaboration with Indigenous leadership to help with establishing engagement frameworks that will ensure the integration of Indigenous perspectives into policy development and into the services that we are providing within our community.
Well, I really appreciate all the hard work that you've undertaken in your time at the city, Suzanne. It's much appreciated. It's important for us to have the blueprint in order for the community to move forward with the plan. I know that the community also appreciates the strong elements of consultation, and I know that the anti-racism table was meeting just yesterday here at City Hall, and I know that that is a model that other working groups at the city are examining as an exemplar of an excellent way to engage the community. So I really thank you for your contributions to the city. We are sad to lose you, but I think it's important to know that the framework is in place for strong work with the community that will lead to results in equity. I did have one other question, Chair, around facilities. And I just wanted to see if it is possible for us as members of council to have some reporting on the spending plans on both a ward level and a citywide level in respect to facility related programming.
Thank you, Chair. Of course, we can provide details on a facility level for activities that go on, for example, at the Saint Laurent Complex or the Overbrook Community Center. What would take a lot of time and effort is to report on a program specific basis. So if you were to ask about, citywide for each specific program, city's accounting really doesn't automate that level of reporting out. And that would take a little bit more time and some manual effort to do it. If there are specific things that you want to find out about Ward 13 facilities or programs, be happy to work with your office to drill down into this. Perhaps if we can narrow down the specifics, then that becomes entirely more doable and we can produce something that is of value to you.
I appreciate that. I think that we need mechanisms as members of council in order to make evaluations of the programming, the amount of programming in different facilities, the amount of costs that is allocated or budget pressures that are allocated to those programs, and to determine program capacity. So I'll definitely continue to work with you. I know that that's not something that can be done overnight, but I think that both myself and other colleagues I know around the table would love to have some type of measure, both qualitative in a sense and quantitative in terms of the programming and facilities and the capacity. And we would hope to see in future budgets maybe a mechanism that would assist us in having that visibility into those programming and the cost. So I appreciate the answer.
Happy to do that, Councillor and members of committee. There are two things. We are looking at key performance indicators as part of the department's connection to the new term of council strategic plan. And some of the things that we will be looking at is how we perform in terms of service delivery. The other is perhaps a request for a bit of indulgence because we are still in the stabilizing stage of implementing ActiveNet, which is our new registration and booking system. And the ability to produce detailed reports is still evolving right now. And so we are at a bit of a time where we have put all of this data into a new system and are just working now how to get out meaningful data that we can report in a reliable way on. So, but happy to work with members of council to provide the information you need.
Well, we appreciate that. We appreciate the new system. I know many constituents do in terms of being able to book programming through something that's more stable and accessible. And it's good to know that that infrastructure can also be utilized in the back end to provide members of council with data around the programming. So we appreciate that. Thank you, Chair.
Thank you, Councillor. Councillor Kavanaugh.
Thank you very much, Chair. Again, my kudos to both Suzanne and Donna, who are leaving us, but going on to wonderful things, retirement and the special post in Somerset West for Suzanne. I'm thrilled for you. So thank you for all your hard work. As the first liaison on women and gender equity, it was an absolute pleasure to work with both of you. And I think we made some groundbreaking decisions, and I'm really proud of it and just want to reflect what Councillor King has already said. So thank you very much. I also wanted to mention to Councillor DeRoche, if he's ever interested in Ottawa community housing projects that are in line for funding, happy to talk to him. These are shovel ready. So there's no waiting. The waiting is about getting the funds, but we tee things up, and there's lots happening. It's very exciting. So I'm sure you'll be thrilled to hear about it. I wanted to ask about combining our recreation facilities with social services. This keeps coming up, and it's just inevitable that our facilities get used for many things. And I wanted to know if there's any examples across the city for this. because I'm getting asked for it. As we heard from the food bank, where there is a real problem, and I have been asked by our local community house, a community house that is in an Ottawa community house building, townhouse, about expanding, and they don't have anywhere to go. But they're just absolutely at wit's end, because what used to be just a back room is now a full-fledged food bank serving like 30 families a day. It's really crazy. And so they're asking about combinations with our recreation facilities. And of course, we've used our recreation facilities for other things, such as warming centers, et cetera. But is there any examples, or are we considering this combination of the services of social service type programming for our communities with our recreation facilities? I want to know what potential there is there.
Chair, I'll start, and perhaps Donna will want to add to this. There are examples of food banks and other social agencies occupying space in recreation facilities. For example, there is a food bank at Heron Road Community Center in Councillor Carr's office ward. There are other examples. There are also examples where that has happened in the past and has been rolled back. So at one time, Southeast Ottawa Centre was in Heron Road. Somerset West was in Dalhousie Community Center when it was a community center. Sandy Hill Community Health Center was in Sandy Hill Community Center. Most of them quickly outgrew that space. And I can tell you, prior to amalgamation, the old city of Ottawa had to look at what we called the 25% rule, because what we were finding is that once implanted into a facility, one room became 2 rooms, became 3 rooms. And so council said, we have to put parameters around that to limit it, because obviously in the same wards, we are often getting pressures for more recreation, more space for recreation. And we saw, and we are seeing currently, that when recreation space is taken up, even temporarily, there are impacts to programming and to operations. So it is possible. In some cases, it's under the belief that the city will offer the space cheaper than on the open market. I remind council that last year you approved a lease policy that generally sets market rates for our facilities, unless council waives those. And so there are those considerations in terms of what it might cost, the impact on programming, those kinds of things.
But those are existing spaces, and this is about building spaces onto our recreation facilities. Has that ever been done before? Where it's
Chair, there aren't a lot of examples where we have ceded parkland to build other types of facilities. That is generally something that has not happened to any great extent that I'm aware of. It's been fairly limited to using what at a given time is seen as surplus recreation space.
Okay, thank you. I appreciate this, because we're seeing the growing need of social services, and there's obviously a gap. And I think the province should really be doing this, but we're picking up the slack, and they're turning to us because we at least listen to these communities, and they're very much in need. So I appreciate that. Okay, I'll cede my questions to the next person. Thank you.
Thank you, Councillor Kavanagh. Councillor Brockington.
Thank you, Madam Chair. Good afternoon to you and colleagues for going the distance. Long day. Prepare you for tomorrow. I've got some questions that I'll just focus today on park and park renewal. very important in reward for Mr. Chenier, if I may. Mr. Chenier, can you talk about funding that gets allocated in the budget year after year to renew park amenities? How those lists get prioritized. I go through a number of parks, both in my ward and outside, where park amenities have well past their life cycle date in my mind. And I just want to have a better understanding how staff prioritize what I'm sure is a very long list with very limited funds.
Chair, I would love to speak with some level of authority to this, but the whole process the councillor is talking about is done as part of infrastructure services. I don't know if Karina or anyone else from infrastructure services might be available either online or to speak to it. Oh, there is Sue. Excellent. Sue will be able to speak.
Thank you, Madam Chair. We have an inventory of all of our park assets, and there are routine, regular technical assessments according to playground standards or standards we have for our own equipment. And those are prioritized based on those conditions, but with an eye also on what risk there would be attached with regard to safety as part of the greater system. When we have an asset that needs to be renewed, there is a consideration about coordination in terms of the temporary loss of that service. We wouldn't want to have a couple of parks out of service at the same time. There's consideration about things like pathway improvements and what detour routes might be necessary. So although the playground in its creation gets installed all at one time, there are often separate structures, separate elements, and as part of due diligence on our limited financial resources, we do consider having to update individual features on an existing park as a way of extending those finances.
Does the city have a deemed deficit for infrastructure renewal for parks?
Madam Chair, we have an allocation for renewal for each category, each service of our assets, parks being one of them. We aim through the asset management plans to provide a uniform level of service across all of our assets. And that long-term strategic approach with the financial investment that's planned for every year lets us mitigate risk and ensure continuity of service.
But are there amenities that came to the end of their life cycle prior to 2023 that are on a list that you just haven't been able to fund because the resources just haven't been there?
There are no assets in an unsafe condition that are not being addressed in the 2023 budget. The 2023 budget includes renewal of our highest needs, leaving the rest of the assets, let's call them that, in a uniform state, uniform condition and state of repair and risk.
Fair enough. Appreciate that. Okay, thank you. If I may, if I could go back to Mr. Chenier, the Alexander Community Center in Carlington, you did mention it, I believe in the opening remarks. I was here for the staff presentation this morning. Can you elaborate on the timelines? We've made progress. We've sort of started throughout the years. Where are we now? What does 2023 look like for the community with respect to moving this project forward?
Thank you, Chair. The expansion and renewal of the Alexander Community Center is, I believe, a $10.8 million project that we were working on. We've done consultation. We had 3 options. We've selected an option that seems to be very viable, seems to meet community needs, adds a lovely gym to the facility that I think the community will be thrilled with when we get this built. There are development charges that are coming to this project, and I believe that the value is somewhere in the $4.2 million area. There are, in this budget, there is $570 $7,000, I believe, that contributes towards this. There is also a transfer that's been agreed to, I believe, between yourself and Councillor Leeper for funding from the Westgate Shopping Center renewals that is coming to this project. That brings us somewhere in the short of by about $5 million, perhaps closer to $6 million. Councillor, you have suggested that perhaps Ward CIL is a possibility. In the detailed accounting of this, I show it at about $4.8 million short at this point. So there is a gap. We will continue to look for sources for this. We will include this pressure in next year's capital ask, and depending on the size of our envelope, we may make big progress, or we may make, like this year, an incremental step towards it. But at this point, it's primarily to try to find the missing funding. And I know that you have for several years now been talking to provincial and federal counterparts in terms of possibilities for a grant. And as those come up, we will certainly look at the opportunity if that's possible.
Thank you for that. So as far as work goes in 2023, are we in a holding pattern until we can get greater clarity on the full funding envelope for this project?
Chair, that's right. We are in a holding pattern because we could not issue a tender. We could not move to tender at this point since we don't have full funding.
Okay. If anyone has any extra loose change, please let me know. Again, Chair, Mr. Chenier, could you also provide sort of a work plan outline for the Mooney's Bay Pavilion, and again, budget pressures? Similar question to the ACC.
Yes, Chair. I am aware that in the last few weeks, both my staff and infrastructure services staff have been working on a project charter to look at the Mooney's Bay Pavilion replacement and to do some work this year. And I believe if I look at the project charter, the scope is to dig into refining what this project is. And as you know, we've done some preliminaries on this, and the expectations can be as high as complete replacement with community space to a simple replacement of a beach pavilion with some of the associated amenities. So we need to scope out the project and do a final costing, which will then allow us to move forward in terms of a budget ask and start to move towards the ability to implement this. So I think this year, and I believe you and I have talked about this, this year is when we really try to get good definition in terms of what the building would be. There is also the associated fact that the building is so low off of Riverside that we need to look at both water supply and sewage return out, and the associated pumping and whatnot infrastructure that needs to be looked at, and all that has to also be costed out.
Would this be a project that you differentiate in your mind from a ward park project that would use SIL versus a project that would qualify for citywide SIL use?
Yes, I think we can look at that, Councillor. Right now, we have, my numbers say about 2.9 million. We received 1.8 million, and there is 1.13 million in this budget. So what we don't know at this point is how much this is going to cost, what we're going to build, and we are either very close or very far, depending on the scale, scope of the project, what we are replacing and what we are adding on. And that's why it's critical that this next step of that's contained in the project charter is to scope it out so that we know exactly how much money we are chasing.
Okay, thank you. My last question, Madam Chair, and I think it has been asked, so just wave at me and I'll take it offline, but it's regarding lifeguard service at the beaches. I don't know if Councillor Menard has asked about lifeguards at pools, but given that we've had some early springs and later falls, and in my opinion, at least at Mooney's Bay Park, the number of visits during my 10 years as councillor has been, this is a very heavily visited park. And I think an argument can be made that before our traditional lifeguard season starts and ends, there's a demand for lifeguard services. Is this just not possible because of the lifeguard shortage and the need for lifeguards in our existing pools because university students have to go back around Labor Day? Or is there an active possibility, examination or re-examination, to expand this type of service at our large regional beaches and parks?
Chair, Councillor Menard has not asked the question and is focused on wading pools in most of his inquiries, and I believe we'll be seeing something there. For beaches, there are a couple of things. One is obviously the funding to add a week to beach operations is about $45,000 a week for the 4 beaches. That is one obstacle, but the more critical is that currently we open mid-June and close end of August. In mid-June, we really are stretched right now to be able to train staff in the first 2 weeks of June. And we wait for that because staff really do have to do an on-site training in the water at the beach that they're going to work at. And in May, some years, the rivers are just too high, especially the Ottawa in a flood year, and the water is very cold. We also have we struggle a bit with staffing, not just lifeguards, but most positions until the end of June, simply because often pool programs, the spring programs are finishing up and those lifeguards have not been released yet. There's still swimming lessons, there's still public swimming on the spring schedule. That all changes in July and helps a little bit. Same thing at the end of the season, to go past into Labor Day and past Labor Day. Most of our staff are gone. We tried last year with wading pools to do a Labor Day. Former Councillor Fleury had requested additional funding to do that. We simply could not get enough staff to stay to create a safe opening. So there is still a staffing challenge, which we're tackling on many fronts this year, both from the pay perspective, from active recruiting to encouraging some of our new recruits that are getting not quite ready for lifeguards, actively recruiting them into wading pool duties so that they start to work for us and get their feet wet, so to speak. So there are a lot of things happening on that site. For this year, though, we are planning to have the regular mid-June to end of August operating season for beaches.
Okay, thanks for that. Thank you, Chair, for the opportunity to ask some questions, and I'll end it there for today. Thank you.
Thank you, Councillor. Councillor Hill.
Yes, thank you very much, Madam Chair. This is a question with regards to the Veterans Task Force, and I know there's been a heck of a lot of good work that's been done over the last few years in terms of bringing some programming online from a homelessness perspective and from a healthcare perspective. My question is really one of, are we in the place that we need to be right now in terms of our relationship with the province and the federal government in terms of supporting funding from some of the programs that we have a level of ambition to engage with? Or if not, what work do you recommend that we do to get into that space? And I could give you a number of examples there, but I think you probably know them as well as I do.
Thank you, Madam Chair. And we're really quite proud of some of the work that we've been doing around veterans homelessness and the work that we've been doing in terms of the affordable housing and ensuring that we have affordable housing and moving veterans out of homelessness into housing. And some of that has been as a result of other levels of government funding to the city in the affordable housing. We do have a task force team that is supported by Suzanne Obiora's team in Community and Social Services in the Gender and Race Equity, Inclusion and Indigenous Relations group. I'm going to hand it over to Suzanne just to talk about where we are in terms of supporting the work and what we think we need to move forward.
Thank you for that, Donna, and thank you for the question, Chair. So we do have our older adult plan, which seeks to implement concrete actions to assist the city in effectively serving and responding to the needs of older adults. The plan just finished its most recent term, and staff are currently evaluating the progress achieved in the last term and consulting with members and partners in the community to provide considerations to council for future direction of how the city will address community needs as it relates to older adults. That will be informed not only through consultation with city departments, but also in consultation with the seniors round table who have been overseeing the activities and the work of the older adult plan this past term.
Suzanne, I'm sorry, I think the question from the council was just around the Veterans Task Force.
So my team oversees the seniors roundtable. So we don't have the Veterans Task Force.
Yeah. Oh, Paul. Yeah, sorry, Paul.
Thank you, Donna, and thank you, Madam Chair, for the question. Indeed, Housing Services is working closely with our shelter operators and our community partners that provide services directly to veterans to end veterans homelessness, which is our commitment as part of the 10-year plan. Beginning in November 2021, we started to fund a case manager specializing in Veterans Affairs and Veteran Services through the Ottawa Mission. And we are working with that case manager wrapped around with other agencies to focus their interventions and making sure that we can move veterans from the street or from shelters into housing with supports. And since that November 2021, there's been 14 veterans that have been housed through that program, and the program continues and it's very successful. Thank you.
Thank you, Madam Chair. I will follow up on from a provincial funding perspective with regard to concerns over medical coverage as well. So thank you.
Thank you, Councillor. So seeing that we have no further questions, what I'm going to ask is we're going to contemplate the budget roadmap first. Because we have Councillor King has a declaration. If everyone is amenable to passing it in one vote, I'll pull out that one piece that we have Councillor King's declaration on. We'll vote on that first, and then we'll go to the rest of it. Is everybody okay with that? Okay. So I'll ask. So Councillor King has stepped away from the table. So we're going to pull out item 2B, number 2, the community recreation and cultural programs, page 25. Does anybody have any further questions, or is that item carried? Okay. Councillor King is welcome to return to the table. Yeah. There you go. Very brief. Does anyone want to pull any other item out of this to vote on separately? No? Okay, so can we carry the remaining items in the roadmap as one vote? Is item carried?
Carried.
Oh. What part does the community safety and well-being plan fall under? Because I want a dissension there.
Madam Chair, my understanding, and Donna can confirm if I'm incorrect, it is the General Manager's Office, Community Safety and Wellbeing and Business Support Services Operating Resource Requirement. I think it is item 1A on the roadmap, if Eric could just scroll up.
Is that correct? Yeah. Okay. So you dissent on that item?
Correct.
Okay. And that's noted, Eric? Okay. All right. Is everything else carried? Carried. Wonderful. Thank you very much, everyone. I will, oh, we're not quite done yet. Don't sell it. We did have a motion. I don't know, Councillor Kavanaugh, if you wanted to mention that. I did speak to you in regards to that.
Yeah, I'm willing to withdraw it because it might be more appropriate at a council level.
So we won't be voting on that, and Councillor Kavanaugh will be following up on that item. So I know folks were hoping to get a bit of a break. What I will do is encourage you if you want to stand up and move around a bit, but I do know that some of our colleagues need to get to other items. So I am going. Okay, well, you're anticipating very quick conversations, but no, just. So I am actually, with the committee's indulgence, I'm going to ask that we pull up the item 9, I believe it is, other business. It was the item that we added to the agenda is physical distancing centers, because we have, I believe, 3 motions to discuss about that. And we have city staff here to answer any questions in respect to that. So is that okay with everyone that we pull that item up? Okay. Perfect. All right. So for what I will do is I will ask the councillors, I'll start with Councillor Carr, to read their motions out. But before that, I just want to make sure that we have them up on the screen.
Excellent. Thank you very much. So I will start to read. Whereas physical distancing centers began operating in May 2020 as a temporary measure to reduce the overall capacity within the single adult community shelter system and provide adequate space for users to physically distance and mitigate the spread of COVID-19. And whereas the COVID-19 pandemic has disproportionately affected low-income households for a number of reasons, including the loss of community and recreational spaces and programming as a result of physical distancing centers, PDCs, isolation centers, vaccination clinics, testing centers, and emergency supply storage being located in recreation and community centers. And whereas this council memo titled Spring COVID-19 Response to Support Single Adults Experiencing Homelessness, dated February 14th, 2023, outlines recreation facilities, community centers that will be used as physical distancing centers from now until mid-August 2023. And whereas the demand for emergency shelter services in the City of Ottawa continues to exceed the system's permanent bed capacity, and that the City of Ottawa has taken the approach that no one should be left unsheltered if they seek temporary shelter. And whereas affordable and supportive housing remains a key priority for the city, and a housing first model, which moves people from shelters or the street to permanent housing with supports, is recognized as a desired alternative to chronic homelessness. And whereas there are currently 180 units of supportive housing under development, which will be available by the end of 2024 and will serve individuals experiencing homelessness. And whereas the city continues to prioritize options that provide permanent housing for individuals experiencing homelessness. And whereas the council report titled Respite Services Sustainability Plan, approved on April 13th, 2022, directed staff to conduct a review of the single adult community shelter requirements and develop a longer-term plan to support the transitioning out of physical distancing centers and respond to the needs of those experiencing homelessness. And whereas housing services staff have been actively identifying and evaluating opportunities for permanent, medium to long-term housing and will report back to committee and council in Q2 2023. And whereas recognizing the need for physical distancing centers may be required in the future in the event there is increased demand for shelter services that exceeds current capacity and/or in response to unforeseen emergency situations within the housing and homelessness sector. Therefore, be it resolved that as part of the report to committee and council in Q2 2023 outlining options to transition out of physical distancing centers, staff be directed to 1, outline a strategic approach focused on providing individuals experiencing homelessness the supports needed to transition to permanent housing. 2, explore all alternative options to using recreation/community centers to provide temporary emergency housing as needed. 3, include measures to ensure that community programming can resume at Heron Road and Dempsey Community Centre within 1 month of the transition of residents out of the centres, and that ice time at Jim Durrell and Bernard Guillemette be reinstated for the 2023-24 skating season. 4, identify factors and considerations for choosing recreation community centers as short-term centers open to respond to emergency in the housing and homelessness sector, including applying a diversity, equity, and inclusion lens. And be it further resolved that staff be directed to regularly update council on the progress of the approved transition plan until the resumption of programming and facilities used for PDCs. And be it further resolved that the general manager of community and social services work with the city treasurer to include considerations for the 2024 budget process and develop a financial plan to execute the options.
Thank you, Councillor Carr. Councillor King, you have a motion.
Thank you, Chair. Whereas council declared a housing and homelessness emergency and crisis in January 2020, whereas physical distancing centers began operating in Ottawa in May 2020 as a temporary measure to reduce the usage within the single adult community shelter system and provide adequate space for users to physically distance and mitigate the spread of COVID-19, whereas the demand continues to exceed the temporary basis of these PDCs, whereas the council memo Spring COVID-19 response to support single adults experiencing homelessness dated February 14th, 2023 outlines recreation facilities, community centers to be used as physical distancing centers from now until mid-August 2023, whereas the intent is to ensure clients utilizing these temporary shelters be transitioned to permanent housing, whereas affordable and supportive housing is a key priority for the city and a housing first model, which focuses on moving people from shelters or the street to permanent housing with supports, whereas affordable housing stock in the city is already at an all-time low. And a recent fire in Overbrook resulted in the loss of 32 units owned by nonprofit organization Centertown Citizens Ottawa Corporation, displacing 53 people, whereas the shift of work from home and hybrid workspaces has evolved due to the COVID-19 pandemic, creating commercial buildings in the city to become vacant, whereas council has committed to pursuing the conversions of such types of office buildings in the downtown core to residential buildings, whereas the federal government Rapid Housing Initiative provides funding to facilitate the rapid construction of new housing and the acquisition of existing buildings for the purpose of rehabilitation or conversion to permanent affordable housing units, whereas everyone deserves a safe and affordable place to call home, whereas council requires data and low-level reporting to make informed decisions and understand the fluctuating citywide housing and homelessness crisis and emergency. Therefore, be it resolved that the city explore supportive housing options using the third round of Rapid Housing Initiative by working with nonprofits, community organizations, and housing providers for eligible clients housed in shelter or PDCs, and report back to Community Services Committee and Council with evidence of these efforts and final projects selected for funding. Therefore, be it further resolved, in order to keep all council members up to date on the housing and homelessness emergency and crisis, staff will continue to report annually via a progress report to council and will report biannually to committee via an information previously distributed update using an anti-racism and women and gender equity lens. Report on A, the current number of families being housed in hotels and motels, B, the number of families in family shelters, C, the number of single youth, men and women in emergency shelters, D, the cost of hotels, E, the cost of emergency sheltering, F, the number of singles and families who have moved from shelters to permanent housing through rent gear to income housing or with a housing subsidy. Thank you, Chair.
Thank you, Councillor. Conseiller Plante, tu as une motion?
Merci beaucoup. Whereas the city zoning bylaw part 5 section 134 defines a shelter as, quote, shelter means an establishment providing temporary accommodations to individuals who are in immediate need of emergency accommodation and food, may include ancillary healthcare, counseling, and social service supports, refuge, and whereas physical distancing centers and respite centers fall within that definition, and warming centers and emergency shelters that respond to natural disasters do not. Whereas in spite of this zoning bylaw, the council report entitled Respite Services Sustainability Plan approved by council on April 13, 2022, provided the general manager, community and social services with the delegated authority to quote, maintain the human needs command center as well as municipality operated respite and physical distancing centers. And whereas the council report titled Respite Services Sustainability Plan directed staff to conduct a review of the single adult community shelter requirements and develop a longer term plan to support the transitioning out of physical distancing centers and respond to the need of those experiencing homelessness by Q1 2023. Therefore, be it resolved that staff complete the report to committee and council in Q2 2023, outlining options to transition out of physical distancing centers, and be it further resolved that staff be directed to 1, expand the criteria used to identify factors and considerations for choosing recreation community centers as short-term centers open to respond to emergencies in the housing and homelessness sector to include applying a diversity, equity, and inclusion DEI lens in the future and their proximity to schools and licensed childcare centers, and to consult with those entities to understand the potential impacts. 2, provide the criteria and scoring used since 2022 to pick within city facilities to be used as physical distancing centers, and specifically the scoring for the facilities considered in 2023 before picking Heron Road. Sorry, that should say considered in 2023, such as Heron Road, Dempsey, Jim Durrell, Bernard-Gramate locations. I'll fix that. Be it further resolved that no physical distancing centers be opened or extended in city recreation or community centers post August 2023 without 90 days community notice. Be it further resolved that no recreation center that has been used since March of 2022 as a homeless shelter, respite, or emergency physical distancing center that meets the definition of a shelter in the zoning bylaw be used for a similar purpose again for a period of 5 years. And be it further resolved that the funding not spent on recreational programming in those centers and community centers due to their use as a physical distancing center, respite center in 2023, or any other use that meets the zoning definition of a shelter be reallocated for new additional programming in those centers by the end of 2023. And be it further resolved that staff develop a comprehensive and robust security plan to ensure the safety of both users of the physical distancing centers and neighboring community and schools. And that plan be presented to councillors for collaboration and consultation. Merci.
Okay, thank you, Councillor. We do have one delegation who had signed up in the instance that this would be added. We have Natalie Carrier from the Vanier BIA. So I will ask Natalie to take the floor, then we will move to questions to staff.
Thank you. I'm assuming you can hear me?
Yes, we can.
Great. Thank you, Chair Dudas, councillors, and thank you certainly for giving me the opportunity to speak to you today. Firstly, I'd like to congratulate you all on your recent elections and on leading the city through the next 4 years. There are many challenges ahead of us, but certainly it seems thus far, and definitely by today, that this council is poised to face these challenges with strength. My name is Natalie Carrier. I'm the Nathalie Carrier aussi. I'm the executive director of the ZAC Vanier BIA, and I'm here today to discuss the issue of Bernard-Gramate Arena in Vanier being used as a temporary shelter. Because some of you are new, I'd like to take this opportunity to share with you some of the unique aspects of Vanier. We proudly share that we have the highest number of Indigenous people in Ottawa, the highest number of Inuit people outside Nunavut, one of the highest percentages of newcomers, and unsurprisingly, Vanier, it proudly represents the highest number of BIPOC-owned businesses. The Vanier BIA is a very highly engaged BIA. We go above and beyond the core responsibilities to contribute positively to our community, not just to our businesses. We provide free food at all of our events. We ran a free drop-in summer camp in the summer camp in a converted parking lot where most of the kids attending are from local shelters. And we call that parking lot the Vanier Hub, which along with our partners at VCSC, we just recently won an award for it. We provide naloxone training and work very closely with the Indigenous and Inuit and French Canadians and two LGBTQ communities in our BIA to ensure that there's safe places that exist for all. We, like many other BIAs and Ecovia, are your allies. We are your eyes and your ears on the main streets and your boots on the ground. Obviously, the Vanier BIA would prefer to keep our arenas as arenas and not have it converted again into a temporary shelter. A shelter, it must be said, that does not entirely abide by the shelter policies because it's being called a respite center. I say this not to be confrontational in any way, but because I believe we all need to call a spade and work together honestly. So, There are three main points I'd like to bring to your attention today regarding this temporary shelter at Bernard-Grandmain. The first is that we hope that when you say temporary, it will indeed be temporary. We understand that this committee faces tremendous challenges and takes these decisions very seriously. We respect that you are not going into this decision lightly. We hope that you will respect the research and your own policies that point to housing, safe, supported housing, as the way to eradicate chronic homelessness. We hope that you understand that moving clients from Nicholas to Vanier does not fix this problem. It simply moves it to another neighborhood. Furthermore, the clients of these services deserve better. This brings me to my second point, that the city, and specifically this committee, can once and for all actually end the issues of chronic homelessness in the city. You have a unique opportunity here in Ottawa to finally put an end to this crisis, given that there are roughly only 600 chronically homeless people. That's still a lot of people, but it's a lot less than most cities. I urge you to listen to Katie Burkholder-Harris. It will take brave, bold, and unique decisions from you. The most vulnerable in our city deserve to be treated with dignity and kindness, and deserve from you a plan, a very solid one, to help them. This plan must especially consider the families living in hotels across the city, many of which are on Montreal Road. This plan can no longer download onto local businesses like hotels in Vanier and their front desk staff the responsibility of monitoring important and challenging social issues. This plan should respect your own policies of providing adequate and supported housing first. And third, the third point I bring to you today is that recreational facilities like the Bernard-Grandmain Arena, the only recreational facility in Vanier, are important factors not only to the community, but also to businesses in our BIA. People who play hockey in the evenings or bring their kids to skate on weekends also buy pizza from Louis Pizza, which is the best pizza in town, by the way. Users of recreational facilities also stop into restaurants and coffee shops and grocery stores and pharmacies along the way. The city has an official plan. That plan includes recreational facilities, and it speaks of 15-minute neighborhoods. I urge you to restore and invest in recreational facilities, especially in neighborhoods facing the challenges that Vanier faces, especially in neighborhoods where racialized people are disproportionately affected by the challenges of poverty, like Vanier. Many in our community don't have the luxury of driving to Orleans or Canada to access recreation. You have a responsibility to ensure these services are also provided in communities like Vanier. And finally, I leave you with this. You've heard all day about the impacts of the lack of services to communities and businesses. Concentrating social services and challenges into one area is not the solution. It doesn't help neighborhoods, and it certainly doesn't help the clients of those services. You know this. I know it. Now is the time to act on it, and we are here to be part of that solution.
Thank you so much, Nellie. It's important to hear about the need for permanent and medium-term solutions. Once again, we're in a situation where we need to find housing for people immediately, and I think that it's wonderful that you're here to provide your viewpoint on this. And I think the city does have some very strong plans to move away from temporary measures. So thank you very much for being here. I do see that we have a question for you from Conseiller Plan. So, Conseiller.
Thank you. Merci beaucoup, Nathalie, pour tes interventions. C'est toujours très pertinent, tes commentaires dans la communauté.
Thank you very much. It's always very, very relevant what you have to say. You've been working here for a long time. I know it's something that's very, very important to you. I wanted to ask you a question, however. The question is the following. What's the feedback from the community on Bernard-Grandmain? What do young people, what do parents think, especially in neighboring communities? What do they want to see happening at Bernard-Grandmain? Do you have that feedback? Well, I've really focused on businesses, but I'm someone who's linked into the community. What people are saying is very, very simple. Not enough to do in Vanier. That's clear. We have the Richelieu Center, no sports facilities. It's very, very far away. There's only one bus that goes by every hour or so, and the services are zero. The Bernard-Grandmain Arena was at the heart of Vanier and has been for a long time. The Potvin brothers came through there. My father organized hockey tournaments very often in this arena. We've just lost MacArthur Lanes as well. That's another important component of recreation facilities. The community wants more. I'll say this in English because I want everyone to understand.
Faced in this community. Trust me, we see them in Vanier. You heard all morning about Byward, but they are in Vanier. We see those challenges. We see vulnerable people that don't have access to very, very, very basic services, and those people should have them. That being so we understand that pitting sort of skating against survival is a difficult thing to do. However, I do think that this council, and specifically this committee, has a responsibility to ensure that both exist. And Vanier is somebody that, you know, is a community that gave 3 years of that arena to COVID. Yeah. We just got it back, and now it's being taken away. So is it a challenge for the community? Absolutely it is. Do we understand that people are in need? Absolutely. We see it every day in our community. So I don't envy you the decisions that you have to make, but I do think that, you know, this idea of moving everything that's in the market that's problematic to another area, which seems to be the trajectory that things are going on, is not going to be helpful. And I think Councillor Troster said it so well today. We don't need less services, we need more, and we need them to be everywhere. LGBT kids shouldn't have to travel, you know, from Fitzroy Harbor to George Street to be heard. That shouldn't be happening. So I know I'm speaking about arena, but I'm very passionate about a lot of things. Vanier is a place where we've come up with very creative solutions to a lot of the challenges, and we've worked really hard together. So yeah, it's going to be a loss. There's no doubt about it. You know, Councillor King knows it, you know it, our community knows it. We've always been, trust me, my grandmother ran the first food bank in Vanier, which was called Le Vestiaire de l'Église at Saint-Charles. My grandfather ran, you know, the men's group at l'Église Saint-Charles. I come from a long line of very, you know, philanthropic people. Vanier is a place where people help each other out, and we will hold it down if we need to. But we've been asked to hold down a lot, and there's more coming our way too. So that's a very long answer to your short question. Pardon.
No, just a quick follow-up. Is this a ringing endorsement for my motion?
You know, I'm not a counselor. You guys have that decision to make. I can simply, I'm just going to bring to you my thoughts on it from both a business and a community perspective where it's appropriate.
Thank you.
Councillor Troster, you're next.
Thank you so much, Natalie, and thanks for your kind words. And I mean, just to echo what you're saying today, we heard from a lot of people in Sandy Hill and Vanier, which is very close to my ward in Somerset. We're separated by just one street. So, and I just want to echo what you are saying to this committee, which is we need a yes and approach. I would hate to remove resources from the downtown before other services are fully engaged in other wards. And I think if we're able to offer those supports across the city, then hopefully the demand will go down in our downtown core. And at that point, we can decrease services. But I am concerned, you know, about one person was advocating for a moratorium on new services in Sandy Hill, or, you know, which is very close to where I live downtown. And I think that would be a mistake. I would like to see a yes and approach. So I really do appreciate your perspective. Yeah.
I completely agree. And I think we're actually in a situation where we need to be creative, right? We need to be creative and we need to work together. But what we know and what the research points to, and Katie Burkholder-Harris will be the first to tell you, is that siloed approaches to things and, you know, concentration of services is not the way to go. That's not how people get out of these very challenging situations. They get out when they have support, not just from services, but from their community and their neighbors. And they're not seen as people coming in and, you know, but they're truthfully supported. My best friend lives in Toronto. They live in Leslieville. She owns a very tiny $3 million home. There is a shelter a block from there, and the community works together to make sandwiches. They found ways to make it work. You know, they found ways to work together, and it actually helps. You know, these are not sort of things that can't, I mean, we live in a community together. These are symbiotic things. We shouldn't be isolating the Orleans and the Canadas of the world from the challenges faced everywhere in this community. So, and certainly not making people travel such a far distance to access the basic services they deserve. I'm just going to plug in my computer, which is about to die. Sorry, I'm back.
Councillor Pastor, you're done?
Yeah, thank you very much.
Okay, thank you. Councillor Carr.
Hi there, I'll be very quick. Natalie, thank you very much for coming out today and speaking about this. I just want to make 3 quick points. I absolutely agree that we need to increase services, and I find it really interesting. I've had 2 facilities in my ward used as physical distancing centers, basically nonstop since the start of the pandemic. And in my case, the services that have been impacted are services for youth in low-income areas. And I'll speak about that shortly. So I think we need to take a global look at all the services across all communities and what needs to happen. Secondly, I want to speak to the fact that, you know, you talked about increasing supportive housing, and that's absolutely, I think, the goal of most of us around this table today. But talking with colleagues for weeks, and it's truly after 3 years of declaring a housing and homelessness emergency, certainly we still have an issue with shelters, and we need to act on this. And third of all, I just want to acknowledge that you have acknowledged that sometimes we do have to make short-term solutions and that impact other services. And that's the difficulty that I think we found ourselves in. But thank you very much for coming out today.
Thank you, Councillor Carr. And if I may, I think, you know, I grew up in your neighborhood. I grew up right behind Canterbury High School. You know, I've skated at Canterbury. I swam at Canterbury. I was one of those kids that was, you know, just at the poverty line. I don't know what I would have done if the wading pool and the recreation programs offered in that park didn't exist when I was a kid, because my mother had to work, my father had to work. I was alone, you know, I was that typical latchkey kid. So I know your community very well, and I don't envy any of you. I can tell you we've missed Jim Durrell since it's been gone. The annual tournament for my daughter's, ringette always happened there. It doesn't happen there anymore. Summer camps for ringette happen there. Now we pay expensive facilities in other places. So again, I think it's just time for a lot of other communities to hold down their share. Heatherington is a place that needs services. These kids need them, and they need the wading pools, and they need the pools and the ice rinks. And you are so lucky to have that beautiful outdoor ice rink. It's the greatest in the city, I got to tell you. But anyways, thank you for everything you do as counselors. I certainly work very closely with the 2 counselors on my board, Councillor Plante and Councillor King. And I don't envy your decision, and I appreciate the time you're spending on it. Thank you.
Thank you very much, Natalie. So we are going to go to questions to staff, but I have a couple of questions myself that I wanted to ask. If the city does not have these centers, what will happen, and how will this impact the city's ability to serve the unhoused residents that are going to be positioned in these locations? I want to know exactly how this is going to impact those individuals if they do not have these centers accessible to them.
Thank you, Madam Chair. I think that the difficulty that the city will be in without having the recreation centers right now is we're kind of in a convergence of kind of almost like the perfect storm, where we've opened immigration and have increasing immigration coming across our borders and people coming into the city. We have a housing crisis where although we're building affordable housing and building supportive housing, there's a time lag in that delay. So what it means without having the physical locations in recreation centers, until we can find an alternate solution, is that people will not be able to be housed. And in not being housed, we run the risk of having increased encampments in our communities. And, I'm on calls frequently with my colleagues across every larger 47 municipalities across the province, all suffering, large and small, from significant encampment issues. We've been very successful in the city of Ottawa in managing our encampments because we have had a space for everybody to come in at night. If we don't have those spaces, then we don't have the ability to house people. And where we've been really challenged, and I think this is the piece that I really want to help people understand too, is it's not by choice that we're in recreation centers. It is absolutely the last resort. And we never have done this in the history, my 35 years in the city for extended period of times, ever used recreation centers as an alternate to housing. The COVID pandemic coming through that, the need for physical distancing, the vulnerability of the housing to illness, and our need to protect that really made this a last resort for us. And we did that as a very last resort. We looked at over 200 properties across the city. We looked at schools, we looked at private sector, we looked at hotels. You heard this morning from Mr. Ball, who I've been in numerous conversations. That's why we know each other over the pandemic around use of hotels. How do we use hotels? There are supports that people need during this period of time. So we're in there. Those options have not come to fruition, and they haven't come to fruition with the funding that we have available and the budget that we've had available over the last 4 years. We are anxiously and desperately want to get out of these recreation facilities. It is inhumane for the people that are in these centers. We do our best, and my incredible appreciation and gratitude to the staff, new staff that we've had to hire, train, set up processes, procedures, who are, administering naloxone every day to make them as best we can. We need a longer term solution, and we're actively looking for that longer term solution. But we need time. And that's what these facilities give us, is the ability to humanely house people, not put them on the street, and not deal with encampments. And the plan that we want to bring back, the options are buying, leasing, building, converting. Those take time, effort, and we're aggressively pursuing that. And we need the interim as an option, because there is no other option without significant, and there is no other option, and it's not even a matter of money.
Thank you very much, Donna. The other thing is, we've heard that there's been reference made to the selection of these locations as being ad hoc. Maybe this is to you, Mr. Chenier, but why were these particular locations selected? Is there a criteria that city staff put into effect when these were selected?
Madam Chair, maybe I'll start with the requirements, and then, maybe Mr. Chenier can deal with how did we match requirements. So as you can imagine, that in order to provide a temporary location, it has to house vulnerable populations that need supports. And to be able to do that quickly, efficiently, and effectively, it takes a certain type of space. So we had to have a significant amount of space in a particular location. And the team had to really consider the safety of staff, the safety of residents in that space, and the ability to supervise that space 24/7 to make sure that people were safe in this space. They had to be able to address parking, delivery, ability to have food, supplies, et cetera, to come in. So there had to be access routes, there had to be parking, there had to be entry points. The security of entry points, we needed to make sure that we're secure, both for residents, tenants, and staff. We had to make sure that there was access to the public. We had to make sure that there was transportation. And we also needed to make sure that we had the support and ability to use other services in the general location. Because as you can imagine, we staffed these centers up very quickly, which means we had to hire people who needed specific expertise, but we needed to rely on our service partners who have harm reduction supports, mental health supports, to actually be in that vicinity. And we had to follow public health guidelines around, we had to have washrooms, we had to have showers, they had to be heated facilities, they had to have cooling capability in the summer. They had to have an eating area that followed health guidelines, that allowed space and separation of space for people to eat meals because we were in the pandemic and there was a certain amount of space requirements that we actually had. And physical, just ultimately the cleaning, physical distancing and all of that. So we were already, when we're looking at access and ability to do that, we were already looking at that criteria had to be what then Dan had to look at what's available. And at various times during the pandemic, we were also dealing with, multiple competing demands for facilities, which Dan was addressing. So things like was in the motion, testing facility, isolation. We were in kind of prioritization mode of the availability of sites. So when we say in the motion that councilors asking for criteria and scoring, wasn't necessarily, it was requirements and needs and guidelines and workplace health and safety and public health and safety requirements that then we matched to what was available in facilities. And then maybe Dan can speak to the piece around how we tried to then mitigate recreation impacts as well in the facilities that we actually chose to match those requirements to the need.
Thanks, Donna. And bear in mind that at least at the beginning of this, our facilities were closed. So impact on clients and impact on budget were a lesser consideration because generally the province had shut us down. But we did, and Donna's correct, we had the requests from Community and Social Services, but also from Ottawa Public Health and the Ottawa Hospital in terms of running initially testing sites and subsequently vaccination sites and PPE storage and vaccination storage. So all of these were requirements and they all had very different technical requirements. Speaking to Donna's needs, we pretty much, there was no points list. There was essentially, we played real estate agent where we took Donna's staff around to different sites that we thought would match their requirements. And I mean, it's obvious, but arenas do not have heating. And so if you're going to use an arena either for a shelter or a vaccination clinic, you have to pick a site that has the electrical infrastructure, the HVAC infrastructure that would fit. And not all of our arenas did. So we quickly narrowed down things like technical requirements, looking at code requirements, access and egress, fire code, all of those things that would be asked of us to comply with before we could actually let somebody live there overnight and those kinds of things. And so we worked hand in hand with Donna's staff, with Dr. Etch's staff to take them around, to show them what we had, to let them work with us to cost out the modifications to the sites. And that ranged from everything from installing temporary heating and cooling, for example, in the Zamboni doors that allow access to the building. That becomes your heating plant. In terms of looking at, the showers and how we prepare those to go from a very public use to a private use. How do we modify the facilities in order to accommodate that? So that's really the process that took place. Moving into a period where we started to reopen, then of course we did look at displacement of existing clients. Where was the highest impact? What were our options for? It becomes a bit of a strategic thing that if we close this, then we can relocate groups to this, and the financial impact, which we would want to identify up front in terms of lost revenue, additional expenses. So all of those things were part of the ongoing consideration as we moved from complete closure to gradual reopening. We looked at all of those things and the ability to staff the facilities, because at one point we had no staff. They were all on furlough, and the ability to bring people back to help staff these facilities. So those are the considerations from our side that went into it.
So quite the opposite of ad hoc is basically what you've said. I just have one more question, then I'll turn it over to my colleagues. We are looking at 3 different motions in front of us. I would like staff to weigh in on each of them if they have any comment in respect to each of them, and what is trying to be achieved.
Thank you, Madam Chair. And I think that the car motion, staff are supportive of that. We support that. The King motion, we support that. The Councillor Plant motion, I support the criteria. I think that, we're happy to do that and hoping that we don't end up in these situations again. Happy to do that. The criteria, like we talked about in the scoring, and reporting back before, I mean, we've spoken to the considerations, but there isn't really a scoring and criteria other than a matching, which I think we've just spoken to. I think the pieces for me that are problematic is report that no physical distancing is going to be opened or extended in city recreation or community centers post August 2023 without 90 days community notice. And so, and I appreciate and understand the need for 90 days notice. I think where we are right now in pursuing options is, you can imagine, we're trying to buy buildings, we're trying to lease buildings, we're trying to, look at land. And we're going to be right up against the August date. We're trying aggressively to make that date, but to have 90 days would mean we'd have to have the plan done by June. And I know right now that would be extremely difficult for us to be able to feasibly make that 90-day target. And I think the other piece that I think is problematic for us, or for council, I guess, is that no recreation center gets used for these purposes again for 5 years. And, we've never done that. And I'd love to be able to say, yeah, it makes sense. We've never done that before in the history for any prolonged period of time. But I think there's so many factors that you don't know right now as a council around immigration, around homelessness, around the financial and economic situation. I really do believe that is handcuffing staff in terms of options that might be available, increasing costs. And I think that we understand the intent, and I think it is a last resort. We recognize that and appreciate. We see the value of recreation services. We don't want to do that. So I think for me, it's about restricting council in the 5-year period, because we don't know the circumstances that are coming upon us. And I think we may end up in another potentially planned crisis. The funding Dan can speak to, and the safety plan, absolutely. We have done this numerous times. And I want to thank Councillor Plant. I want to thank Councillor Carr. I want to thank you, Councillor King. I want to thank Councillor Leeper. We have been through this numerous times as we've walked around and traveled around the city, housing people temporarily. We've done everything we can around safety and security, direct communication, issue and crisis management, working with our partners. We will continue to do that in these centers, because we totally recognize the impact to communities. And what we're hearing today in communities, I understand that. We want to mitigate that, and we're committed to doing that. So absolutely the last, to do safety plans and do everything we can to mitigate that. We're totally in support of that component of the motion. So it's really the other two pieces that I struggle with in my advice, providing that to council on what that does to limit your ability in future situations.
Thank you. Our next question is from Councillor Troster.
Thank you so much, Chair, and thank you so much to staff. Yeah, I just wanted to clarify a couple of things, because Councillor Carr was mentioning that there were not significant security concerns near the physical distancing center in terms of concerns to the community in general. I'm just wondering if you could speak to that issue about whether there has been major disturbances in the neighborhoods where they have taken place, because I personally have not heard of them, but they're not my words. That's my first question. My second question is, so my understanding with these physical distancing centers is, unlike the Mission or Shepherds of Good Hope, where people sleep there for the night and then they don't stay there all day, are people allowed to stay as long as they want in these facilities if they want to spend time indoors during the day?
Thank you, Madam Chair. So in terms of the facility, absolutely, they stay there. And what we have really done in these centers, and we have had real success at the jail hostel, at Dempsey, at Jim Durrell, in terms of bringing all of our services in. So we bring in our housing case management, we bring in our social assistance workers, and we bring those resources in and we intensively case management to help people get referrals to supports and harm reduction, et cetera. So they really have intensified supports in these centers. And we try, when we work with the rest of the entire sector, is to make sure that who's coming to these particular facilities, it meets their needs. So typically, well, in all of them, we haven't had harm reduction in those centers, or haven't supported those because of the staff and the location and the temporary nature of that. So we've really tried to make sure that the clients that we have there, the people coming to live, we can match the supports and have success. In terms of security issues, you know, I think that it really has been dependent and it's been up and down. I would be remiss if I said we didn't have issues, but what I know that we have actually had is very quick response. So we have staff on site, we have emergency response, we have partnerships with the neighborhood response teams, we have surveillance and police, we have security parked in the parking lot, we have extra patrols around the particular area. But they're individuals living in crisis, and sometimes there has been crisis situations where people have had to intervene, and we've had to intervene quickly. We've had really good, in some areas, we've had really good support with the community too, in terms of the community identifying issues for us proactively so that we can get on those issues in particular communities. But in some centers, we've had absolutely no issues whatsoever, and people come and go, and they live in these temporary situations, and they move through those temporary situations. And I think what I really want to stress is the individuals who are living in these temporary situations got here by no fault of their own, and they need support. And not everybody in these centers have drug addictions or mental health. Some have physical health conditions. They're very, very difficult in their personal situations in their life that they're actually experiencing. And I think what we try to do, the security piece is a very small piece. And I know for communities, that's highly escalated because it's new. Not everybody is exposed to people who have been marginalized or disenfranchised in life. And that's difficult for communities. We do every effort to educate communities and help them de-escalate, help them understand who these people are, humanize people who are in these centers for no fault of their own. And we've had tremendous communication that we've shared. And I want to tell a story. We had a story, and I think this tells of a woman who came to our center, and her son was found through this physical distancing center. He had had a mental health issue out west. He was schizophrenic. He had left out west. He had been gone for 6 years. The staff identified who he was. They figured out who he was. They worked with him, and they sent him back home to his family after 6 years of not being connected. And those are the types of stories that we hear every day. So I think, I wanted to take the opportunity to just put some context to, these are human beings. We want to do the best that we can for them. It's temporary. We don't want it temporary. And we take care of the community. We're totally committed to make sure the community is taken care of because we understand it is difficult, but we also prioritize the people that are in the home and the staff who are in new situations, in temporary situations. Sometimes, safety risks are in those situations, to make sure that they're well supported as well. And it's a tough balance of all three, but we try to do the best that we can.
Thank you so much for that perspective. Councillor Plant, I understand where your motion is coming from, and I heard very clearly from your community. I'm very uncomfortable with some of the framing around security and around a potential 5-year ban. We heard from a lot of residents, but we didn't hear from many people who have spent time in these emergency shelters, because the reality is the people who can come to these meetings have a certain amount of privilege, time, ability to speak. It happens in my community too. I really think I have sympathy, but I find it enormously problematic when people who are experiencing homelessness are framed as a security risk and as a problem. Similar in the same way that safe consumption sites are designed to stop people from dying of drug overdoses, overflow shelters are designed to prevent people from dying of exposure on the street. And I think we need to keep our eye on who the client really is here, who the neighbors are that these services help. I strongly believe that everyone in this committee is committed to a housing first model that we want to move away from this. But I think that placing undue control on staff's ability to be flexible during true emergencies it could lead to really catastrophic results. So, it sounds stark when I said, do you want to find needles or do you want to find bodies? Similarly, do you want a physical distancing shelter in your neighborhood or do you want encampments? Because it really is one or the other. And so I have tons of respect for the community in Sandy Hill and Vanier. We live very close, Councillor Plant, we're neighbors. But I can support Councillor Carr's motion and Councillor King's motion. I can't support the third one for that reason. Thank you.
Thank you, Councillor. Conseiller Plant.
Putting my hand down. Okay. Yeah, thank you very much. I just wanted to make a couple clarifying points to the comments that you made, Donna. So when you talk about the immigration aspect and the refugee aspect, I think it's very important that we clarify. So, for example, when Ukrainian refugees come, this is a dossier I know very, very well. They're generally already supported. They've been matched up with a family. They have a place to stay. They're not using sort of city resources when they come here. The refugees that have been coming through Roxham Road, they're taken care of by Immigration Canada. Their hotels are paid by Immigration Canada. Eventually, maybe in a couple months, you could just maybe see them ending up in a shelter, but their supports are provided at a different level of government. They're not sort of using city resources when they arrive here. That's a whole different category of arrival, financial supports, et cetera. So I absolutely agree. We need to help new Canadians. They generally have support already when they arrive, and they're supported by a different level of government. You would agree with this, right? Just yes or no is fine.
Thank you, Madam Chair. It's not really a yes or no answer, because I think what is the complicating factor is, and if we take the Ukrainian situation for one, is people do come in and they are matched, but there are deteriorations. And what we are experiencing now is deteriorations of those relationships and people entering into systems and needing supports. And the same with so there's two aspects, I think, of the refugee and new immigrant situation to be aware of. When they are transported to the city and when they are coming into Ottawa as new immigrants and refugees supported by IRCC. IRCC fills hotels that they purchase in the city of Ottawa. Many of those hotels are the same hotels that we would use to have availability. So it does have an impact on availability of alternate places to actually house people. And the other thing that we're actually seeing, and we're in conversations with the province and IRCC right now, is what we're seeing is people leave the hotels that are supported by IRCC. So they leave and they migrate and they also come into our system. And we are seeing significant strain that we're having to support on settlement agencies for supports. We're seeing strain on our community agencies that we fund around medical certificates and medical supports. So we are seeing those strains on our community as well. And when we're looking at immigration and we're looking at people coming into this city because of the border situation, we are seeing in other cities where they have to, specific hotel rooms that the city has actually supported as well. So while IRCC and immigration and settlement has traditionally been its own bucket, we're seeing now that they're merging more and more together in terms of needing the supports of the city.
Okay, so moving on now to the encampments, and I'll just sort of give a brief outline of that ruling. So there was a ruling in Waterloo recently where the judge ruled that people can stay in encampments where the municipality doesn't have shelter space in the context of, where they can bring their spouse, they can bring their dog. The judge ruled that, single gender, shelters should accommodate for whatever your life situation is. If you're someone who do drugs, the shelters need to accommodate for that. And if the shelter space is not available, then an encampment is where you can go to sort of not be discriminated against for whatever your life situation is. So it just is interesting to me that the shelter that's going at Bernard-Gramait is a male-only shelter. By definition, that does not meet the test under Waterloo. So if someone wants to come into a shelter and you're saying at Bernard-Gramait, well, this is men's only, then that means it doesn't meet the test under Waterloo. It just means that it's a single gender shelter, and that's where someone can go only if they are male. Just want to keep going, sorry. I do want to touch upon the point about the no harm reduction on site. So I don't think it's a secret that the people at the jail hostel, a lot of them use drugs. They're using, opioids, they're using Schedule I narcotics. Where are they supposed to go to use and consume the drugs if they can't use them inside the shelter, which again doesn't meet the test in Waterloo? Like, they're going to have to go into the community if they don't have some sort of safe consumption site, if they don't have a needle exchange. And that is what's concerning for the community. There is a school right next door. It's called Horizon Jeunesse. It's a French Catholic school. There's also a school a little bit behind it. It's called Assumption. That's where I did one of my budget consultations. So I see what you're saying, Councillor Troster, about not stigmatizing people who use drugs. And I don't think I've ever done that throughout these proceedings. And to be fair to people in my community, I don't overwhelmingly think they did so either. I think they're expressing real concerns around finding syringes, seeing people being overdosed, and there's not enough support, and there will be none at this site for those kinds of situations. And I'm a little concerned that out of everything we've heard today, that's not part of this discussion, is saying, well, okay, community, like these securities that we've put in place, not only do they not meet the test in a very recent legal case that came out and is affecting every municipality across the province, now you're saying, well, and we won't be able to provide those supports on site, so people will have to go into the community to consume and to buy, et cetera, et cetera. And that's very concerning for my residents. And I take those concerns very seriously because that's something we live with every single day in all other parts of my ward, as you heard throughout the day. Now, I just wanted Dan very quickly to touch upon the 5 years. You and I had a conversation about this earlier today. Now, my understanding is there are about approximately 60 facilities that meet sort of the criteria that you discussed earlier. They have showers, they have kitchenettes, they have parking, they have entryway, they have there's about more or less, correct me if I'm wrong, about 60 facilities across the city that would meet that criteria. So if we do some sort of DEI lens and we decide to go on some sort of rotational basis, that means it would take how many years? It would take about 30 years for us to sort of go through the line of facilities. Is that more or less what our discussion was this morning? I'll let you sort of unpack that.
Chair, yes, there are about between 60 and 80 facilities that would be of a size. So we're looking at either a full-size community center with change rooms and showers, or arenas, or community halls that would have those kinds of amenities. That doesn't mean that all 60 or 80, however many there are, would meet all of the other requirements that we talked about. But if you lump them all in and then did the division by 5, then yes, that would give you that
would give us about 30 years to cycle through. So I'm hoping in 30 years we can find a solution to housing and homelessness. I really hope that this is not something we're planning on having a 30-year outlook on. I'm hoping it's something that's really sooner. And so the ban, it's not even a ban. It's the idea that if we have facilities, we can cycle through them. Other communities will have an opportunity to use them. We can look at places that are more transit friendly. There is hardly any transit on MacArthur Road. So if anybody needs it, good luck with that. You're going to have to go to Montreal Road, and good luck with that on Montreal Road. I'm looking at Wilson because I know you, not just saying the transit on Montreal Road is a bit of a challenge. So I'm not really sure the comments that are being directed towards my community right now underscore the stress level that we've been dealing with over the last couple of years. And I would really like to see, we talk about spreading out services. We talk about it's coming, the services are coming in a couple of years, we will have X, Y, and Z. Well, the time is now, the vote is now, and I would appreciate if there could be some sort of concrete measure that we show the community that we are taking concrete steps to spread out the services as of today. And at an end in August, the community can have their rink back and the hockey can start. And lastly, sorry, I just wanted to talk about the 90 days. That actually wasn't a number that I came up with when I spoke to community members, and for context, I had another community center that was used for 2 years as a shelter. It was called Routier in Lower Town, and then Bernard-Gramé was also used for 2 years. The hockey was brought back this year, and now it's being used again. My understanding, I'm not a hockey organizer, but like when you pull rec services from a facility, it takes about that much time to find a new facility, redo scheduling, be able to negotiate with other neighboring community centers, who has ice time, when is this game going to be played? Again, I'm not an expert, but brownies, any other activities, that's what it takes more or less to be able to redo schedules and look at new facilities. So that's why I put that out there. I'm happy if it makes, if you think it would be easier, we can maybe have a conversation and we could pull out the 5-year piece and pull out the 90-day piece. I'm not sure if Ariel, that would be easier for you to sort of digest, and we can maybe look at those more in a different motion in the future. But it's very important to me that my community have some good news today.
Yeah, no, I understand.
I'm mute there too. You have to shut off your Zoom.
Okay, now here we go. Thank you. And I understand where you're coming from. And if staff is comfortable with the motion, pulling out those two pieces, I'm comfortable with that kind of assurance. I understand the incredibly tough position that you're in. And again, our communities are adjacent to each other. So a lot of the challenges that we deal with are similar. I just think, I have very similar conversations around the same consumption site at Somerset West Community Health Center in my own neighborhood. I just think we need to keep the eye on the prize of who this community, who this committee and staff are seeking to serve. And I understand we also need to ensure that the rest of the community is served. But, and I hate the fact that we know this is a Band-Aid solution, but if we remove it, or if we remove the opportunity to enact it in emergency situations, the alternative is much, much worse. And the spillover impact on the community is much worse. So, but
I do think it's important because we do have adjacent communities with very similar challenges that we are on the same page on a lot of these issues because, we are stronger. We're stronger together.
No, for sure. And I'm not suggesting that any of your rhetoric was anti-drug user, anti-homeless. I apologize for this crosstalk, but I do think the tone was sort of getting there with some of the submissions. And I just think we have to be really, really wary of that kind of rhetoric.
So I'm just going to jump in, and I know you have a little, but I'm just going to jump in. We are looking at a motion in front of us. We're not thinking about the delegations from the budget. I'm going to, once again, separating the conversations at the moment. We're looking at what is in front of us. If the member chose to withdraw the motion, revise it, or bring it as a direction to staff has been quite clear that they would be willing to take the criteria, the scoring, those pieces. I know I have grave concerns with elements of this, and I'm happy to speak to that in a moment. But I think that once again, this is not the place. There has been a lot of lead up to this. I know there's been many iterations of this motion. So now is not the place to tease it all out between each other. So if the member wants to, while the discussion is happening, change it and then represent it, that's fine. But I'm not thinking that we're going to brainstorm here and come up with another version of this motion. So I'm gonna leave it at that. Councillor Plante, you still have a moment or so more. I mean, feel free if you wanted to. And I think staff wanted to comment in response to, you had brought up a lot of points. So I think they wanted to mention something in that.
Just with regards, Madam Chair, with regards to encampments, so what I think it speaks to what we do in the entire sector. And we have coordinated supports for people who are homeless. And we look at where is the best place, because there's a variety of different types of shelters that have different services and different supports, depending on the level of acuity of the individual, but also the individual's preference as well. So we do try to make sure if it's, women and spaces, it's particularly women that are looking for a space, we make sure that we can also move people around. So in any particular situation, we have a house for somebody. And we make room should somebody have a need for safe consumption, then, and there might not be a bed at the jail hostel, we'll move other people to make sure that that need can actually get met. At the jail hostel, we have not had, and maybe a better way to say it is, we've not had safe consumption services on that site. People have not, we have not been supervising the consumption, and the intent is not to do that in BG. The staff that supervise that, and the staff that then support around that need specific skills and training, and so we keep that within the existing shelter situation. I think what often, not necessarily everybody who are in these temporary places have drug problems or drug use or consumption, supervised consumption needs. There's often a thought around that these particular sites will be familiar to sites where there is safe consumption associated with the site. And I think what is important perspective is those safe consumption sites are limited across the city. So they are servicing many other people. And I think it gets to the point that people are saying around the need for more safe consumption sites. But I guess what I'm trying to say is that in these centers, we will make sure that the people who are there do not need safe consumption, supervised consumption on those sites. We will make sure that the population that is actually coming to that has the level of acuity that the staff can actually support. And it's not to say that they won't have, necessarily, they won't be using drugs like anybody else could potentially in our community be using drugs, but we would be making sure that things like needles, all of that, that comes with the safe consumption sites that have been problematic in the market, we make sure that we manage that around the site. The paraphernalia, the needs, all of that with our center and our support, but we're not drawing people to these as safe consumption sites. That's my point.
Right, but you can't discriminate between who uses the site and who doesn't. It's quite possible that someone who's accessing Grand Maître or any of the other sites is a drug user and will be using in that location, is what I'm trying to get at, because that's what the entirety of the Waterloo decision says, is you cannot discriminate against people for where they are housed. And what my community is concerned about, and what I'm not really hearing a response to, is that where are people going to use and consume in and around this site? And that's still a huge question mark for me. Thank you.
Vice Chair Bradley.
Thank you so much. And thank you, Chair, for allowing this to be on the agenda today. I think it's an important discussion that we're having. I empathize with my colleagues, Councillor King and Councillor Carr and Councillor Plant, for having the communities that are most impacted. Jim Durrell is right adjacent to my ward, so certainly we felt that pinch point as well. I wanted to offer a couple comments and an observation. And I also want to thank staff because, Donna, it's very clear today based on the conversation we're having that this has been both operationally challenging, but emotionally challenging too. We're dealing with people, and I'd be remiss if I didn't point out that today we're deciding between housing people and recreation programs in vulnerable neighborhoods, and that shouldn't be a decision that we have to make as a council and as a committee, and that's where we are. And while it's the first time that we've had to do this, it's not entirely surprising. We declared a housing crisis in 2020, and all levels of government have been slow to make real investments to house people, and so that's where we are today. So it's not surprising, and it's frustrating, and so the delegate had said that she doesn't envy any of the decisions that we have to make, and it's really hard. And I do share some of the concerns expressed by the chair and Councillor Trosser and staff around limiting the use of facilities, and I appreciate what Councillor Plant is saying, is that we have a lot of facilities around our city, and so it's difficult that some communities bear the brunt of they have the greatest need, and so they end up being the facilities that we use. So it's difficult. So that's my observation on this, is that's the conversation we're having today, is Do we want to offer recreation in vulnerable neighborhoods, or do we want to house people? And every budget cycle in the last number of years, we set a tax target and we say that we can continue to deliver the services within that tax target. But what it means is that we're not making investments that we need. And so, I mean, I've always taken issue with that and how budget directions work, but that's a conversation for another day. So just one last comment, I guess, is what I haven't really heard today is what's our exit strategy? How do we move out of this? What is the investments that needed? How do we, so that we're not in a position, again, when the next crisis comes, that our only option is to use recreation facilities. So maybe you have an answer to that. I don't expect you to have all the answers, but I just wanted to say that.
Thank you, Madam Chair. And we're grateful for the RHI funding, because I think the RHI funding is one vehicle to help us get out, to look at purchasing and building supportive housing and trying to do that as quickly as possible. So we are right now investigating on numerous sites. We did an RFI for supportive housing with projects that are ready to go, and that's one route out. We have 82 units of supportive housing that have come, that we've been working on, that are coming online this year. That's another out. And as I said, we have been building supportive housing, and there are supportive housing in communities across the city, and that is a big way out. The interim piece, which is the, what do we do in the interim, alternate to a rec center? We're looking at a number of options right now. We're with our real estate, either lease options of particular facilities, purchase. We have a number that we're negotiating, looking at trying to put in place between now and that period of time. And we're hopeful on that. We're negotiating right now, but it is a process of negotiation, purchase, lease, et cetera. And so I can't tell the details right now, but that is our option out. And as last resort, the other option we would put on the table for council's potential consideration is, if we don't have that and the option is not rec center, is some kind of temporary structure someplace that would serve as an intermediary.
Well, I'm glad to hear that there are some plans in the work, and I hope that in the 2024 budget or budgets beyond, if there's an ask that's needed so that we're not making the choice between recreation programs in vulnerable neighborhoods and housing people, that will be brought to council's attention for consideration. And I just also wanted to say thank you, Donna, for your 35 years of service and being your last budget meeting. Thank you for all your work that you've done for the city. It's been a pleasure for me for working with you in the last decade. So thank you so much.
Thank you, Vice Chair. Councillor Brown.
Thank you very much, Chair. And Councillor Bradley stole my thunder. I was going to ask what the exit strategy was, so I guess I don't need to ask that now. I would like to thank Councillor Carr and Councillor Plant for bringing these motions forward. Clearly, these motions stem from their community's sense of desperation and a desire to move forward. And I think that was very clear from what we heard in the delegations today and the comments made by our council colleagues. I guess my question to staff, in terms of alternate sites that are appropriate, are there any close to the downtown core that could be accessible but aren't actually in the downtown core? So the one comment that we all heard today was that centralization of vulnerable people is draining the communities and the resources in those areas. So is there something immediately available just outside the downtown core that could be brought into service?
Sorry, Madam Chair, just for clarification, do you mean on a temporary basis?
Yes, please, on a temporary basis.
So maybe I'd ask Dan that question.
Chair, of course, there are other community centers, arenas that could be reviewed for relocation. That would entail, since we are mid-season in programming, significant disruption to programming. But there are, probably dozens of other facilities that could be looked at if it was a direction to find another facility that would suit the need. We would again tour them with Donna's staff and review how they might fit the bill. The longer the horizon in order to make a shift, the better in terms of providing an orderly phase out and return, both in terms of facility programming, but staffing implications and all those other things we'd need to look at.
Okay, well, that's helpful, and certainly I respect that response. I would say, based on the discussion that you're hearing from my council colleagues, it likely would be a good idea to look at a few alternative sites, just so we have those as comparison. But I'll leave it there. Thank you very much, Madam Chair.
Thank you, Councillor. Councillor Kavanaugh.
Sorry. Thank you. Thank you, Chair. Well, we've had a very big discussion on this, and I get the back and forth. I mean, I was talking earlier during the budget discussions about how a community is looking for social services space in our recreation. How ironic is that? And they're the ones that are calling for it because they lack space themselves. This is a community house. So overall, we have a major problem with space shortage for the services that are needed right now. There's no doubt about it. I just want to get a clarification. Councillor Plante was talking about removing sections, and I wanted to know if Donna, if you're supportive if those problematic sections were removed. Thank you.
Through Madam Chair, yes, if they were changed as per my conversation or as my comment, yes, I would be supportive.
Okay, thank you. I guess that's up to Councillor Plante, but I appreciate it, and I realize the struggle this is causing. I mean, my own Belltown Dome was not was used for storing things. I mean, of all things, and in fact, I had to really push to ask to get those things removed. This was supplies for the pandemic, and lo and behold, it has happened, and it's back to being a rink, but not the same. But it's just the pressures of trying to find space. Thank you.
Thank you very much. I was actually I was going to turn it over to wrap up. So Conseiller Plante, if you wanted to do wrap up, and then I was going to offer it to Councillor King and to Councillor Carr as well too.
My sound is off. Okay, I'm getting this. How does that work then to take out those two pieces? Would we just sort of strike them out? I'm not really sure. That's I guess a question I'm asking. And then we would vote on it minus those two pieces.
The clerk's office, just to make sure it's on the other.
The member would need to clarify which of the resolutions in the motion, and with the will of the committee, she could withdraw those portions of the resolution and we could put the revised one back up on the screen.
So we would be removing on page 2 where it says be it further resolved, and at the end 90 days community notice, and then further down the last one where it says be it further resolved. Oh no, sorry. And then the one right after it where it says be it further resolved, and then 5 years.
Madam Chair, can I have a point of clarification too? Maybe it's to the councillor. And the criteria and the scoring, I guess I'm wondering, we've talked about that today too, number 2.
Well, my understanding was there was like this was to be put, like I understand that we've talked about it, but we want to see in writing what the criteria was, how this was decided, and then it can be applied to future decisions along with the DEI lens.
Okay, perfect. Thank you.
Thank you, Chair. And I really want to thank all the councillors around the table who've submitted motions concerning this issue. We know and we all agree that we need to move towards permanency in terms of a solution, that we have to move from transitional housing to permanent housing. And I think that the sentiment behind all the motions that were introduced today were really in that spirit. You know, I was at the council table in the last term concerning and looking at the declaration of the housing and homelessness emergency in the city. In fact, I seconded the motion, and I worked with the mover to talk directly with other councillors and the mayor. And we know that this is the most important challenge really facing the city. We see people in encampments. We've seen an increase exponentially. I've seen that increase exponentially in my ward, and I've been talking with staff on a regular basis about ways to mitigate it. I think that we have motions before us, and I really would like to thank Councillor Carr for a motion that really takes a direction that looks at midterm and long-term solutions, so that at the end of the day, staff has a certain level of direction from this committee and council to ensure that we are moving towards permanent closure of these centers, of these physical distancing centers, and moving towards real solutions. That was the other reason why, in terms of my motion, I wanted to look at the rapid housing initiative, which I know the city has been working on, city staff has been working on with our federal government partners directly on to create opportunities to permanently house. And so I was concerned so much so that I was able to convene a meeting with a federal MP and staff to have a deeper conversation on where the programming can be improved, where criteria can be improved, so that we would move towards solutions. I think, and I'm really pleased that Councillor Plante is willing to examine and re-examine her motion. Because the reality is, when I was going door to door, talking to councillors, talking to the mayor in the last term, we were talking about an emergency. And there was a great debate around the floor, if you might remember. Is this an emergency? Is it not? If it's an emergency, which we declared, then we can't always be as prescriptive in terms of some of the criteria that we lay out, especially if that criteria has to come back to council, because that creates delay and challenges in an emergency. So while I understand the sentiment, I'm appreciative of Councillor Plante reconsidering those elements of that motion, just to ensure that we aren't too prescriptive in terms of our criteria in the face of a major emergency that's confronting the city. What I do agree with is a continuous dialogue on those elements that you're concerned about, because I'm concerned about them too. I hear those concerns from my community members as well. But I think that those elements need to be fleshed out and worked out with staff. So I do appreciate a lot of the hard work that has been undertaken over the last couple of weeks with all my colleagues. And I appreciate also the patience and the frustration, frankly, of the community, which I share and which I think we all share. At the end of the day, what we want to see is this transitional housing, temporary scenarios that people face, unsheltered residents, and ensure that at the end of the day, they have a home. Because I think that that's the most decent moral thing that we can do as a city, is to ensure that the people in it are safe and that they have safe homes. So I appreciate the work of everybody around this table. Thank you, Chair.
Thank you, Councillor King. Councillor Carr?
Hi, thanks very much. And I'm going to admit that I'm not going to be an eloquent speaker right now. I don't know if I'm tired from Police Services Board last night, from this meeting today, or apparently there's a big meeting tomorrow as well. So I I made myself some opening remarks, but I'm going to try to flip them into closing remarks, and I apologize. So I just want to say, first of all, thank you to my colleagues this morning for allowing the motion to go forward today. I realize on a very long meeting to vote to suspend proceedings to allow this item to be heard meant a lot to me. I want to thank the staff, Donna and Dan, and all their staff who've answered questions from me nonstop practically since the day that I was sworn in. I asked for this to be accelerated because there's a deliverable for staff attached to it in the second quarter. But I also think it should be accelerated given the urgency of the issue for us. And I think it's very timely given the flavor of discussions today. I mean, we heard today from many residents concerned by the state of social services in the city. They're worried about lack of social supports, whether it's food security, management of addictions, shelter, lack of programming facilities. We heard concerns from the rural area about services. We heard from the downtown core. You know, the reality is that there's many residents all over the city who've been impacted by poverty, who have been unhoused, who don't have food security, who don't have adequate programming. They're not the ones here to delegate for themselves, as Councillor Troster said. They don't have the resources nor the time to advocate. It's quite likely many of them don't have a computer to join virtually, nor the means to come to City Hall. The reality is we are in a housing and affordability crisis, and we're also in the middle of a global humanitarian crisis. We've got that steady stream of asylum seekers. This is more than a housing and homelessness emergency. This is a full-blown crisis. You know, in my community, 3 years at the onset of the COVID-19 pandemic, when the city took that first step of temporarily converting those recreation centers to physical distancing centers, the impact has been, just for example, Dempsey Community Center. It's one of my community centers. It's located between the Ottawa Community Housing Community of Russell Heights and the Ottawa Community Housing Seniors Building. After 3 years, what the impact has been is that Christie Lake Kids, which is a charity that operated a dozen youth programs for underprivileged youth pre-pandemic, as well as providing food through their programming for the neighborhood's kids, now doesn't operate any programming in my community. And approximately 20% of the kids that participated pre-pandemic are currently bused or overbooked for 1 or 2 programs a week. So that just speaks to, the needs for different programmings in the community. I think we all know that Heron Road Community Center is right next to Heron Gate. I'm sure you all know about that community. It made international headlines for what happened there a few years ago. It's got the second lowest neighborhood equity index in the city. So I'm not here to say, no, I don't want any more shelters in my neighborhood. What I'm here to say is that we need to start making decisions about how we better serve everyone. And, I can bemoan the loss of programming in the city, but I can also celebrate the fact that I was elected along with a whole bunch of wonderful people around the table. And I know when I heard Mayor Sutcliffe speak on the day that I was sworn in, I know that I would come to the right place and made the right decision for myself. We're going to have some really tough decisions over the next 3.5 years of our term, or 3 3/4 year of our term. I know that we're moving in the right direction. I know that we're going to get these folks properly housed. I know that we're going to have staff that are going to make the right decisions about using that rapid housing initiative funding. And I'm really looking forward to having these folks supportive with the supports that they need and getting our youth more programming. And we're the decision makers around the table. And I just want to say thank you to you all.
Thank you, Councillor Carr. Monsieur Plante, I believe you had an updated version, or I think Eric has it. No, I didn't have it in my, I don't, oh, it was on.
If it clarifies, we made the revisions as discussed in the meeting, and we'll screen share it now. It's also been sent by email and saved to SharePoint for reference by councillors.
So just looking at the updated version, and I'm back online, so now I can see what's going on in the world here. So it looks like it removed those 2 pieces. Councillor Plante, do you want to just go through what this has changed here so we all understand what's before us?
Well, my understanding was Donna was not on board and did not recommend the 90-day notification to the affected communities, and she was not on board with having a limitation of 5 years on certain certain sites, and so they've been removed to accommodate the preferences that have been indicated.
So Eric, could you just move that up a bit on the screen so we can all see what's in front of us? That's fine. Okay. I'm I'm going to ask colleagues to give them a moment to read this through. What we'll do is we'll have Councillor Carr's motion because it was read in first. We'll vote on that. Then we'll go to Councillor King's, then we'll go to Councillor Plant. And that way we can just make sure everybody reads this and knows what they're voting on. So is there anything further in regards to Councillor Carr's? Can we carry this motion?
Carried.
And on Councillor King's motion, can we carry that motion?
Carried.
And everyone has had an opportunity to read through Councillor Plant's motion? Does anybody have any other questions on this motion? Okay, can we carry this motion as amended? Carried? Carried. Wonderful. Thank you very much, everyone. And I fully recognize we have a couple of more items to go, so don't leave yet. Just quick, like just checking the, yes, and I know, absolutely. We'll go through the rest of it, but I just wanted to thank everybody because I know that this was a matter of timeliness. It was important for our colleagues to bring these motions forward and for us to discuss this. So I do want to thank you for allowing this to be added to the agenda. So we don't have much more to do. I do want to make sure we're doing this. I think now we're at item 6, which is in-camera items. We have nothing of that nature. Item 7, notices of motion. Did anyone have a notice of motion?
Oh, yes, I did. Right. It was on the bottom of the one.
Was that the inquiry or the notice of motion?
Oh, yeah. So this is obviously for next community services meeting. I had discussed this last night at Police Services Board. And you heard a bit about it today about the use of private security in the Byward market. And this is a bit of a black hole. We don't know what kind of training they get. We don't know, are they keeping statistics that are in line with the statistics that public health and that community services are keeping. So be it resolved that staff make an inventory of the private security used in and around our shelters, be it further resolved that staff work with Office of Ward 12, that's me, to see what training and supports are provided to the private security companies that they can better understand the challenges facing vulnerable people accessing shelters.
Okay, so that will come up at the next committee meeting.
Thank you.
We'll now on to number 8, Councillor Plant, that is inquiries, and I believe you have an inquiry.
As you know, we discussed the Waterloo ruling, and I believe Maître Huxley is here, or would it be you?
I am aware the inquiry is coming forward, Madam
Are
Chair.
you Stuart Huxley?
No, I'm Tim Mark.
So the Ontario Court of Justice ruling, court file CV 22717 in Regional Municipality of Waterloo versus Persons Unknown, dated January 27th, stated the following: I declare pursuant to Section 51 of the Constitution Act, bylaw violates Section 7 of the Charter in that it deprives homeless residents of the encampment of life, liberty, and security of the person in a manner not accordance with the principles of fundamental justice and is not saved by Section 1 of the Charter. I declare the bylaw is inoperative insofar and only insofar as it applies to prevents the residents of the encampment from living on and erecting temporary shelters without a permit on the property and when the number of homeless persons exceeds the number of available accessible shelter beds in the region. Finally, I order that the region may apply and terminate my declaration upon it being in a position to satisfy this court that the bylaw no longer violates Section 7 of the encampment residence. Scroll down. Can legal services provide an opinion analysis on the legal implications that this ruling may have for city bylaws, policies, and enforcement practices surrounding issues addressing homelessness, shelters, and encampments in the city, clearing encampments in light of this decision, and how the City of Ottawa will accommodate this decision? Merci.
Thank you very much, Councillor. The only item left is adjournment. Our next meeting is March 28th, 2023. And I do want to just say one more thank you to Donna Gray, being that this is your last budget. And it was a marathon meeting, but thank you again for everything you have done for our city and for the people in our community. Absolutely greatly appreciate it. So we are adjourned.